Hi everyone and very good afternoon guys. I hope I'm audible and visible to all of you, and welcome to the second part of Microbiology LRR and also the last from my side in the LRR series of Path and Micro. Of course the other subjects continue, and we've got a lot to do and finish off today. So of course we have very little time to talk about miscellaneous things, but if there is any, we will talk about it right at the end. My assumption is that this class would continue for approximately 3 hours and over that, but we will be able to cover everything that we've decided. Thereafter, I believe tomorrow is your champions exam, so it's good that I've finished off these subjects before that, and I hope all of you are going to benefit from that exam as well. I would encourage all of you to give that anytime between 23rd and 27th of April. That's when it's happening, and after that, once the exam is done, you will also get the solutions, you will get the audio explanations. So I think that will be an add-on to the LRR also. I believe annotated PDFs for everyone who's asking. Oh, the slide that goes everywhere. Annotated and unannotated PDF, whatever you're searching for. Earlier it was being circulated on Telegram. Now it is being put up on the PrepLadder app so that anyone who's also on the app can download the same from there. So yeah, it's available on the app. All subjects, my subject for yesterday, Patho, has already been uploaded. Today's will also be uploaded once the session is over. So I believe we are good to go. I'll quickly write down where we left yesterday. We had finished off the parasitology part, but we had not done the helminthology. By that I mean cystodes, trematodes and nematodes. So first 30 minutes I shall dedicate to that. Thereafter my plan is to wrap up bacteriology, and thereafter we will go for virology. And thereafter, yesterday if you noticed, there were no bonus slides that were in the PDF because I have kept all the bonus slides and the extra topics that if you get time you must study or scan through them. You know, micro has a lot of things which you have to see 1 week before the exam. I mean, it's humanly impossible that you've seen it 6 months prior and you will remember it. It is obvious that you will have to see it within 1 week of the exam. Tabhi wo exam day pe yaad aayega. Only then you will be able to recall it. So those bonus slides, you do it right now or not is your wish, but you have to do it 5, 6, 7 days before the exam. It's a must, and best would be within 48 hours of the exam, because more than that, ma'am, we can't remember microbiology. I think we are good to go. This is the order in which we'll be going ahead. I'm starting with helminthology and starting with the very first question that you have over here. There's a 48-year-old patient who presents to the emergency department with severe headache, and his BP has obviously gone down 86/50, suddenly collapsed and died. So there was an autopsy that was done, and the brain showed a Swiss cheese appearance, which is quite a buzzword, and microscopically scolex and hooklets are given. Which of the following is the most likely diagnosis? Okay, most of you have started saying tinea solium because with this Swiss cheese appearance, you have started to believe neurocysticercosis. Now just tell me, everything that is mentioned over here belongs to which family of helminths? It is going to be the cystodes. So now for ease and to make you study everything in one flashcard, because these are the things which help you on the last day, all the cystodes have been written over here. What you will help me with is all the definitive and hosts, which, you know, yesterday a lot of students were wanting that, ma'am, can you please make a list of all the hosts at one place? So yeah, we are going to do that today. And if there's any extra point alongside, I will keep adding on. So now let me start with H. nana. In fact, H. nana is said to be the most common cystode infection. Remember I told you, if you ever want to be a parasite in life, I mean you don't, but if you ever have that option that I want to be a parasite in life, then you are going to be H. nana. Why? Because H. nana is very, very successful, and H. nana has decided that it will keep only, see, the entire thing, the definitive host for this entire table is going to be the man. And then H. nana says that I don't need anyone else. There is no other host. So this is going to have a single host. And now you will realize that how it decided I will keep one source only, not jump and change my notes and apps and so many things, and then I will be successful. So keep a single source, be successful in life, and that is going to be H. nana. Now coming to the second one, that is H. diminuta. You know, minute sounds like minute hoga, ma'am. It must be the smallest, but it's not. H. nana is the smallest. It is not H. diminuta. So the dwarf tapeworm is H. nana. See, H. nana had so many limited things. Host, only one, size, the smallest, but look how it became successful. It's the most common cystode. Very, very good. Coming to H. diminuta. Diminuta is now different. H. diminuta can, number one, have human being as a definitive host. It can also have the rat. In fact, please note, now it is very important to know that the intermediate host is a beetle nut. That is something which was a long time, you know, a plus minus thing, that where the rat is the intermediate host, and still can be. But believe now what the best answer will be, that human beings and rat are definitive hosts and beetle nut is going to be the intermediate host. Coming to the next, D. latum. We call it Diphyllobothrium latum, and we like to call it Diphishobothrium latum, because apart from human being, fish, there are two fish involved in it. So there is a chota fish, that is a big fish. The chota fish is known as cyclops, and the big fish is known as the fish, of course. So this life cycle will go on between human being, chota fish, big fish. So what will we end up consuming? We will end up consuming the big fish. Now they will ask you a question that what is the big fish, what is the larva which is going to be the infective form? So the infective form is going to be the L3 larva, and the L3 larva is also referred to as the plerocercoid larva, which is a previous year question. Very good. So now listen again. If they say there's a human being with a chota fish and a big fish, and you have consumed the big fish, you have actually ended up eating the L3 plerocercoid larva, and that causes D latum. What I'm going to ask you from pathology is which anemia is it associated with? Very good. All of you are saying B12 deficiency, megaloblastic. Perfect. So we finished off what we started in pathology. In path, you told me two things. What was the parasite associated with iron deficiency anemia? It was hookworm. And what was the parasite with B12 deficiency? That was going to be Diphyllobothrium latum. What you made in path, you have written in micro also. Let's move forward. Now we come to Taenia, Solium and Saginata. Human being is fine. Solium will be with pig and Saginata will be with cattle. Saginata is the one with cattle, and Solium, I don't know whether I should be using such words online, but at least I can write and tell you. Solium is going to be the one that is associated with pig, and Saginata is the one that is associated with cattle. So this is obvious. Now which one of these causes neurocysticercosis? I believe everyone knows that Taenia Solium causes neurocysticercosis, and that over here is shown as what appearance, guys? Come on, you know it. I've started making the stars. This is the classical starry sky appearance, right? And I taught you 3 starry skies in path, and today you have finished. So one starry sky was for radiology right in front of you. There are 2 more starry skies. One was in kidney and one was in lymphomas. In kidney, the starry sky was seen in PSGN. ये table I'm not writing because ये already LRR patho में है. PSGN shows you starry sky appearance, Burkitt's lymphoma shows you starry sky appearance, and neurocysticercosis shows you starry sky appearance. Moving on to the next one. Finally, everywhere definitive host was human being, but for Echinococcus granulosus, which you call as the dog tapeworm, ma'am, the definitive host is dog. And then the intermediate host is also sheep. So where are we in this entire cycle? We are the poor accidental hosts. And we are by chance if we end up getting infected. That is Echinococcus granulosus. What is the name of this disease? ये क्या बना है? What photo? Even if I don't zoom out, you guys know it. Ma'am, this is the famous hydatid cyst, and that is what Echinococcus does. They will not ask you that what is this. This is hydatid cyst. Everyone knows. दिख रहा है, pearly white cysts are seen. They will ask you how many layers does this cyst have? It is going to have 3 layers. Under the microscope, 3 layers. Can you name the 3 layers? They won't give you photos. They will ask you a one question on the 3 layers. So ma'am, let's go from outside. Outside, the layer is referred to as the pericyst. Obviously, outside is periphery. Then comes ecto, and then comes endo. No rocket science in this. Peri, then ecto, then endo. Which out of these two is going to be derived from the host, ma'am? Out of these 3, the outer one, the parasite has not made. Pericyst, the periphery, we have made, because imagine if a parasite comes into our body, we will make inflammatory cells. Na? You will make eosinophils, lymphocytes, neutrophils. So all those inflammatory cells have ended up making the pericyst. This is first question. Who has made, what has been made by the parasite? Only the ecto and endo. Echinococcus only makes ecto endo. We make pericyst. So what is ecto? Ecto is going to have a paintbrush appearance. Their favorite question. There are 2 brush appearances which you are going to answer for me. If they say there is paintbrush appearance, you say ectocyst of dog tapeworm. If they would have said broom appearance, yesterday I taught you a fungus. With that broom you used to hit the rat till the rat turned red, mar ke lal karna. Remember that broom appearance? Which was that fungus in which you saw it, ma'am? We remember something, Marnefi word was there. Penicillium marnefi or Talaromyces marnefi or whatever ABCD Marnefi examiner writes. That was the broom appearance. They ask you what is paintbrush appearance? That is Echinococcus granulosus. Now bacha endo wala. Endo is said to be the germinal layer, because that is making new baby hydatid cyst. So germinal layer will show you what? Germinal layer will show me this. What is this, guys? This is going to be the hooklet. I want to ask you, remind you of a mnemonic from yesterday. The hooklet of hydatid. Hooklet of hydatid. कहाँ पढ़ा था? Remember a mnemonic? My nose is cold and hot. hot was hooklet of hydrated. This means the hooklet of hydrated is Zn stain positive. Very, very good. Excellent. Acid fast. Everyone remembers. That's amazing. Now tell me that if this is a situation that has come up in front of you, how will you do the diagnosis? Ajkal, what is the test that is being done for hydrated cyst? It is ARC5 immunoelectrophoresis. By this, I'm trying to basically find out the antibodies. Would you want to do an FNSE? Would you put a needle inside it? My question to you, FNSE karte hain? Not at all, ma'am. FNSE is contraindicated. Reason being that if you puncture this, patient will have anaphylaxis and patient will end up dying. So nahi karna hai. FNSE not done. Earlier, one skin test used to be done. That skin test was Cassoni test. Do you do it now? Again, this is also obsolete. People were having anaphylaxis. So don't put any needle in this patient. Skin mein needle, nahi dalna. Do you have to put a needle in the liver? You don't have to. In the cyst, you don't have to. Don't put needles in these patients. Otherwise, they will have anaphylaxis. They will die. How do you do the diagnosis? You do ARC5 immunoelectrophoresis. Now I have a question. I ended up saying liver over here because what is the most common site of echinococcus? It is going to be the liver. But before I write that, I hope you remember sabka definitive host was human being, but only for echinococcus human being was accidental host. Everyone had two hosts, but H. Nana said no, I will have only one host. And Diphysiobothrium latum said human and two fish, so I will have three hosts. Is that okay? Now I want you to answer the next question. Which organism is responsible for multiple alveolar-like lesions in the liver? In the liver, I told you, liver is the most common site of hydrated cyst. So now tell me what is the answer to this. Many of you are saying A, some of you have said B, because ma'am, abhi aapne padhaya tha echinococcus granulosus. Does that cause hydrated cyst? Yes. Does echinococcus multilocularis also cause hydrated cyst? Yes. Both of them cause it where? Both of them cause it in the liver. How will I know the answer? Look at this. The organism has multiple alveolar-like lesions. This doesn't mean your lungs mein ho raha hai. No. It is happening in the liver, but the organism, instead of looking like this, the cyst is looking like this. The hydrated cyst that is formed is having jaise alveoli hota hai, but that doesn't mean it's in the lungs. It's still in the liver. And now the answer will be multiple locules. So that is multilocularis. Please be very sure that the most common site will always be liver, chahe first option ho ya second option ho. When will you mark the first option? Only when examiner says the cyst has these alveoli like multiple locules. Answer is multilocularis. So yes, the most common site is going to be the liver. And Dr. Fatima is asking, can it happen in the lungs, ma'am? The second most common site is the lungs. So it can happen in the lungs. Moving on to the next question. Which of the following statement is true regarding trematodes? We've changed the family. Cystode ho gaya, trematode baad mein. So what is trematode? Which is true regarding trematodes? Quick answer and then one table for trematodes. Two in fact. Jaldi wala. They are hermaphrodites. First intermediate host of Paragonimus is crab. Schistosoma is by metacercaria and life cycle has 3 intermediate hosts. Okay, so many of you are asking me alag organs. ऐसे नहीं पूछते. Most common, second most common तक ठीक है. Now you can't keep going into every organ, right? Okay, previous question. Yes, previous question का answer someone asked me, तो बता तो दिया. Multiple alveolar like lesions will be what I've told you. It is going to be echinococcus multilocularis. उससे previous question का answer also I've told you. Swiss cheese appearance was in the brain. That was in tinea solium, neurocysticercosis. सारे answers हमने कर लिए. Moving on. This question everyone is saying answer is going to be option A. They are usually hermaphrodites. Perfect, because now I will do a family of trematodes and then we will reassess this question, but your answer is correct. So hermaphrodites mein what all is going to come? This everything is going to come, ma'am. All of these are going to be trematodes. Now what I'll do, all of them are going to follow common rules. But schistosoma will say, I want everything SSS. Schistosoma ke liye SSS, which means how will all of them, if I ask you what is the definitive host? So sabka definitive host, human, simple. Sabka first intermediate host is going to be the snail. See, snail has started coming in. Okay, once schistosoma gets the snail, schistosoma says, now I don't need anything else in life. S mil gaya, nothing else in life. So schistosoma life cycle is human being, snail, khatam. But for others, they don't go on that S. They will say human being, then snail, and then one more thing. So please remember, human being is the definitive host. Then first intermediate host is snail. Second intermediate host, let us start reading. When I say schistosoma, no second intermediate host. Para is written as cara. So cara means anything sounding like cara, Paragonimus mein aayega. That is going to be crab or crayfish. Crab hoga, crayfish, not fish guys, not fish. crayfish, crab, ये सब में you will write Paragonymous westermani. Coming to next, Clonorchis opisthorchis, we had written as clonorfish, opisthorfish, because over here it is going to be fish. Now hang on, just wait over here. Tell me something. If I say human being, snail, and crayfish, what will you mark? Cray, cara, Paragonymous. If I say human being, snail, and only fish, you will say clonorfish, opisthorfish. If I don't say all this, I say human being, chota fish, bada fish, two fish. Human being, small fish, that is cyclops, and big fish, that will be two fish, di, fisho, philobothrium latum. I hope the fish story is okay with you. Now coming back, Fasciola hepatica and Fasciolopsis buscae. Over here, ma'am, Fasciola FA, Fasciolopsis FA. The second intermediate host is going to be FA, that is fresh aquatic plants. I hope everyone has learnt all of the second intermediate hosts. Snail ke aage, nothing there, that is Schistosoma. What else? One more thing, look at their names. What are they called? So let's start. P for Paragonymous, P for pulmonary, matlab this goes into the lungs. This is known as the pulmonary fluke. Now they will say, acha, eggs are present in the stool, because diarrhea to sabhi karayenge. Saath mein eggs are also present in the lung. Lung se kya sample aata hai, ma'am? Sputum. So if they say eggs are present in the stool and the sputum, you will say, oh, this is going to be pulmonary, Paragonymous westermani. Next, they say Clonorchis opisthorchis, C for C. This is known as CL. देखो Clonorchis, CL. It is known as Chinese liver fluke. Liver में जाता है ma'am. What does it cause? C for cholangiocarcinoma. Very, very important. Coming to Fasciola hepatica, I mean, कैसे नहीं याद रहेगा? Hepatica means liver. I call it Fasciola hepatica. I've changed most of the names in parasitology. Fasciola hepatica will tell me it is sheep liver fluke. Why sheep? Because the life cycle was human being, snail, and fresh aquatic plants. But sheep word has come. This means sometimes the definitive host can also be sheep over here. So if they say Fasciola hepatica, it is sheep liver fluke. Coming to the next one. Fasciolopsis buscae. Fasciolopsis buscae is intestinal fluke because it tends to go into the intestine. सबके नाम याद हो गए. अब आते हैं S की तरफ. Schistosoma is of three types. Schistosoma hematobium. Schistosoma hematobium क्या कराएगा मैम? Hematuria. Hematobium, hematuria means it goes into the urinary bladder. What will it cause in the urinary bladder? Most commonly it causes S है ना, तो first तो squamous cell carcinoma. It can also cause transitional carcinoma. Watch out for this question. Schistosoma hematobium causes SCC, TCC, both. If it asks one best, then you mark the S wala, that is SCC. Very good. Then Schistosoma mansoni and japonicum, you can see ये intestine में जा रहे हैं. Their next question will be small intestine, large intestine. So IJ, that is how we learn it. If they ask me about ileocecum, I will mark I के बाद J. So Schistosoma japonicum goes over there. And if they ask me large intestine, that is sigmoidorectal, then mansoni will go over there. सारे नाम याद हो गए. Everyone names are done. Life cycle भी याद करो. Now comes the real story of S. All of them say that we will happen via ingestion, खाने पीने से. You are eating some dirty food and that is why this is happening. But Schistosoma says no, I want S. I will do skin penetration. Okay, then you will ask me, ma'am, if all of them are by khana pina, what are you eating? We are eating the metacercaria larva of these organisms. But Schistosoma says, nahi, I want that S sound. I want the S touch. So that will be because of penetration of cercaria larva. So listen again, all of them are by eating metacercaria larva. Schistosoma is by the skin penetration of cercaria larva. Very good, all of you are right. Coming to the worms, all of them are hermaphrodite, male, female, same. But Schistosoma is S, matlab sexes are separate, male alag, female alag, separate. All of them shows what eggs? I will show you eggs right now. All of them are operculated eggs. Schistosoma says no, I want S, that is spinous eggs. Now one place where Schistosoma is not the odd one out is the treatment. For all of them, what is the treatment? Yes, I think you all know it. I've written a P for a good hint. That is going to be all of them praziquantel. But Fasciola hepatica says that for me it is going to be triclabendazole. This is a very, very famous pharma question. All trematodes are treated by praziquantel. Fasciola is by triclabendazole. So ab yaad ho gaya. Now I can get back to my question that we had. Which of the following statement is true regarding trematodes? So trematodes are hermaphrodites. Yes, all trematodes are hermaphrodites, but Schistosoma was going to be sexes separate, but they are usually hermaphrodite statement. ठीक है. First intermediate host of Paragonymous is crab. I hope you remember. Definitive host was human. First intermediate host of everything was snail. The second intermediate host was going to be cray, cara. So first nahi, second wala is going to be crab. False. Schistosoma is by Metacercaria. Nahi ma'am, schistosoma to Cercaria, sa wala sound. Okay, life cycle of trematodes has 3 intermediate hosts. No, it has 1 definitive host and it has 2 intermediate hosts. So ye bhi galat. Only correct statement was the first one. So this is also settled for us. Now let me make you solve maybe a question if you have seen, but पहले you realize कि 2 families कर लिया मैम, cystode done, trematode done, सबका eggs बता दो. Let me ask you, what is this egg? You will tell me ना, eggs I have taught you million times, your day to day. What is this egg? Whenever I see an egg जिसके अंदर I can see 1, 2, 3, 4, 5, 6 lines, 6 hooklets, 6 wala cystode, 6 wala is going to be cystode. Acha, one very random question, that is, if I in the urine, if I show you a crystal with 6 sides, 6 sides wala crystal in the urine was 6 wala kaun sa tha? That was cystine. Similarly, if I show you an egg in the diarrhea sample, egg having 6 hooklets, that was going to be, that is cystode. But ma'am, exam mein no zoom in option na, I can't zoom in to count those 6 lines. Then what do I do? You will have to look at these 2 knobs over here. These are referred to as the polar knobs, and if you look carefully, kuch aisa dot dot ganda dirty material is kept over here, and that is known as the yolk granules. When you see 6 hooklets with polar knobs and yolk granules, that is cystode. So all cystodes, matlab H nana, then Taenia solium, Taenia saginata, all of them show you this. But then H diminuta says, no, I am different. H diminuta has the same thing. See, it's got the same 6 wala hooklets, but then it has 2 exceptions. It doesn't have those polar knobs, there are no polar knobs, and it doesn't have that ganda material, it has no yolk granules, that is H diminuta. Very good. Coming to the next one is going to be this. What is this? If you see an egg and that egg is going to have a lid on top of it, matlab ma'am, egg ka protection karne ke liye there is a lid, and that is known as operculated egg. Where, like lid, what is lid for? It is for protection. What do we need protection against? STDs. So if they ask you STD, please note all the STD ke paas operculated egg hota hai. What is STD ma'am? S stands for, yes, please let me know, please write it down for me. STD kya hota hai? S for Spirometra, T for trematodes, all trematodes, and D for Diphysiobothrium latum. I want to ask you a question. All cystodes have ये वाला egg, but H diminuta says no knobs, no yolk granules, and D latum वाला जो cystode है, that says what? I will have operculated egg. Cystode family हो गया. All cystode have 6 वाला eggs. H diminuta अलग, D latum is going to be operculated. Now let's go to trematodes. All trematodes have ये वाला egg मैम, lid वाला egg, but schistosoma थोड़ी ना मानेगा. All trematodes have this egg, but schistosoma says no, 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 I want S. I want spinous eggs. Now those 3 spines are in front of you. If it says lateral spine, terminal spine, or hardly visible rudimentary, दिख ही नहीं रहा, तो lateral is schistosoma. Which one? Man, Sony. How did you learn it? Sota hua, leta hua, man. That is how we learned it. Sleeping laterally, man. For those who don't understand Hindi. Sota hua, leta hua, man. Sleeping laterally, man. Right? That is one thing. Now we come to where do you see a terminal spine? That is going to be schistosoma hematobium. Has the T in it, so that has terminal spine. And where do you see the rudimentary spine? Japan spineless, matlab Japonicum, just a way of learning. Japonicum is going to be the rudimentary spine. All spinous eggs are done. So if you've done all of it, last question before I move on to the next family. A patient recently returned from sub-Saharan Africa presented with painless hematuria. Please stop here. Hematuria. अभी तक के कौन से organism का सोचा? Hematobium सोचा मैम. I think it is schistosoma hematobium. Hematobium has lateral spine, terminal spine, or rudimentary spine? Hematobium has a terminal spine. यहाँ तक fit हो रहा है. Now we come to microscopy measuring 125 micrometers. Which of the following statement is or are correct, and what have you thought of it, guys? क्या सोचा है? Okay, D you are saying. अच्छा, टेल मी इफ इट इज शिस्टोसोमा, इज इट गोइंग टू बी सर्केरिया लार्वा? ठीक लग रहा है. इज द ड्रग ऑफ चॉइस ट्रिक्लाबेंडाजोल? नो, इट इज गोइंग टू बी praziquantel. इज द मोड ऑफ इन्फेक्शन द इंजेक्शन? नो, शिस्टोसोमा का तो एस मतलब स्किन. मोस्ट कॉमनली causes TCC? No, again, most commonly causes SCC. So the only correct statement that I have is the first one. This was just a way to confuse you. They could have given me as a single best answer also, na, 4 options, but they gave you a multiple level layering wala question so that you get confused and then you mess up in the exam. Is that okay with everyone? Can I move forward? Yes. Now moving on to everyone's favorite. Ma'am, ये worms, adult worms सबने request किया था, नहीं याद होते, बेजा problem. So you will tell me, identify the organism shown in the image below. What is this? Strongyloids, Enterobius, Ankylostoma, Ascaris. Perfect. This is going to be Ascaris lumbricoids. Amazing. So why did you, what is Ascaris lumbricoids? It is roundworm. तो दिख रहा है ना मैम, अगर आप उसका बॉडी ऐसे जूम इन करके देखो, it is cross section is looking round. Cross section is looking round ऐसा. So this is known as the roundworm. Perfect. Now the next story is male और female में कैसे differentiate करेंगे. Now please note the rule for every. What family am I starting with? I am starting with nematodes. Now instead of teaching you question answer, I have got 3 flashcards in which worms, eggs and important features, everything is written, so that now whatever question comes you can solve from there. Then I will make you practice questions. When I talk about nematodes, rule number 1 is पहले तो identify करो कौन सा वाला worm, roundworm, hookworm, pinworm, threadworm, वो सब identify करो. Next is identify male versus female. So the thing is that the female is larger, that is one thing, and male ka you have to focus on the back side. I mean, it sounded very bad when I said that, but that's how you have to do. You have to focus on the back side of the male. So always go and focus on the back side कि वो क्या दिख रहा है. तो if you look carefully, this worm is looking larger. This must be the female. And then इस worm का अगर back side देखा तो back side में मैम मुझे कुछ ऐसा गोल गोल coiling दिखा. तो the back side is going to have a coiling. That must be the male. And that you do for every organism. The female will be larger and the male के back side पर कुछ अलग होगा तो you will identify. Let us start. What I'm going to do, I have got the adult worm, I have got the egg, and any other extra point you will add on. We will now do all the 5-6 adult worms of nematodes that we have to. Starting with Ascaris, that is roundworm. Obviously, ma'am, you've taught us round दिखेगा. उसके अलावा the female is going to be larger and the male is going to have a coiled end. So we've identified. Now let's come to their eggs when the male and female undergo fertilization. Now basically mating होता है तो eggs. I can see round worm का round egg. Simple ना, round worm है, round egg होगा. But there are 2 eggs. One is a fertilized egg and one is a non-fertilized egg. How do we realize? Fertilized says I will say yes to everything. Non-fertilized says मेरे तो नाम में ही non है, no है. I will say no to everything. So for example, if you say which of them has a coat on the outside, so fertilized will say I will have a coat, non-fertilized will say I will not have a coat. Okay. Next, which of them has a space? ध्यान से देखो, ये रहा बीच में अंडा. There is a space here, there is a space here. Who has that space? Fertilized has a space, non-fertilized does not have a space. Who will float on SSS? What is SSS? Float on. If you want to float the eggs, what do we use? For those who don't know, we use saturated salt solution. Who will float on saturated salt solution? Fertilized will float. Non-fertilized का तो सब कुछ no, it will not float. तो roundworm तो हो गया. That is going to be Ascaris. Done. Now let's go on to the next one. I have not written. Can you identify? ये adult worm, ये उसका egg, ये उसका clinical photo. What is this, guys? Ma'am, it's looking like a hunter. Hunter तो नहीं लिखेंगे ना. They will write whip. So whip basically means that now over here they are talking about the whip worm. That is TT, Trichuris trichura. Yes, whip worm. Whip जाके hunter. कहाँ पे hunter मारना? Rectum. That is where it is going to go and attack. So if you look carefully, this they will say this is the specimen from the rectum. ये rectum का endoscopic photo लिया. And photo में I saw that there were these white color Trichuris trichura के eggs. तो hunter कहाँ पे? Hunter rectum पे. Sorry for those who like coconut, but I am ruining it for a lifetime for you. It looks as if the rectum is a cake and this is coconut flakes that I have added on top of it. This is known as coconut cake rectum. Very sorry for this. So coconut cake rectum is nothing but those trichuris trichura. So how do I identify? Everyone in the exam पहले worm identify करो. Will you be able to identify ये hunter जैसा जो है that is going to be trichuris trichura? तो पहले तो you've identified the worm. Second, male female. तो ma'am then you had told us that male के back side पे focus करना. तो can you notice male का back side over here is coiled. This must be the male and this automatically becomes the female. How easy does it become, right? Now we come to the eggs. Worm हो गया. Now we come to the eggs. Eggs are going to be classical. Although book में लिखा है barrel shaped eggs, they people students call it ढोलक. They call it वो Bollywood movies में जो bomb आता है वैसा जो मन करे ढोलक bomb. But examiner will write barrel shaped eggs. But if you zoom in, the egg is brown in color. But then it is something colorless on the ends. क्यों egg क्यों brown in color है? Because this egg is said to be stained with bile. That is why it is brown in color. It is bile stained. But then ma'am on the two ends it has mucus plugs which don't have bile. They are non-bile stained. That is important for you to know. So please note, I have learnt it ऐसे T यहाँ से लगाओ T जैसे वो Bollywood movies में bomb होता है ना. In Bollywood movies they show there's a bomb and there's a pin inside it and then the hero comes and takes the pin out and then saves the entire world from the villain. So then we will see that T and T हम लगा देते हैं. There are two mucus plugs that I have put and that is going to be the barrel shaped eggs with mucus plug. मतलब T trichuris trichura. Done. This is also okay. Now coming to the next one. Ma'am ये वाला photo आएगा तो कौन सा worm? This is known as, when I see an egg and that egg has O inside it. O inside it. That is known as a segmented वाला hookworm. जिस egg में O आएगा like this, that is O वाला hookworm. Very good. Hookworm का नाम. There are two hookworms. One is known as ankylostoma. One is known as Nectar americanus. Please note N for N. Nectar americanus, N for N is known as New World hookworm, whereas ankylostoma is Purana naam. That is known as Old World hookworm. They are not Purana naam, Naya naam, depending on which countries and which areas geographically they are affecting. So ankylostoma, Old World, Nectar americanus, New World. Okay, both of them, their eggs are going to look the same. How do they enter? They are not by eating dirty food. They are coming via the skin. Which trematode came via the skin? वो SSS वाला कौन था? मैम एक तो schistosoma came via the skin. Second, you are telling me hookworm is also going to come via the skin. Very important question. Now let's come to the adult worm. When I will look at the adult worm, hookworm का egg में, you will always notice that the way of identifying is that again there is something in the posterior end of the male. The male this time has not gone coiling round. The male has an umbrella-like expansion. The male has an umbrella-like expansion. Which end? Posterior. Male के back side पे focus करना. So that is going to be the posterior end. Basically, this is how it catches on to the female, and this is how the mating and copulation will happen. So the posterior end of the male will be opened up like an umbrella. Then I will identify, अच्छा ये hookworm है. This is the worm for it. Okay. Now the question that comes is that when it comes via skin, उसे क्या बोलते हैं? Ma'am, that is known as creeping. Worm ऐसे creeping करता हुआ आता है. Will the patient also have a lot of itching because of it? Yes, there is ground itch, but ultimately it will go well. Ultimately it will go to the intestine. Which anemia does hookworm cause? It causes iron deficiency anemia. ये तो मुझे कब से बता रहे हो? 5 days से you've been telling me this. So this is also settled. Now I move on to the next worm. What is the answer to this that is written over here? Ma'am, again male female तो हम पहचान लेंगे because you told us male का back side. But ये कौन सा वाला worm है? Which worm is it? That I want to know. This worm is known as Enterobius vermicularis. Vermicularis means vermiform appendix. Appendix इतना छोटू सा पतला सा structure. How can a worm go inside it? That worm must be very patla, like a pin, very patla, like a thread. So this is known as thread worm or pin worm. How do I know? Male female तो very simple ना. This is larger female, this पीछे गोल is male. But you will identify that to go into the appendix it has to be very patla, and you will notice something on the front. This is known as cervical ala. So that worm in which I get to see 3 cervical ala, मतलब this is a 2D photo ना guys. You are seeing one ala over here, one ala over here, one must be on the back side also because this is a 2D photo. Actually worm is 3D. So 3 cervical ala अगर होगा, that is Enterobius vermicularis, and then you will say अच्छा ma'am male female is okay. This is what causes a very famous finding which is known as perianal pruritus. This word will be written and you can't mess up. This is perianal pruritus, and please note that how will you identify? Ma'am, patient will come to you with itching. बच्चा या adult perianal itching होगा. So one, in an adult, I can take a swab from the anal region. I can take a swab. That swab is known as what? That is known as the NIH swab. Bachcha will not let you take a swab. For bachcha, what will you do? For bachcha, we will stick a tape. Why are you taking a swab? Why are you sticking a tape? Scotch tape method. Because on the tape, all the eggs will end up getting stuck. On the swab, all the eggs will end up getting stuck. How are the eggs of enterobius? Ek side flat, ek side curved. Flat, curved, flat, curved, flat, curved. Matlab plain, convex. Plain convex. It is a plano-convex egg, and inside that egg, if you notice, there is the larva sitting. There is a tadpole larva. Plano-convex egg with tadpole larva. How I want it? D-shape eggs किसमें होता है? Plano-convex वाला D-shape eggs are seen in Enterobius vermicularis. Okay, perfect. This is also done. Let's see if you were listening to me. There is a 4-year-old child who's brought to the OPD with perianal itching and scaly skin. The perianal tape, Scotch tape method was stuck over there, and next day it was examined. On low power, there are eggs with flattened on one side and convex on the other. Ma'am, D-shape eggs are seen where? They are seen in enterobius. So nice. Now you should not be scared of worms and eggs, I hope. Coming to the next one, there's a 32-year-old individual presents to the clinic with persistent fatigue, shortness of breath, and there is itchy rash on the feet. Patient has a habit of walking barefoot. Reports are awaited. Which other clinical investigation or would you see? So ma'am, barefoot में मुझे समझ आया कि something is entering via skin. Now I think that अच्छा, what else? When I was talking about coconut cake rectum, that was trichuris tricura. Lymphatic filariasis में lymphatic का तो nothing is mentioned over here. Perianal pruritus में they will not come via the skin now, obviously. पेरीएनल है तो जीआई होगा. स्किन के थ्रू हुकवर्म कम्स. वेरी गुड. एंड हुकवर्म क्या कराता है मैम? हुकवर्म कॉजेज आयरन डेफिशिएंसी एनीमिया. सो नाउ व्हेन आई टेल यू अ फाइनल एंडिंग ऑफ दिस एंटायर टॉपिक, कैन यू रीअरेंज द फॉलोइंग पैरासाइट्स एंड मैच देम विद देयर होस्ट्स? Let's see how many of you were listening. एक एक करके बता दो जल्दी से. डायफिलोबोथ्रियम लैटम, डायफिशोबोथ्रियम लैटम. मैम, छोटा फिश, बड़ा फिश. छोटा फिश is mentioned over here. This means we will talk about cyclops. Next, Paragonimus. Para is Cara. I will mark it with crayfish. Then we come to Taenia. Taenia, which one? They've not mentioned. Taenia solium hota to pig. Pig is not here. Maybe it is Taenia saginata. Saginata for cattle. Fasciola is Fascipiola hepatica. Fascipiola hepatica is sheep. So this is also settled over here. All of you are perfectly right. Last question. जल्दी से. 29-year-old male patient comes to the OPD. मैम, यू कीप रीडिंग. हम तो नहीं पढ़ रहे. हमें दिख गया यहाँ पे ढोलक एंड हमें दिख गया अपना फेमस कोकोनट केक रेक्टम. सो दैट टी एंड टी हमने लगाया. आर आंसर इज इन फ्रंट ऑफ अस. ट्रिक्यूरिस ट्रिक्यूरस. सी, दैट इज एग्जैक्टली. रेक्टम था, कोकोनट केक रेक्टम था, फोटो गिवन, बैरल शेप्ड एग था, म्यूकस प्लग्स. मेक्स योर लाइफ अ लॉट easier if you do those 3 flashcards of worms and eggs. Nematode के questions are settled. Dr. Snigdha, can, if you ask me such questions, can trichuris cause IDA? Yes, because there can be bleeding. As you can see, there is rectal bleeding, and any kind of blood loss from the body, if it goes on for a certain number of time, it can cause iron deficiency anemia. So can wala question, so I will have to answer yes. But is that the first option that you go for in the exam? That would be no. Now moving on to the next question. Hookworm and strongyloids infection usually are acquired through what? Maybe strongyloids हमने नहीं पढ़ा, but मैम hookworm तो हमने पढ़ लिया. You told us hookworm comes via the skin, so this is going to come via the contact, not by ingestion, not by bite. So this is a previous year question. के एक list बना दो. What all comes via the skin penetration? SAS comes via skin penetration. Repeating, what all via skin penetration? Number 1, S for तो हमेशा S के साथ तो हमेशा cystosoma. Then A for ankylostoma. Ankylostoma you were saying मैम hookworm होता है तो वो भी पता है. And now S for strongyloids. तो tell me, schistosoma सबके eggs याद करा दो. Schistosoma का eggs तो had to be with S, that is fine. Hookworm का egg you told us, hookworm का OO वाला segmented egg होगा. Strongyloids का egg you did not show us. Why? Because strongyloids is very strong. Means when the egg is laid down and the larva is inside it, the larva comes out, it breaks the egg and the larva is going to come out. So ऐसा नहीं है. डोंट से स्ट्रोंगाइलॉइड्स एग नहीं ले डाउन करता. स्ट्रोंगाइलॉइड्स भी एग ले डाउन करता है. इट लेज द एग, बट दैट लार्वा इज सो स्ट्रॉन्ग ना, इट जस्ट breaks the eggshell and it comes out. So now the larva identification of strongyloids will be given to you. They will not give you the egg identification. How do you identify the larva of strongyloids? How do you identify strongyloids? Ma'am, this is a larva, some ऐसा सा U सा कुछ होगा, but they will always mention this. If you look at the head end, you will notice that there is a constriction at the esophagus. Let me see in the other photo. I will find the head end. Obviously, head end will be a little more broad, tail will be a little more patla, narrow. So in the head end, we will notice that there is some constriction that is happening. So that will tell me double bulbed esophagus. This is double bulbed esophagus. So when they write this, that is the rhabditiform larva of strongyloids. तो सुनने में कैसा लग रहा है? Strongyloids. See, the story over here is what is there, what it appears like on the face is not reality. Like I told you, H. nana is looking like dwarf, chota sa tapeworm, but in reality it is very successful. It's the most common cystode. Over here, strongyloid sounds like, oh, damn strong. But when you talk about the nematode family, this ends up being the smallest nematode that we have. This is the smallest nematode that is going to be there. So I hope that is okay with everyone. Yes, moving on to the next question. Tail tip contains 2 nuclei. Gisa pita question, ma'am. How can you finish the session without it? Tail tip contains 2 nuclei in microfilaria of. For helminthology, I think this shall be the last question. Quickly, guys, 2 nuclei. How did you, everyone, how do you all know this answer? Brugia malai, very, very good. You have studied a lot. That is not to let you stop studying. That means keep the momentum going. Brugia malai. So, ma'am, you are talking about filaria. Means you will get a question of lymphatic filariasis. How will you get a clinical question? This is how the clinical question of filariasis will come. Because filaria has a habit that it will always go and cause involvement of which channels? It will go and cause involvement of lymphatic channels. Look at the lymphatic obstruction. We all know this photo. This is the elephantiasis. What will I teach you in this? So, elephantiasis में swelling होगा. Look at the skin over it. There is going to be skin pigmentation also that is going to be there. तो ये तो हमें पता है मैम. But if the lymphatic channels are going to burst, then imagine the chyle. Chyle क्या होता है? Lymph. Lymph will come into the urine. Lymph will come into the urine and then look at the color of the urine. This is known as milky urine. Please note when lymph comes into the urine, chyluria, that is milky urine. So they will say elephantiasis with milky urine. You are settled with it being known as filaria. Now you asked me कि अच्छा मैम उसमें से उसका जो baby है, the microfilaria, baby out of it, can you tell me how do you identify? So there are 2 ways and I think we all know these are all the filaria that I have to study. Yes, all the filaria. What is this, guys? Ma'am, LBW one side, others one side. That is how I've learned it and you learn it like me, otherwise you will also go mad if you learn it by the book way. LBW one side, others one side. What is LBW? Loa loa, Brugia malai and Wuchereria bancrofti, they are all going to have a sheath. So sheaths are going to be LBW. If you want a confirmation, you can zoom in and see, yes, I will notice ma'am that there is a transparent sa kuch covering hai bahar. That transparent sa covering is known as a sheath. You can see little bit of sheath coming out also. So LBW is sheathed. If you look at the others, they don't have the covering. So see, there is no outer covering, so wo others mein dal diya. Now they will ask you, out of these sheaths, how will you differentiate between LBW? We all know that whoosh whoosh everyone has started saying, तो ये अपना internal ही चलता रहता है हमारा ना. Live chat is just what we can understand. If any non-NEET PG student comes in, would feel that we've just gone crazy. So if there are no nuclei at the tip, that is nuclei gayab, nuclei whoosh, magic, that nucleus has vanished. That vanished whoosh nuclei is Wuchereria bancrofti. If you see 2 nuclei at the tip, 2 for bi, bi is going to be Brugia malai. And if you see line se nuclei, ma'am, line se nuclei are going to be seen in loa loa. Repeat with me once again. Where do you focus? You focus on the tip. On the tip, if you noticed, यहाँ तक nuclei थे, यहाँ के आगे whoosh, whoosh मतलब Wuchereria bancrofti. Second, in the next one, I saw 1 and 2. Ma'am, exactly 2 nuclei at the tip. किसका tip? Worm का tip देखना. Please don't start looking at the sheath. Sheath को छोड़ो. Look at the tip of the worm. The worm is going to have 2 nuclei. So that is B, Brugia malai. And if you look at the next one, ma'am, till the end, line say nuclei. Line of nuclei, that is going to be loa loa. Okay? Wuchereria, Brugia, loa loa. Done. All the others, you can just read their name, Mansonella, Onchocerca, fine. They are all going to be unsheathed. Clinically मैम क्या होता है, all the photos that I showed you right now of elephantiasis, chyluria, blah blah, all of that was most commonly with Buscheriria. They will also ask you questions of loa loa and they will ask you questions of onchocerca. इस पे अलग से questions आते हैं. What else? Loa loa से start करो. Loa loa goes in the eye. What does it cause? You will see this kind of a worm. You will see a proper worm in the eye. This का तो best है मैम. इसका जो नाम होता है, that is going to be African eye worm. What more can you ask from here? It is African eye worm which will tell me कि worm मुझे eye में दिखेगा. Common sense. But now coming to the next one, this is what they will ask you. What kind of a swelling does loa loa cause? It causes something known as Calabar swelling. Calabar swelling is nothing but a hypersensitivity reaction. You can see a swelling, the hand of this patient is swollen. The photo is not very in terms of lighting अच्छा नहीं है, but there is a redness also on the top. Basically hypersensitivity reaction. There is a Calabar swelling that is going to be there. Coming to the next one, also please note this worm is diurnal, matlab it is going to come in the diurnal means when does it come into the blood? It comes in the morning also, comes in the evening also, so it is basically a diurnal worm. And D for diurnal, D for deer flies. If they ask you what is the vector of it, it is going to be via the deer flies. So loa loa diurnal hai, deer flies hai. Loa loa is African eye worm, so I can see that, and it causes Calabar swelling. Is that okay with everyone? Now coming to the next one, एक मैम ये बता दो, what does onchocerca volvulus? Volvulus tells me something गोल is happening, so this will be convoluted worm. That is the other name of onchocerca volvulus. It is गोल means it is a convoluted worm. इसमें सब कुछ black. This mnemonic I had added recently in the main videos also. Maybe you wouldn't have found it in rapid revision. So onchocerca volvulus गोल मतलब convoluted, everything is black. So this is very commonly seen in Africans and black population. This is caused by the black flies and the patient is going to have black skin. So black flies, black population and black skin, and that is what is known as leopard skin. Apart from that ma'am, lymph node तो हर disease में बढ़ेंगे ना, but in this the lymph nodes of the groin are very big. So it looks as if the groin is hanging, so that is known as hanging groin. But very good, eye इसके अंदर भी involved होता है, but eye में क्या होता है? Very good guys, river blindness. You can see there is an entire sclerosis. I mean the cornea is hardly visible. There is sclerosis that is present in river blindness. This could be asked in INI-CET exam. Sclerosing, there is disease and treatment क्या होता है? Ivermectin. River blindness का treatment क्या है? River or river blindness का treatment is ivermectin. You will never ever forget. Okay, with that I think when I come back in this one table I have finished off all your PYQs. या तो they will ask LBW, or they will ask the nuclei, or they will ask the elephantiasis, or they will ask the worm in the eye wala situation and Calabar swelling, or they will ask the leopard skin, and they will ask the river blindness. Okay with everyone? One table, all questions are settled. Coming back, you told me bye. Now tell me, 2 nuclei on the tail tip, bye matlab there is going to be Brugia malai. ओके बाकी नॉक्टर्नल कौन से हैं? मोस्टली नॉक्टर्नल ही है, तभी मैंने नहीं बोला. यहाँ पर ऑल दी अदर्स विच एनीवन इज आस्किंग मी, दीज आर गोइंग टू बी द नॉक्टर्नल वंस. ओके विद एवरीवन? बिकॉज नाउ आई मूव ऑन टू द नेक्स्ट क्वेश्चन दैट वी हैव ओवर हियर, एंड दिस इज द मोस्ट, आई मीन इफ आई हैव टू स्टार्ट बैक्टीरियोलॉजी ऑन अ गुड नोट, दिस हैज टू बी इट. आई एनी वैसे 30 मिनट्स फॉर पैरासिटोलॉजी, 45 मिनट्स हो गया, तो 15 मिनट्स लेट तो हम वैसे भी चलते ही हैं मैम, LRR में मान के चल के बैठे हम. नाउ वी कम टू दिस वन. ड्यूरिंग अ पिकनिक a cook makes sandwiches for a group of 10 individuals. However, after consuming sandwiches, 8 of them experience severe gastroenteritis within 4 to 6 hours. ये हमें रटा हुआ है मैम. Answer is going to be Staphylococcus aureus, which means that whenever they give me food poisoning, and food poisoning का see ultimately all of these can somewhere cause food poisoning. This can cause typhoid, this can cause cholera, but then within 6 hours if they mention, I only think of 2 things. Whenever they give me a product which is going to have milk and meat, where was the milk and meat over here? Meat तो था ही नहीं. They said sandwiches, something you will have to assume. Coming to it once again, if they say a South India patient, तो वो हमेशा swimming कर रहा है, मतलब rhinosporidiosis. If they say a truck driver, उसका हमेशा sexual practices unsafe, that is going to be syphilis. If they say African child, Burkitt's lymphoma बनाना है. If they say sandwiches, healthy सोचना ही नहीं. You have to think of those mayonnaise loaded sandwiches. Mayo is going to be a milk product. If they say pastries, you have to assume वो pineapple वाला cream वाला pastry, cream milk product. कुछ assumptions करो, तो milk product आएगा ही. सैंडविच में मैम उन्होंने मेयो डाला ही डाला है. मोमो के साथ उसने मेयो वाला चटनी खाया ही खाया, समथिंग यू अज्यूम, ओके। तो मेयो मतलब मिल्क प्रोडक्ट एंड मिल्क प्रोडक्ट मतलब स्टफाइलोकोकस ऑरियस। मे बी उसने अच्छा नॉन वेज सैंडविच खाया, चलो वो वट एवर यू लाइक इन लाइफ ना, अपने हिसाब से रेसिपी बनाते रहो। इन शॉर्ट मिल्क और मीट विल बी मेंशन्ड इनडायरेक्टली एंड you will have to mark incubation period within 6 hours is going to be staph. When will you mark Bacillus cereus? ये तो हम already कर चुके हैं. For Bacillus cereus, ma'am, it will be Chinese fried rice. Once a student asked me कि ma'am, what if that is Chinese fried rice which is non-veg rice? Then हम क्या mark करेंगे? So don't ask me such permutation combinations. अपना अपना recipe मत बनाओ exam में, because if this is how we could do microbiology then life would have been so easy कि अच्छा non vegetarian Chinese fried rice होगा तो किससे होगा. That is exactly why we came up with microbio, because this is an assumption on the food that we are making. Now we want to do a culture media testing. Culture media testing में for Bacillus cereus, let's assume it's Chinese fried rice. So then what is with selective media? Ma'am, we go in for MIPA PEMBA. Do I need to remind you? I mean, because YouTube will have its own licensing restrictions, I couldn't play the video in class, but I hope all of you remember that there is a Bacillus cereus, a serious politician saying, yes, everyone has started writing rumba rumba, hai na, rumba rumba she started saying in one of her rallies and speeches. So now that rumba rumba of that serious politician we have converted into MIPA PEMBA. In case you've not seen, that rumba rumba now is a very famous song which people have made with lots of nice beats and music. You must listen to it today. It's a 1-minute song. So that homework, today's homework is listen to rumba rumba song on YouTube. So okay, MIPA PEMBA is what is the culture media for Bacillus cereus. Okay, but what if I wanted to do the diagnosis of Staphylococcus aureus? Ma'am, Staphylococcus में क्या क्या photo आएगा? This is all in front of you. This time I've tried to make the LRR PDF of bacteria all the more concise कि जितनी कम slides होंगी इनको उतना अच्छा feel good factor लगेगा. But information is the same. I mean, I've tried to squeeze in everything, but on one page ताकि flashcards easy बन जाए. When I talk about Staphylococcus, do we all know it means it is going to look like a bunch of grapes? Common sense. When I say aureus, what is AU? AU for gold. I can see there is a golden color pigment, AU for gold, and common sense is Staphylococcus ka staphyloxanthin pigment hoga. Yes, ma'am, this is also common sense. They will ask you what is the selective media for Staphylococcus aureus. Samosa, as everyone started saying. Very good. So a lot of food that we will talk about. Staphylococcus aureus ka selective media is mannitol salt agar. Now what is mannitol? Obviously ma'am, mannitol will tell you कि डिफरेंस क्या कि मैनिटॉल फर्मेंटेशन हुआ या मैनिटॉल फर्मेंटेशन नहीं हुआ. सो व्हेन मैनिटॉल फर्मेंटेशन हैपेंड, व्हाट कलर डिड यू गेट? यू गॉट अ येलो कलर. बट मैम, ओरिजिनली द कलर वाज रेड, बिकॉज व्हाट वाज द ओरिजिनल इंडिकेटर? द ओरिजिनल इंडिकेटर इज फिनॉल रेड. हाउ डू वी लर्न इट? दैट व्हेनेवर you eat a samosa, you always eat a samosa with best samosa is not the samosa that you get in a restaurant. The best tasty samosa is the one that you get roadside. Most unhygienic samosas are the tastier ones, and they always give it with the most unhygienic red chutney, and that is how it is. It's the most unhygienic but the tastiest, right? So that samosa comes with red chutney. So samosa always has to come with something red. That is, indicator is going to be phenol red. Perfect. Now this means that mannitol, ma'am, number one is a differential media. Differential because it tells me a difference. It is an indicator media because it has a phenol red indicator. It is also a selective media. Why? Because it has salt. Selective का क्या मतलब होता है? That selectively, like if I am a very bad teacher and I say selectively, एक ही बच्चे को टॉप कराओ एंड बाकी सबको गलत गलत इन्फॉर्मेशन बता दो. सो देन आई एम बीइंग सिलेक्टिव. आई एम ओनली टेलिंग प्रॉपर LRR इन्फॉर्मेशन टू वन स्टूडेंट एंड देन अदर्स आई एम गिविंग रॉन्ग इन्फॉर्मेशन, गलत PDF अपलोड आई एम डूइंग. देन आई एम बीइंग सिलेक्टिव एंड बायस्ड टूवर्ड्स वन स्टूडेंट ना. दैट इज अ सिलेक्टिव मीडिया. दिस विल अलाउ Staph aureus to grow, but it will not allow the other bacteria to grow. That is what is meaning of salt. So please remember this. Please remember this. A question आता है, mannitol salt agar is differential plus indicator plus selective, all of the above. तीनों टाइप का मीडिया. सो द समोसा स्टोरी इज डन. हाउ आई थिंक दिस क्वेश्चन विल कम, ये तो आएगा. दे विल से देयर इज अ डायग्नोसिस ऑफ स्टाफाइलोकोकस ऑरियस बीइंग कंसिडर्ड. व्हाट इज द सिलेक्टिव मीडिया दैट यू विल यूज फॉर द कंफर्मेशन? देन यू विल यूज मैनिटोल सॉल्ट अगर. अच्छा, इसका ट्रीटमेंट कैसे करते हैं स्टाफ ऑरियस का? बिकॉज यू नो ट्रीटमेंट वाला क्वेश्चंस आर वेरी वेरी फेमस. द ट्रीटमेंट ऑफ स्टाफ ऑरियस इज डन बाय बीटा लैक्टम्स. बीटा लैक्टम्स, तो ऑब्वियसली मैम यू आर टॉकिंग अबाउट व्हाट? यू आर टॉकिंग अबाउट पेनिसिलिन. देयर इज नो डाउट अबाउट इट. बट आजकल व्हाट इज पेनिसिलिन? इफ आई जस्ट आस्क यू बीटा लैक्टम का मैकेनिज्म ऑफ एक्शन क्या होता है? बिकॉज आई हैव समथिंग कॉल्ड नैमनैग, 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 विच इज गोइंग टू बी written over here. What is this, guys? So ma'am, ये तो हमें याद आ रहा है, NAM, NAG, NAM, NAG, and then you had told us that NAM and NAM are connected by these pentapeptide, because Staph aureus क्या है? Staph aureus is gram positive, so gram positive में तो pentapeptide था, बस this is what penicillin goes and breaks. Penicillin says कि अच्छा इनका ना वो pentapeptide break कर दो, इनका cell wall गया, Staph aureus का cell wall गया. But do you think Staph aureus is that innocent and naive? Not at all. Staph aureus says to hell with your beta-lactam. I will now make beta-lactam resistance. How does it make beta-lactam resistance? By making a gene called the BLA gene. So obviously for beta-lactam resistance वो क्या gene बनाएगा? BLA gene बनाएगा. कैसे बनाएगा मैम? Will it make it by chromosomes? Will it make it by plasmid? So please remember, it is going to be by BLA by PLA. BLA by PLA. So remember, the BLA gene is made by plasmid. It is plasmid coded. So now once the beta-lactam is resistant, what do we give? We give methicillin. But then bacteria says, to hell with you, I will now do methicillin resistance. How did it do methicillin resistance also? ME for methicillin, ME for MEC-A gene. तो simple, beta-lactam के resistance के लिए BLA gene, methicillin के resistance के लिए MEC-A gene. Now what will you do? Ma'am, now my option is vancomycin. तो पहले दिया penicillin, resistance हुआ, I give methicillin. फिर resistance हुआ, I give vancomycin. Now this bacteria is so bad, it has become vancomycin resistant Staph aureus. By which gene? By the VAN-A gene. जो drug का नाम वो gene का नाम. Penicillin के साथ BLA, methicillin के साथ MEC-A. With vancomycin, it is VAN-A gene. And then you are like, okay ma'am, we can give daptomycin, we can give linezolid. Then the list is endless. फिर तो resistance होता जाएगा. Then I can't keep learning beyond it. Then we go in for what? Then I will just leave it to the microbiologist and say, you do antibiotic sensitivity testing. How will the antibiotic sensitivity testing be done? Kirby-Boyer disk diffusion method. I'm writing short forms because I've taught you yesterday. Remember that Kirby-Boyer disk diffusion method, zone of inhibition, first question of yesterday's LRR that we studied. Then the the microbiologist will do that and will let me know which antibiotic is sensitive. Does Kirby-Boyer disk diffusion method tell us the minimum inhibitory concentration? No ma'am, it will not. If you want to know the minimum inhibitory concentration, then you will have to do the epsilometer test. This is something which I have taught you, hence I'm writing chota chota. But if you haven't seen yesterday's LRR, please go ahead and see that. Okay, moving on to the next one. The next question over here is this. There's a 25-year-old male who presents with complaint of fever and vomiting. आज सबको या तो vomiting होगा या diarrhea होगा. If not, then meningitis होगा. So he has also had pastries from the restaurant 5 hours ago, which after with the symptoms appeared. Within 6 hours incubation period, pastry, मान लो, pineapple pastry with a lot of cream, lot of milk product, assume it. The doctor diagnosed it as food poisoning. Which enterotoxin cannot be responsible for this? Ma'am, enterotoxin का तो मतलब ही है ना food poisoning. But which enterotoxin? Imagine the irony. F वाला enterotoxin does not cause food poisoning. So the rule is that when we are talking about Staphylococcus aureus, all the enterotoxins cause food poisoning except enterotoxin F. What is it known as? Very good ma'am, इसको बोलते हैं toxic shock syndrome toxin. So it is going to cause toxic shock syndrome. How I have learnt it and you've also learnt it as I have seen. If F for female and F for fatal, मतलब F वाला तो बहुत deadly disease कराता है ma'am, toxic shock syndrome. Why in females? Because there will be a history of retained tampon usage during the menstruation. So if the tampon was used and it was not changed, that could have had infection, Staph aureus, and that causes toxic shock syndrome. What is the reason for so much of shock and toxicity? Because this toxin is a super antigen. It is not a normal antigen. Every previous year question, all enterotoxins cause food poisoning, but enterotoxin F causes toxic shock syndrome. Why does it happen? Because of retained tampons. What kind of an antigen is it? Super antigen. All your MCQs, PYQs are settled over here. I move on to the next question. Give me an answer. पहले तो photo देख लो. Photo will help you a lot, right? Photo will help you a lot. Now coming to, we will talk about all these antigens also. Which is the feature or the test that will be characteristic of the organism in the patient who presented with meningitis? I told you ना, या तो vomiting या diarrhea या meningitis. तीन चीजें चलेंगी आज. CSF sample was examined using gram staining and photo has been given. And you have to tell me that what are the features or the tests that will be characteristic over here. So पहले क्या बनाया? If I just zoom in once and show you, ma'am, एक capsule वाला organism है, that I've understood. And this is not a single bacteria, this is a diplococci. There are two bacteria present. Okay, so now what do you mark? सोचा क्या, इज दिस मेनिंजाइटिस? ओके, मेनिंजाइटिस में क्या क्या मैम, एक तो मुझे याद आता है नाइसीरिया मेनिंजाइटिस. ओके, इज दिस नाइसीरिया मेनिंजाइटिस? Is this Neisseria meningitis? No, it is not. Why? Because Neisseria meningitis is going to be gram negative. And are gram negative organisms purple in color? No, this is purple in color. I have to think of a gram positive organism. And the answer to this, am I not getting answers or are you guys not giving? Okay, sorry, there was a lag. I was waiting कि कोई कुछ बोल नहीं रहा. Suddenly everyone has gone silent. No, there was silence in my phone. So yes, most of you have started giving Streptococcus pneumoniae as the answer. Yes, because I expect pneumonia will cause pneumonia, but pneumonia also causes meningitis. Now pneumonia is, you are saying it is what? Catalase negative, optogene sensitive. Okay, that's a tough question to deal with. So I will have to start off with Streptococcus family. Staph की बात खत्म. Now let's come to Streptococcus. Streptococcus का division is done how? On the basis of how does it break the blood. Alpha breakage, beta and gamma. Alpha, beta, gamma. अगर alpha breakage होगा, so what is the color that you are getting? मैम जैसे alpha लिखते हो, you will fit a G in it. So alpha hemolysis is going to give a green color. Okay, beta hemolysis gives what color? Beta के साथ Y आ जाता है तो beta hemolysis gives yellow color. Gamma मतलब no hemolysis, इसमें कोई change नहीं होता. The blood is as it is, same वैसे red का red. So green color, yellow color, no color. That is alpha, beta, gamma. What comes under alpha? VP comes under alpha. Streptococcus viridans and Streptococcus pneumoniae. What comes under beta? Anyone? Is there a classification for beta? ये question भी है, जल्दी से बता दो. What is the classification that you have? Landsfield classification. Very good. क्या होता है Landsfield classification? C. It is based on the C antigen. They ask you the basis of the Landsfield classification question. C antigen पे होता है. Remember in patho I kept telling you group A beta hemolytic streptococcus, group B beta hemolytic streptococcus. Finally it comes group A beta hemolytic streptococcus is Streptococcus pyogenes and group B beta hemolytic is Streptococcus agalacti जो अभी हम पढ़ेंगे. Finally ma'am, the gamma hemolysis one is going to be Enterococcus. This I've given you an overview of almost the next 1 hour of your rapid revision videos. This is exactly what it is all about. Coming back to my question, which was on Streptococcus pneumoniae. So which family? Alpha hemolysis. Alpha hemolysis कौन सा color? Green color दिखा मैम मुझे यहाँ पे. Now they will ask you, अच्छा there are two members under it, viridans and pneumoniae. And all of you are saying मैम pneumoniae is HOD का favorite बच्चा. Who is HOD का favorite बच्चा? जो हर काम को yes बोलेगा. From writing the word notes to making tea for the department people, he will say yes to everything. So you give him 3 responsibilities, that is Streptococcus pneumoniae, and it is going to say yes to everything. HOD का favorite बच्चा. So if you say bile solubility करोगे, it will say yes. Inulin fermentation करोगे, it will say yes. Optogene sensitivity show करोगे, it will say yes. So it will say yes to everything. Okay, HOD का favorite बच्चा will then be guarded by the HOD. Now obviously HOD will save such a बच्चा कि oh, he is doing all my work. So number one, the HOD will make a guard around him. He will always keep that बच्चा guarded, capsulated. And second, the HOD will say तुम्हारा thesis तो I will sign and your MD exam I will pass you because you have done so much of work. तुम क्या करो? तुम chill करो. तुम कैरम खेलो, लूडो खेलो, play other board games, chill in life. So what kind of colonies will Streptococcus pneumoniae show you? It will show you carom coin colonies. You can see these carom coins over here. It will show you carom coin colonies. Yes, ma'am, matlab center में. Is that बच्चा doing a good thing by doing superficial buttering? HOD को तो 3 साल खुश रखोगे, but later in life you will end up not getting any skills. You are doing a bad thing for yourself. So draughtsmen, you are putting yourself in a drought and in a bad situation. Carom coin colonies को बोलते हैं draughtsmen colonies. One more thing, any organism that has a capsule, is there a test that is done? The test is known as Quelang reaction. Any capsulated organism, which testing can be done for capsule? Many of you had written Quelang, so it is Quelang reaction. Treatment में क्या? सबका beta lactam, staph का भी beta lactam, Streptococcus का भी वही penicillin beta lactam चलेगा. So remember, says yes. उसके बाद guarded रहता है, chill करता है, carom खेलता है, and Quelang reaction. I think this is settled. Streptococcus pneumoniae. Whereas viridans says I am not wanting to be any teacher's favorite bacha. Will I show optochin solubility, inulin fermentation, optochin sensitivity, bile solubility? Nothing. No bile solubility, no. Inulin fermentation, no. Optochin sensitivity, no. वो कहता है देखी जाएगी. I don't want to be buttering someone. So that is going to be Streptococcus viridans. Now please note, viridans एक family का नाम है. It's an entire family. Many things come under it. If they only write viridans, they are wanting to tell you a bacteria present in chains, and that is going to cause what? Then it is going to cause PV, prosthetic valve endocarditis. So I've made a small heart in case you don't understand later on. If they say there is a bacteria present in chains and causing prosthetic valve endocarditis, it is going to be Streptococcus viridans, because what people do is whenever they see a bacteria present in chains, they always write Streptococcus pyogenes. But Streptococcus pyogenes to sore throat कराता है, तो chains देख के नहीं आंसर करना. They say chains with prosthetic valve endocarditis, mark viridans. They say chains with sore throat, then mark Streptococcus pyogenes. But if they say in this family there is one more member called Streptococcus mutans. Mutans क्या करता है? Mutans mouth में जाता है. Mouth में जाके it causes dental caries. Imagine, we've been telling people all around us all our life कि oh, you have dental caries, दांत में कीड़ा, you have poor hygiene. But do you know the name of the bacteria that causes dental caries? Imagine as a doctor not knowing that, because I can imagine and totally guarantee this also that most students don't know this. Even I did not know it back then in my time. So please note, Streptococcus mutans causes dental caries, which is very important to know. Coming all the way back, अब मैम हमने ग्राम स्टेनिंग पे ये कैप्सूल वाला ग्राम पॉजिटिव बैक्टीरिया देखा, निमोनिया, एचओडी का फेवरेट बच्चा. एचओडी का फेवरेट बच्चा हैड टू बी bile solubility not mentioned, inulin fermentation not mentioned, optochin had to be sensitive, and along with that these are not catalase. Streptococcus and staph में से the basic rule, staph is going to be catalase positive and Streptococcus is going to be catalase negative. That is the basic rule. Today you will get a lot of bonus slides. So all these catalase positive, oxidase positive, urease positive, hosts, drugs, ये सब I have compiled for all of you, and in the end of today's PDF you will notice एकदम से 20 slides are extra, but those 20 slides are for you on the last day that you have to read through those mnemonics of rapid revision. Coming to the next question guys, there is a patient who presents with complaints of red sore throat. हमारी country में sore throat and bacteria, I don't even want to think further. I want to write Streptococcus pyogenes, then they have written hoarseness, redness, condition was diagnosed as pharyngitis, and see, they agree with me, Streptococcus pyogenes. Which family? This is known as GABS ma'am, group A beta hemolytic Streptococcus. Beta hemolytic का कौन सा classification? Lancefield classification. What is Lancefield classification based on? C antigen. सारे questions हो गए. अगले पे चलते हैं. This I just got as a quick test for you. Next question. There's a patient who presented with complaints of stuffy nose, sore throat, back to sore throat. अपना diagnosis बनाते चलो. I think it is Streptococcus pyogenes. Cough, sore, hoarseness, voice in the morning session of the OPD. Okay. Doctor decided to send the sample for culture. The microbiologist did a culture on blood agar that has been shown over here. Identify the organism showing this bacitracin sensitivity. अगर ध्यान से देखो blood agar तो ठीक है, I can see over here. And if they are saying bacitracin, so this disc that they have put over here must be of bacitracin. Let me zoom in and see. So they will realize that acha ma'am, bacteria are everywhere, but around bacitracin the bacteria are not growing. Can you see the bacteria have stopped growing? Oh, bacitracin is sensitive. As soon as they say bacitracin is sensitive, I will think of Streptococcus pyogenes. Anyway, if I would have gone by the sore throat wala logic also, it was Streptococcus pyogenes. Many of you are saying wide zone of hemolysis. यहाँ पे hemolysis नहीं देखना था. Dr. Avinash, although your answer in that way also has come out to be right, but over here you're not waiting for hemolysis. You have put a disc over here of bacitracin. You are trying to see the inhibition. So this is bacitracin sensitivity, which tells me that ma'am, what all questions can I get for this GABS? You will tell me. Number one, you are saying कि ma'am sore throat तो हमें पता है. बच्चों में पीडिया में एक फीवर जिसका स्ट्रॉबेरी टंग भी होता था, स्कारलेट फीवर, रिमेंबर गाइज? एंड स्कारलेट फीवर में आई एम मेकिंग अ स्ट्रॉबेरी बिकॉज होपिंग यू विल नो कि अच्छा स्ट्रॉबेरी टंग था इसके अंदर. एंड सेकेंडली देयर वाज वन रैश which you guys had told me there also in patho also, sandpaper rash. Yes, but apart from that, where else did you study Streptococcus pyogenes? One disease of the heart, that is rheumatic heart disease, and one disease of the kidney, that is with cola color urine, post streptococcal glomerulonephritis. Itni jagah we have studied. Very good. when microbio answers come back to back, it gives me a lot of happiness. Forget you, I become very happy कि चलो अभी इतना आंसर कर रहे हैं, इसका 60-70% भी एग्जाम में याद आ गया ना, with all the other miscellaneous things happening around, they will be able to sail through it. Coming back, सबका ट्रीटमेंट बीटा लैक्टम चल रहा है तो वो तो अभी तक कॉपी पेस्ट चलाओ. नाउ कमिंग टू दिस स्टोरी ऑफ स्ट्रेप्टोकोकस पायोजीन, सब कुछ मैम विल गो पाई 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 वाई पाई ऐसे ही चलेगा, ठीक है. आई विल कीप सेइंग पाई पाई थिंग्स. So if I ask you what is the transport media, something with pi, the transport media is the Pike's media. Okay, one more thing. Today, one more flashcard that I've added in the bonus slides is जो सब लोग इधर उधर भटकते रहते हैं, ढूंढते रहते हैं. Can you write, ma'am, all the culture media in one place? So I have done that for you. अभी तो I will teach you question wise, but at the end in bonus, all the culture media of all the bacteria have been written as 5 flashcards in one place. Exam से एक दिन पहले just flip through those so that you have everything in one place. Coming back, transport media is going to be Pike's media. What is gram stain? दिख रहा है ना? Gram stain, ma'am, it is present in chains. Be very cautious when they say there is a bacteria in chains causing sore throat, streptococcus pyogenes. Same chains would have been causing prosthetic valve endocarditis. You would have written streptococcus viridans. Please chain देखकर you are not going to only stick to one. Chain के साथ क्या? Sore throat तो pyogenes, prosthetic valve endocarditis तो viridans. Coming to blood agar, many of you like Dr. Avinash would also saying कि मैम wide zone of hemolysis दिखता है, सब कुछ y pi pi ऐसे चलेगा. Now coming to selective media, when I write streptococcus pyogenes, the selective media, if I ask you what is the selective media, you will say सबसे पहले antibiotics वाला PNF media होता है. Number 1 is PNF media. Then YV, any stain that comes to your mind, YV के साथ crystal violet. So this is not a blood agar, simple blood agar नहीं. Crystal violet blood agar is what is the selective media for streptococcus pyogenes. I want to ask a question. There are only 2 crystal violets path micro मिला के, after that in 19 subjects नहीं होगा. तो crystal violet and hemat, ma'am, you had taught us. All the bodies can be stained by normal stains like Heinz body, Pappenheimer body, but एक body था which cannot be stained on Romanovsky stain. One body of G6PD deficiency anemia जिसके लिए crystal violet लगा था, that was Heinz bodies. तो simple ना, crystal violet का पैथो का question, crystal violet is going to be used for Heinz bodies. Crystal violet का micro का question, that crystal violet blood agar is the selective media for streptococcus pyogenes. हो गया, सब कुछ इंटीग्रेट होने लगेगा. इफ यू गिव इट टाइम आफ्टर 4-5 days, इफ यू कीप स्टिकिंग टू अ सब्जेक्ट, स्टिकिंग टू द इंटायर लूप ऑफ इट, यू स्टार्ट गेटिंग थिंग्स बैक टू योर माइंड. फिर वो इतनी जल्दी निकल भी जाता है. वंस यू विल एग्जिट दिस माइक्रो LRR पैथो LRR लूप, यू विल सी आफ्टर 1 week मैम के साथ याद आ रहा था, अब खुद से कुछ याद ही नहीं आ रहा. दैट मीन्स यू विल हैव टू कम बैक वंस अगेन टू दिस PDF एंड वीडियो ऑन योर ओन ऑल्सो. But once you get into the loop, you will start integrating it yourself. Coming back to the biochemical reactions, again I will write streptococcus pyogenes once again because they will ask you what is the antibiotic status. It is bacitracin what? Sensitive, and it is which test positive? It is PYR test positive. सारे reactions हो गए याद, and everything is in one place. So pi Y is for pyogenes. Coming back, bacitracin sensitive बोला था, अच्छा मैम streptococcus pyogenes की बात होगी. Is that okay? Coming to the next question, easiest baby question. बहुत सारे clinical vomiting हो गया. Now let us come back to the test. This is simple test, ma'am. This is known as CAMP test. CAMP is the name of 2-3 scientists. क्रिस्टी, एटकिंस, मंच, पीटरसन. तो नहीं याद करना ना, साइंटिस्ट का नाम थोड़ी याद करेंगे, इतना टाइम नहीं है हमारे पास. कैंप टेस्ट इज नॉट साइक्लिक AMP टेस्ट, इज व्हाट आई वांट टू टेल यू. सो मेनी स्टूडेंट्स से मैम वो साइक्लिक AMP था. नहीं, कैंप इज डिफरेंट, वो अलग है, साइक्लिक AMP अलग, ठीक है. दिस इज द कैंप टेस्ट, एंड कैंप टेस्ट इज डन फॉर विच ऑर्गेनिज्म? इट इज डन फॉर स्ट्रेप्टोकोकस agalacti. Please, only for streptococcus agalacti. Gala time in camp, you are saying very good. Gala time, okay, gala time in camp तो याद रहेगा. But how will someone, I mean I'm not promoting anything, but gala time के लिए मैम little alcohol तो required, which is that tumbling tully friend of yours, listeria, which means that one more organism that can have a gala time in the camp is going to be listeria. So camp test positivity, if asked to all of you, please note, I will write it once again. Camp test positivity, if asked, is going to be by gala time with little alcohol, so that is going to be gala time, and listeria is going to be camp test. If I ask you reverse camp camp test. That is for which bacteria? That is for Clostridium perfringens. How will I know in the exam, ma'am? दोनों का photo ना same दिखता है. Camp and reverse camp का, you will have to look at these labeling. So everyone draw with me. I have these two red वाले blood agars. Common sense दिख ही रहा है blood agar. They will have vertical line, horizontal line, vertical line, horizontal line. दोनों में the horizontal line is going to be gala. Gala time तो मैम एग्जाम के बाद आराम से चिल करके लेटेंगे, नेटफ्लिक्स देखेंगे. तो gala time is like lying down and chilling in life. The standing line is going to change. If the standing line is Staph aureus, then they are talking about the camp test. And if the standing line is Clostridium perfringens, that is going to be reverse camp test. So I have taken you out from the zone of exam. One day you will reach that phase in life where you will have a gala time in case you consume alcohol, पर नहीं करना चाहिए, but in case you do, you will have a gala time in the camp. So that camp test is going to come in your life. That is, what do you want to achieve? What is your immediate goal in life? Exam खत्म हो मैम, camp test हो मेरे साथ life में. That is what I want. That is what I am aiming for. इसीलिए पढ़ाई कर रहे हैं. Okay, moving on to the next question over here, which is there's a doctor which sent the patient sample having suspected to have Neisseria infection in the laboratory. Which of the following test can be used to differentiate gonorrhea from meningitis? ये question बहुत बार देखा है. Okay. Someone said, ma'am, we will drink cold coffee. High five, Dr. Parul. You are like me. But then nothing used to change for me also. Before the exam finished also, I was surviving on coffee. After the exam finished also, I was surviving on coffee. But the stress levels were different. I mean, the enjoyment of coffee was very different. Exam में जो coffee पीते थे, वो it used to be with a lot of tension. After the exam, the taste of the same coffee and the milk used to change. Okay, coming back. Neisseria, meningitis, ये सब बाद में, don't distract me. Meningitis versus gonorrhea, कैसे differentiate करोगे? You are saying glucose fermentation से differentiate करोगे. Okay, but the thing is कि gonorrhea में भी glucose fermentation होता है, meningitis में भी glucose fermentation होता है. तो difference कैसे करोगे? दोनों में होता है. To differentiate, you will have to use something that is only happening in one of them, that is maltose fermentation. So now that means I'm going to make you make an entire table. Ma'am, question आना is like a headache because you start off with the entire table only. और वही तो करना है. If you feel that I will only do अच्छा glucose, maltose खत्म, then that my LRR can also finish in 1 hour and I'll be so happy. But my point is कि when a question comes to you in your Q bank, go back to your notes. Don't read explanations again and again. So many students are coming back to me saying that ma'am हमारा Q bank खत्म ही नहीं होता. See, over here you knew the answer is maltose fermentation. तो पूरा explanation ऐप से पढ़ने के बजाय come back to your rapid revision notes and read the table from there, and that will give you visual memory also ना. एक बार मेरे साथ पढ़ा, एक बार खुद से पढ़ा, एक बार with the Q bank you study. Read your same notes again and again to create that visual memory, irrespective of wherever you studied from, but get back to those notes only. Coming back, Neisseria meningitis has M and G, so it will show you maltose fermentation also and glucose fermentation also. Neisseria gonorrhea only has G, so it will only show you glucose fermentation. Easy याद हो गया. दोनों का shape, मैम meningitis M की तरह, तो M से हमने capsule बना दिया. It is going to look like a capsule. Sorry, we'll make a lens and a capsule around it. We've made a lens and a capsule. So M से what have we made? M से we have made a lens and we have made a capsule around it, which means it is going to have a capsular polysaccharide. Neisseria meningitis has a capsular polysaccharide. Which serotypes? A, B, C तो याद रहेगा. Only two that I have to learn is W and Y and W135. ठीक है. So Y and W135. Okay, you are saying notes से ढूंढने में मैम GT check 3 दिन में हो जाता है. Okay, that is also another concern. I don't blame you. Can you make topics like, for example, when you are doing GT questions, pick out the system wise, or you can do subject wise. जैसे भी पढ़ाई कर रहे हो, तो subject wise, let's assume you have 20 questions of pathology. You segregate those 20 questions, and then you know कि अच्छा 20 questions में से 5 are from general path. So now you know that with that one copy, you just have to go to the 5 pages and read it. Doesn't mean कि 19 कॉपी सामने रखो, पहले एक सर्जरी का क्वेश्चन पढ़ रहे हो, फिर अगला गायनी का पढ़ रहे हो, then you're flipping through notes, the notes are in the air and you're all lost. That is not what I mean. I mean go subject wise in that situation. Coming back, meningococcal vaccine पे क्या question आता है? Ma'am, if there are 5 types of meningococcal species, vaccine can prevent me only against 4. Which one of them does vaccine not prevent you against? So vaccination for all except not B. Okay, except B, which means that B के against protection is not provided. Okay, and that capsule is not present in gonorrhea. Gonorrhea के पास कोई capsule नहीं होता. Gonorrhea का G and G, सीधा G उल्टा G, what is the shape of it? It is a kidney shaped or bean shape or whatever they may write it. Now I want to show you a picture of gonorrhea which looks nothing like a kidney, but now that is exactly what I'm showing you. They will say there is a patient of gonorrhea. Gonorrhea matlab sexually transmitted disease. Okay, and they will show you these kind of neutrophils, and inside those neutrophils, ma'am, mostly inside them I can see dot dot. बिल्कुल भी कहीं से भी kidney नहीं लग रहा. Not just inside, few dot dot I can see outside. I will draw it and then I will erase it so that you can see it later on by yourself also in the PDF. I will just encircle these. So inside them you can see those dot dot dot. Those dot 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 are the gonorrhea. So be used to this photo. Kidney जैसा पढ़ा है, kidney जैसा दिखेगा नहीं, ठीक है? It is not. Someone is saying it is looking like LD bodies. Agreed, but LD bodies were inside macrophage. कुछ तो history देंगे ना यार. LD body में कुछ तो कालाजार कुछ तो लिखेंगे. They will not leave me open ended with one photo like that. This is neutrophil with dot dot dot, and gonorrhea का मतलब they will give some sexually transmitted disease का history, urethral discharge, vaginal, cervical discharge, कुछ तो लिखेंगे. Something they will have to. Okay, coming to the next. What else? Have I taught you something to do with pili? Yes, we have studied which pili were present in Neisseria meningitidis and Neisseria gonorrhoeae. Ma'am, type 4 pili ये आपने कल पढ़ा दिया था. दोनों का transport media is also the same, that is known as Amy's media. I am writing the same thing over here, okay, same to same. Amy's, how I've learned it, mice is in nice, ठीक है, mice media is in Neisseria. तो Pike's media, pie for pyogenes, a mice media, mice for nice. That is how we study. Culture media अगर करना हो तो that is known as the modified Thayer-Martin medium. दोनों का same, modified Thayer-Martin medium. दोनों का treatment के लिए you are going to give ceftriaxone. Treatment तो कर दिया. Disease क्या है मैम? Meningitis will cause meningitis. Gonorrhea will cause gonorrhea, sexually transmitted disease. ये तो पूछ ही लेंगे. What else? Other than meningitis, what else does it cause? Bilateral adrenal hemorrhage. What is bilateral adrenal hemorrhage? Known as Waterhouse-Friderichsen syndrome. They will give you a case of bilateral adrenal hemorrhage and ask you which organism causes it. Meningitis. Okay, for gonorrhea, STD, so they will give me gonorrhea only, but apart from that, they will also give you something known as Fitzhugh-Curtis syndrome. What is Fitzhugh-Curtis syndrome? जल्दी जल्दी. फिट्स-ह्यूग-कर्टिस सिंड्रोम क्या होता है? एक वर्ड में बता दो. कहाँ का इन्फ्लेमेशन? गोनोरिया का तो नहीं है, मतलब एसटीडी तो नहीं है, समथिंग अदर देन एसटीडी. मैम, इट इज एन इन्फ्लेमेशन अराउंड द लिवर. आई विल राइट इट लाइक दिस सो दैट यू रिमेंबर. हेपेटाइटिस नहीं होता, इट इज अ पेरी हेपेटाइटिस. यस, इट इज अराउंड द लिवर, सो इट इज पेरी हेपेटाइटिस विच आई हैव रिटन. सो नाउ रेडियोलॉजी पे क्या दिखता है? यू टेल मी. मैम ऐसा ना, ऐसे बैंड्स, इन्फ्लेमेशन के ऐसे बैंड्स लगते हैं, तो ऑन रेडियोलॉजिस्ट thinks that it is looking like violin strings. I mean, what a nice imagination. The radiologist calls it as violin string appearance. Now I have another question from point of view of micro only, that ये जो Fitzhugh-Curtis syndrome, I am taking it up on a separate page, is caused by which other organism? Fitzhugh-Curtis syndrome एक तो हो गया Neisseria gonorrhea. Other than that, it is also caused by Chlamydia trachomatis. That is a question you will get in the later part. Chlamydia trachomatis is also going to cause it. Very very good guys, amazing. Coming back, if they want to give you easy वाला question, दे विल से अच्छा एसटीडी के पॉइंट ऑफ व्यू से देते हैं, एंड एसटीडी के साथ लेट अस गिव या तो यूरेथ्रल डिस्चार्ज या सर्वाइकल डिस्चार्ज, बेबी क्वेश्चन देते हैं, बट साथ में दे विल गिव यू दिस फोटो, एंड दिस फोटो यू कांट अंडरस्टैंड. दैट इज व्हाई आई एम सेइंग इस फोटो को एज इट इज जूम इन करके देख लो. न्यूट्रोफिल होगा, उसमें किडनी नहीं दिखेगा, डॉट 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 दिखेगा. दैट इज नाइसीरिया गोनोरियाe, एंड दे विल से दैट अच्छा आफ्टर सम टाइम so much of complication happened that patient ended up having water can perineum. Water can perineum means pus coming out of everywhere in the perineal region. Like a water can होता है जिससे पौधों को पानी देते हैं, you give water the plants, those dot 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 holes are there. Similarly, the perineum has those pus points. That could be another word over there. Okay with everyone? Meanwhile, I can see chat में एक ना कोलैटरल चैट चल रहा है, विच इज़ लाइक गाइनी भी मैम हम इसी में रिवाइज कर रहे हैं, आप अपना करो, हम अपना साथ साथ अपना किट भी रिवाइज कर लेंगे. वी विल रिवाइज अदर थिंग्स ऑल्सो, विच इज़ वेरी गुड, एंड आई एम नॉट डिस्करेजिंग दैट, विच इज़ वेरी वेरी गुड. आई माइट हैव टाइम कंस्ट्रेंट्स, बट वी कैन नॉट ignore that there are going to be other subjects, which is so nice. And if by that reading that, maybe there are some students who are reading your chat and actually learning a lot, which means कि ठीक ठीक आंसर देना, गलत मत सिखाना किसी को. Now coming to 12-year-old boy. that has presented with tonsillar pseudomembrane formation, sore throat, hoarseness in the voice. You might want to answer something only on the basis of tonsillar pseudomembrane. Tonsillar pseudomembrane is going to be what? It is, ma'am, I think it is a case of Corynebacterium diphtheria. जब ये आता है. Apart from that, there are swollen and enlarged lymph nodes, because along with that swollen and enlarged lymph nodes would look somewhat like a bull's neck. This bacha is also a celebrity bacha. Forever I have known that only the same bull's neck photo has come. Like that African child who always has Burkitt's lymphoma, since 10 years his photo is coming. This bull's neck girl is coming since 10 years, same photo comes. Now there is difficulty in breathing. Doctor has sent it for the microbiology culture. All of you say, ma'am, Corynebacterium diphtheria hai, time nahi waste karte. What is the appearance known as? It is known as the cuneiform appearance. Other than cuneiform, you can also in simpler words call it as what? Chinese letter appearance. Perfect. So Chinese letter mein hame I mean, I don't know Chinese, but it looks somewhat like English letters also. V and L and S ऐसे type का features are seen. So this is Corynebacterium diphtheria. I will come to that, but before that, tell me all the others. Where do you see comma shape organisms? Jaldi jaldi batate raho. Comma shape number 1 is seen in Vibrio cholera. Comma is seen in cholera. Comma is also seen in Campylobacter. Comma is also seen in Campylobacter. Okay, coming to the others. ये तो FMG का भी recent exam question था. Bamboo stick लिखे या box car लिखे. It's the same thing. They want to write these dabbas. Write bamboo stick, they write box car, and that is going to be what? BA, that is Bacillus anthrax. Bamboo stick is seen in BA, Bacillus anthrax. Bamboo stick नहीं लिखा था FMG exam में. Box car bacteria was asked. Box car bamboo stick मतलब डब्बा, same thing. Bacillus anthrax. अभी you did medicine LRR. I saw the PDF, so I know you have studied it. अब you cannot say, ma'am, हमने तो नहीं पढ़ा था. Box car nuclei which are seen in cardiac. कहाँ दिखता है? You saw this morning session. I can also tell you of medicine LRR. Utna also I can tell you, so you can't fool me here. Boxcar nuclei are seen where? They are seen in cardiac hypertrophy. The only two boxcar questions that is to do with path micro, but other than that, so there are many, like you have, there are something, maybe you know boxcar ventricles also. Yes, वो भी बता ही दो अब फिर. Cardiac hypertrophy में boxcar nuclei are going to be seen. Then boxcar bacteria are going to be known as the Bacillus anthracis. और कोई boxcar पता है तो yes, Huntington answer I have started getting. चलो very good. I like the collateral chat that is ongoing. Amazing. अब वापस आओ. Come back to microbiology. We are talking about diphtheria. Diphtheria के सारे questions. I can guarantee if you do this, there is no other question that can come. So that means you will spend 5 minutes with me, because diphtheria पे तो एक question आना ही आना है ना. There is like, if the examiner is in a sane state of mind, he has to give one diphtheria question. What do you already know? Corynebacterium diphtheria is known as Kleb Loeffler. इसका जो scientist famous हुआ, that was Loeffler. सब कुछ Loeffler चलेगा. Stain का नाम Loeffler, culture का नाम Loeffler, bacteria का नाम Loeffler. And what is the appearance that you can see over here? This is the Chinese letter or cuneiform appearance. ध्यान से अगर देखो तो these bacteria, their ends are swollen. So this is a bacteria and their ends are going to be swollen like this. So that is known as which granules? Fancy naam, ma'am. One, it's known as volutin granules and Babes-Ernst granules. Practical name hai, they are at the two poles, so that is why they are known as bipolar granules and they are known as metachromatic granules. क्या है इस granule के इतने नाम रखे? What does it have? What do you have for energy? That energy, mitochondria, powerhouse. Your energy is ATP ADP ना, adenosine triphosphate. phosphate से energy आता है मैम. इनको भी phosphate से energy आता है. इनके ATP ADP का नाम क्या है? Polymetaphosphate. Like you are adenosine triphosphate, they are polymetaphosphate. Where is their energy stored? Their energy is stored in the volutin granule. Simple, energy के लिए है, खत्म. अच्छा, so ये जो इतना अच्छा stain granules you told us, ma'am, what are the stains? So what is the plan for the volutin granules? We have a plan for the volutin granules. We have a plan. Now what is plan? P for, try not to see and answer it because you've studied it many times earlier. P for ponder stain. L for Loeffler methylene blue. देखो Loeffler आ गया ना, scientist का नाम Loeffler, bacteria का नाम Loeffler, stain का नाम Loeffler, and Loeffler is the best. This is the best stain. What is A? A for Albert stain and N for Neisser stain. Out of them, they will give you a picture of Albert stain as has been shown over here. Albert stain का आपसे पूछा जाएगा, what is the composition of this stain? Have you started using that song? Do I have to remind you? सबने लिखना शुरू कर दिया, टिम टिम टिम, yes, what is टिम टिम टिम? It is number one going to be toluene blue, then it is iodine, and then it is malachite green. It is malachite green. No one will ask me this question. ये खुद से देख के बता सकते हो that अच्छा मैम एक toluene blue तो कुछ blue blue color, एक malachite green so something green green color. So if I ask you what is the organism is looking green in color, and what is going to be the granules? toluene blue था पर मैम blue तो आपने नहीं बनाया, you made it purple. That is the logic. Toluene blue. This question is not very important for FMG, but for NEET and INI-CET it is very important. Please note, toluene blue जो है is a special stain called metachromatic stain. What is the concept of metachromatic stain? Today I will remind all of you of that topper in your class जो हमेशा बोलता था या बोलती थी that अरे कुछ नहीं पढ़ा, I think I will fail this exam. And then on the day of the exam you used to see कि सबसे ज़्यादा answers, maximum answers he or she is giving. Two-faced. He used to say I have not studied but used to top. Same way toluene blue is going to be two-faced, ma'am. It says that I am going to give a blue color, but ultimately which color did it end up giving? It ended up giving purple color. So two-faced है कुछ और दिखाएगा कुछ और. It's blue in color but it will show a purple color. That is a metachromatic stain. Okay, you call it girgit. Okay, from today onwards the toluene blue is girgit. So now you understand why evolutin granules were called metachromatic granules, because toluene blue is blue in color but showing purple color to the granules. Now we made sense into it. Coming to the next one, what is the enriched media? Ma'am, Loeffler chalega sab. Enriched media is the Loeffler theorem slope. I have a question. Fill in the blank. All culture media have been sterilized by autoclave in your laboratory except Loeffler serum slope and that Lowenstein-Jensen media, which will be sterilized using which technique? Inspissation. All culture media autoclave, but LSS and LJ media inspissation. Kal pada tha. Inspissation was what? Below 100, at 100, above 100. Inspissation was IPL, मतलब inspissation and pasteurization was below 100. Ma'am, मुझे कुछ याद आ रहा है? 80-20, 80-20, 80-20. Yeah, it was a 3-day procedure. 80 degree 20 minute, 80 degree 20 minute, 80 degree 20 minute. याद आ गया? 80-20, very good. बहुत ज़्यादा पढ़ लिया. Okay, Loeffler serum slope is enriched media. In how much time does bacteria grow in it? Within 8 hours. 6 to 8 hours जो ऐसा लिखा होगा, that is what is there. And I think we all remember this mnemonic, which is my kind of favorite thing, that मैम जहाँ कुछ नहीं होता you start doing counting of alphabets. तो Loeffler में भी 8 alphabet, enriched में भी 8 alphabet, तो 8 hours it is going to take. Enriched 8, Loeffler 8, 8 hours. Whereas selective media, you know, out of the best that you have to select, तो best तो हमेशा will be the selective media only. That is potassium tellurite agar. Tellurite is going to give a black color and best है but time लगेगा. That is 48 hours. So now if I have a question before I move forward, the same kind of question comes with fever and lymphadenopathy. मतलब they are trying to tell you about a bull's neck and they say there is a gray membrane, मतलब pseudo membrane. Which of the following medium will you use for early diagnosis? मतलब they want a diagnosis within 8 hours. Then I will be using the Loeffler serum slope na over here. But if they would have asked you instead of early, the question would have been the best culture media that you will use. That will be potassium tellurite agar. So listen carefully. Early के लिए Loeffler serum slope, best के लिए potassium tellurite agar. अब बचे दो चीजें. These are, you know, I have not given questions because then session lengthy हो जाता है. But questions यही बन रहे हैं. Every word over here is a question that I am teaching you. How do you test for diphtheria toxin? Diphtheria toxin. What is the test for toxigenicity? That is known as LX gel precipitation test, and I have got you a photo of LX gel precipitation test. Precipitation word जहाँ जहाँ आएगा ma'am, it is going to be antigen antibody reaction. It is antigen antibody reaction. So examiner सारा काम यहाँ. This is that one place where examiner will do everything for you, and you will sit like a VIP and just say yes or no. बस इतना करके आना exam में, yes या no. Means examiner will say, look what all I have done for you. I have made an entire filter strip. Filter strip पे क्या डाला? Antitoxin. This examiner has done. Then examiner has put one strain over here of Corynebacterium diphtheria that has the toxin. तो toxin यहाँ पर and antitoxin यहाँ पर. तो मैम रिएक्शन तो होगा, यू विल सी लाइन्स फॉर्मिंग अराउंड इट, ऑब्वियसली बिकॉज ऑफ टॉक्सिन एंड एंटीटॉक्सिन तो रिएक्शन होगा. तो कैन आई से दैट इफ द लाइन्स आर गोइंग टू बी विजिबल, इफ द लाइन्स आर विजिबल, दिस मीन्स द टॉक्सिन वॉज देयर. ओके, लेट मी लुक एट द नेक्स्ट सिचुएशन. यहाँ पर एक Corynebacterium diphtheria है, but ma'am over here I don't see any lines around it. This means toxin is not there. Simple. If the lines are not visible, then this means the toxin is not there. Now you tell me, this is another Corynebacterium diphtheria. You see lines around it. They will ask you unknown है, toxin है या नहीं है. तो simple ma'am, lines है तो toxin है. Line present, toxin present. Line absent, toxin absent. So what do? You sit and see. Line दिख रहा है, okay दिख रहा है, toxin है. लाइन नहीं दिख रहा, ओके नहीं दिख रहा, टॉक्सिन नहीं है, नहीं है. सिंपल. दैट्स हाउ VIPU act in LX gel precipitation test. Now my question is, what are you testing for? Toxigenicity. But INI-CET students and NEET PG students के लिए question है, what type of a test is it? It is a DDDD test. What is a DDDD test? This is only for, not for FMG students. DDDD test is double diffusion in 2 dimension. DDDD. Double diffusion in DD, 2 dimension, known as the outer Loney test. How did we learn this in the rapid revision videos? That whenever we say D, 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 it reminds me of that cartoon, Dexter wala cartoon. याद है? Dexter had a sister, a very irritating sister called DD. And whenever DD used to come into Dexter's lab, everything used to break. All his experiments and tubes used to break, and he used to run saying ouch. So whenever they talk about ouch, you have to think of Dexter running as ouch with DD. You think of D, 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 Dexter wala DD, that is double diffusion, because options will be single diffusion in 1 dimension, double diffusion in 1 dimension, बहुत सारा options होगा. तो D, 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 double diffusion 2 dimension, ouch wala outer Loney is LX gel precipitation test. On the other hand, what is the test for susceptibility? For susceptibility, we do the Schick test. In pathology, I gave you one homework. Today I will see whether you did that homework. You had to learn the mnemonics of all the hypersensitivity reactions. Now you will tell me, Schick test is which type of hypersensitivity reaction? It is type 3 bola, 2 bola, 3 bola. Very good. It is type 3 hypersensitivity reaction. Sharp mnemonic. Acha chalo. I sorry for doubting you guys. You did the homework. Okay, my bad. But what is Schick test? Ma'am, you said Schick test is done for susceptibility. Susceptibility matlab you like you say I to got ma'am. I am very confident. मुझे DPT का वैक्सीन लगा था, मुझे डिप्थीरिया का वैक्सीन लगा था बचपन में, ऐसा my mother had told me. Maybe your mother did not know. She was a non-medical. She did not know DPT का लगा या किसी और का लगा. She just told you that you got the vaccine. You now want to find out, am I immune or am I still susceptible? Your question to me is, ma'am, am I still susceptible or am I immune? मुझे vaccine लग चुका है. I will say do a skin test, this kind of a skin test, that is Schick test, which means that if your Schick test comes out to be positive, like over here there is a lot of redness, if it comes out to be positive, this means you are still susceptible. कोई vaccine नहीं लगा था. On the other hand, if it comes out to be negative, this means like over here it has come out to be negative, it is going to be immunity status. ठीक है? So please remember, susceptible कब होगा? When the Schick test is positive. Immune कब होगा? When the Schick test is going to be negative. Don't mess up on these two tests. Please note, toxin के लिए I am doing LX gel precipitation test. Susceptibility के लिए I am doing the Schick test. Now finally your diphtheria questions are done. I don't think they will bother you beyond this for diphtheria questions. More than coming to the next one. Patient presents with, again back to diarrhea story. Watery diarrhea, stomach pain, consumed meat for lunch. Physician send the sample to confirm the organism. Microbiologist has seen capsulated. देखो milk and meat सोच के मैंने Staph aureus सोचा. But then they said capsulated, so I don't think Staph aureus. Non-motile and has subterminal spores. Spore forming organisms. Subterminal spore, I will think of Clostridium perfringens. Why didn't you think of Clostridium bifurmentans? Because bifurmentans has a central spore. Why didn't you think of tetani and tertium? Because tetanus का तो history नहीं था ma'am. But tetani and tertium has what kind of spores? They are going to have terminal spores. So let me just come back to the point of what is this? This is Clostridium perfringens. Tell me 3 things that Clostridium perfringens causes. Number 1, it causes gas gangrene. I don't think anyone is messing up on this. Gangrene का मतलब there will be a history of some kind of a crushing road traffic accident. ऐसा कुछ kind of history होगा जिसके बाद gangrene होगा. So gas gangrene का history. But that is not, that is पुराना question. Now they started saying that does Clostridium perfringens cause a lot of poisonings, food poisoning? Yes. It can cause enteritis, necrotizing enteritis wala food poisoning. Second, it can cause pig bell wala poisoning. So can anyone tell me perfringens jo pig bell karata hai, that is by the consumption of what? It is a food item which we don't consume very often, but it is consumed in foreign countries where it is a combination of pork and sweet potato. So please note, when there is consumption of pork and sweet potato, that is known as, see, pork will anyway remind you of pig na. So remember, it is going to be pork and sweet potato, that is pig bell, and pig bell wala in food poisoning kiske sath hota hai? It is with perfringens. So now I understood that there is some kind of meat, maybe this is pig bell, maybe it is some other meat. Okay, that is perfringens, but how do I do the diagnosis? Yes, Dr. Lakshita, mnemonics सब end में करेंगे जब बिल्कुल थक के we will be dead as hell, then we will do gram positive, gram negative and all of that. Okay, चलो, tell me guys, what will be senior NTR reverse camp? ये तो पढ़ा दिया था मैम आपने हमें, very very good. What else? What else? Senior NTR, a lot of you I am waiting for you to write. What is senior NTR? These are all the tests that you are going to do for Clostridium perfringens. ऐसे नहीं याद रहेगा मैम, please tell us all the फोटोज से याद रहेगा. तो सबसे पहले, व्हाट इज द फर्स्ट रिएक्शन? इट इज स्टॉर्मी क्लॉट फॉर्मेशन. यू विल सी इन दिस इज सेम स्क्रीनशॉट आई गॉट फ्रॉम योर रैपिड रिविजन, सो दैट विजुअल मेमोरी आई एम ट्राइंग टू build in micro. So over here, what do you have? You are going to have number one, the stormy clot formation. You can see a clot forming. So senior समझ आ गया. N for what? N for Nagler reaction. The questions that they will ask you, which is the test or which is the agar that you have used in the Nagler reaction? This is the egg yolk agar that I have used over here. And when you see this kind of a reaction, opaque area ban jayega, that is going to be positive. Nagler reaction tests for which toxin of Clostridium perfringens? Question for NEET PG students. Alpha toxin of Clostridium perfringens is going to be tested over here. So that is known as what? That is known as Nagler reaction. Coming to the next one, senior T से तो दिख ही रहा है मैम, टारगेट हिमोलिसिस. टारगेट हिमोलिसिस में डबल लाइक अ टारगेट, डबल वाला हिमोलिसिस, टारगेट हिमोलिसिस. सीनियर NTR, R for reverse camp test. Now you tell me, who will always be lying down and chilling? Gala time will always be lying down. Then I look at the vertical line. The vertical line tells me perfringens. तो ये कैंप है या रिवर्स कैंप है? दिस इज रिवर्स कैंप. ये तो हम पढ़ के आए हैं मैम. तो सीनियर NTR में सब हो गया. वन कल्चर मीडिया इज लेफ्ट एंड दैट कल्चर मीडिया इज नोन एज RCMB. What is RCMB? For those who have forgotten, Robertson cooked meat broth. Cooked meat broth. Whenever I use the word broth, am I talking about a solid culture media or a liquid? जैसे chicken soup broth होता है. Broth always tells me liquid. So these are the culture media which are liquid and they will be used for anaerobic organisms. Anaerobic का मतलब होता है the ones that do not require oxygen, because every Clostridium species is anaerobic only. So whether they say Clostridium tetani, कहाँ grow करोगे? RCMB. Clostridium perfringens, कहाँ grow करोगे? RCMB. Clostridium tertium, RCMB. Anything that is anaerobic, the culture media that I will use is going to be the RCMB. Okay, finally done. Spore में मैम you just told us something called subterminal. तो एक बार spore का फोटो याद करवा दो. So when I talk about the most common location, most common, तो you told me subterminal. Let us find over here by zooming in. When I zoom in, do you all believe this is subterminal? कि ये तो end है terminal, and terminal से पहले spore is there. Before that, spore के दो questions that you have studied. One, which phase of bacterial growth curve is spore formation occurring in? Lag, log, stationary or death? Spore formation, sporulation occurs in the stationary phase. पहला question तो याद आ गया. Second question, spores are Zn stain acid fast. That I am telling you. You will tell me the concentration of H2SO4 that you will use when you want to do Zn staining for the spore stain. जल्दी कितना? 20%, 5%, 1% और 0.25 to 0.5%. ये भी कल पढ़ लिया, कल वाली चीजें नॉट राइटिंग अगेन. So 0.25 to 0.5%. ये तो पढ़ लिया. Now one question for NEET PG students. एक और stain बताओ spore का. That is known as the modified Ashby's stain. Modified Ashby's stain is also a stain for spores that other than your knowledge I am adding on. जो rapid revision में था, I am just reminding you कि ऐसा भी कुछ था. Now coming back to the location. The most common location subterminal. But then exceptions पूछते हैं. Where do you see terminal? TE for terminal, TE for tetani में terminal, TE for tertium में terminal. टर्मिनल. नाउ यहाँ पर ध्यान से देखो, टेटनाई का ऐसा राउंड वाला होता है, तो क्या अपीयरेंस बनता है? इट लुक्स लाइक द टू प्ले ड्रम्स यू हैव दो स्टिक्स, तो ड्रम स्टिक अपीयरेंस. टर्शियम का थोड़ा सा ऐसा लंबा सा ओवल होता है, तो दैट नाउ स्टार्ट्स लुकिंग लाइक अ टेनिस रैकेट अपीयरेंस. नाउ आई थिंक दिस इज द थर्ड टेनिस रैकेट दैट आई टॉट यू. इन पैथो आई टॉट यू वो कौन सा लैंगरहैंस सेल हिस्टियोसाइटोसिस में कौन से ग्रैन्यूल्स आर देयर which are going to be tennis racket. In LCH it was Burbeck granules that you told me, you guys had only told me yesterday that Dadaji mein you were doing that Dadaji looks like a tennis racket. We were saying that is Giardia lamblia can have a tennis racket shape. Now I'm asking you out of tetani and tertium who is tennis racket. So TER देखो नाम में है TER, tertium is tennis racket and tetani is going to be drumstick appearance. Okay, these are TE tetani, TE tertium, TE terminal. Now I come to central spores. Central spores are seen in Clostridium bifermentum. See, bifid. If it is in the center, the bacteria is divided into two parts, bifid. So bifermentum shows you central spores, and all the spores are also settled for you. How nice. Someone said, ma'am, even Bacillus cereus can show you central spores. Huh? Back to our cereus, वही Chinese fried rice वाला, serious politician wala, Maipa Pemba wala, we've studied that. Cereus is going to show you with spores. Central spores, very good. बहुत ज़्यादा पढ़ लिया, इतना नहीं पढ़ना था. Coming to the next one, 25-year-old male patient presented to the OPD with shortness of breath, fever and chills. He was working in the wool industry. Animal related history has started coming up. The physician sent the sample for sputum culture in the lab. The culture on penicillin showed you string of pearls appearance. Classical, guys, we are dealing with Bacillus anthracis. Now I want to ask you that obviously जो disease होगा that is going to be anthrax. You will write every question of anthrax. There are 5 questions that I'm starting with. Then I will just show you all these photo तो easy है. सबसे पहले if I ask you what is the toxin of anthrax, you will say ma'am anthrax toxin. Usually all the toxins are bipartite. When I say all toxins are bipartite, every toxin has A part, B part, two parts. But anthrax is alag na, anthrax thoda hatke hai ma'am. It is a bioterrorism agent. It is going to be tripartite. It is going to have 3 parts. What are the 3 parts? You will tell me. That is English Premier League. ये English Premier League, EPL, कुछ EPL का combination तो पैथो में भी करा था. I did teach you in LRR, but I've taught you in rapid revision for sure, without which your inflammation chapter cannot be completed at any cost. What was selectins? E-selectin, P-selectin, L-selectin. EPL were the 3 alphabets for selectins also in pathology. EPL are the same 3 alphabets for the toxin of anthrax. What is the toxin of anthrax? Ma'am, सबसे पहले edema factor. ये edema कराएगा. कैसे edema कराएगा? By increasing cyclic AMP. Second is known as the प्रोटेक्टिव फैक्टर. प्रोटेक्टिव किसका? अपना प्रोटेक्शन तो करेगा ना. एंड व्हाट विल इट कॉज टू यू? इट विल किल अस. इट इज गोइंग टू हैव लीथल फैक्टर. इन द एग्जाम दे राइट L फॉर लबाइल फैक्टर. गलत. सी, एंथ्रैक्स इज टेररिज्म एजेंट. टेररिज्म एजेंट तो लीथल होगा. डोंट गो फॉर लबाइल, गो फॉर लीथल. लबाइल गलत आंसर होता है वहां पर. EPL तो यू रिमेंबर, देन L से क्या है वहां? यू आर वंडरिंग इन द एग्जाम. L से लीथल था, L से लबाइल था. यूजुअल एरर्स दैट हैपन एंड दिस इज वेरी कॉमन व्हेन यू आर स्टडीइंग अ निमोनिक हैवी टॉपिक लाइक माइक्रोबायोलॉजी. सो रिमेंबर लीथल बिकॉज इसमें टेररिज्म करना है. सो टॉक्सिन का तो डिफरेंस मुझे समझ आ गया. सेकंड, नाउ एवरी ऑर्गेनिज्म दैट हैज अ कैप्सूल, कैप्सूल्स आर मेड अप ऑफ पॉलीसैकेराइड. ऑल कैप्सूल्स आर पॉलीसैकेराइड, बट एंथ्रैक्स हट के है ना. व्हाट इज इट मेड अप ऑफ? मैम द कैप्सूल ओवर हियर इज मेड अप ऑफ पॉलीपेप्टाइड. अलग. ओके, नाउ यू विल टेल मी द 3 डिजीजेस दैट इट कॉजेज. अगर ये जैसे वुल इंडस्ट्री से हुआ था, सो दैट इज द सेकेंड फॉर्म ऑफ इट. कैन वी कॉल इट वुल सॉर्टर्स डिजीज? अच्छा, पीपल वर्किंग इन द वुल इंडस्ट्री, how will the wool fiber go into their, they will inhale it na. So where will it go? It will go into the lungs. So this is going to cause a form of anthrax known as pulmonary anthrax. Common sense. मान लेते हैं किसी ने एनिमल को खा लिया, देर इज एन कंजम्पशन, सो दैट विल रिजल्ट इन व्हाट? दैट विल रिजल्ट इन इंटेस्टिनल एंथ्रैक्स. तो मैम इसमें जो हिस्ट्री आएगा दैट विल बी दैट वो पर्सन हैज हैड सम अनकुक्ड मीट और सम अंडर कुक्ड मीट, दैट सॉर्ट ऑफ हिस्ट्री. बट इफ समवन इज वर्किंग एज अ कूली, हु इज अ कूली? अ पोर्टर. अ पोर्टर इज पिकिंग अप व्हाट? हाइड. हाइड क्या होता है? हाइड मतलब एनिमल स्किन. एनिमल स्किन उठाने वाला कूली, दैट इज हाइड पोर्टर. एनिमल स्किन, द पर्सन हु पिक्स अप विल ऑलवेज पिक इट अप ऑन हिज शोल्डर. shoulder. He will make a bundle of the animal skin, and coolie kya karta hai? He always picks it up on his shoulder. So that is known as Hyde-Porter disease, which means that the lesion is going to be formed on the skin, and that lesion is going to be an eschar. That means he will always come to you with a lesion on the neck, on the shoulder, because this is where he had kept that entire animal skin ka bundle, and that is where it will develop. So is that okay? I have taught you every clinical question, every micro question. Now let's see wo baby photos of anthrax. This is what you have to see. I think I've already told you, Bacillus anthrax shows you bamboo stick or boxcar appearance. दिख रहा है मैम इसमें वो डब्बा boxcar, bamboo stick. We will be able to identify. Second, this photo will not come in the paper. All of you are used to seeing this photo and saying medusa head appearance. ये वाला photo कट जाएगा. They will only give you this photo. So get used to seeing this photo without the medusa head. इस पर identify करना है medusa head appearance. आधा photo आएगा. You are used to seeing the full photo in rapid revision. This examiner will not give you this. So remember, this is known as medusa head appearance. Coming to the third, they lug right. It's looking like a pearl string. So this is known as a string of pearls appearance. This is string of pearls. PE is seen on which agar? PE, penicillin agar पे दिखता है. And finally the gelatin stab, the gelatin culture, it shows you inverted fir tree appearance. तो सारे gelatin पे जाने से पहले for Bacillus anthracis, one without a photo, what is the selective media? ये tough है ना, बाकी तो photo से दिख ही रहा था. Bamboo stick, medusa head, string of pearl, inverted fir tree. इसमें क्या rocket science है? What is the selective media? प्लेट मीडिया. यू सिंह मैम हमने वो स्किप कर दिया, हम तो इसका आंसर देना शुरू कर दिया. हैंग ऑन. व्हाट इज द सिलेक्टिव मीडिया? इट्स द plate media. This is different, so you will have to learn this. Full form not important. Okay, now we come to the answers that you had already started. Inverted fir tree तो ऊपर लिखा ही है, Bacillus anthracis. सीधा सीधा tree, ma'am, that was inverted fir tree. If I say सीधा सीधा tree is seen in tetany. Tell me something, where did you see the Christmas tree polyp in pathology? ट्री की बात हो रही है तो क्रिसमस ट्री polyp in pathology was seen in Peutz-Jeghers polyp. Where in ophthalmology do you see Christmas tree cataract? अभी ऑफ्था का LRR भी होगा ना एक दो दिन में. So where do you see Christmas tree cataract, ma'am? That is seen in myotonic dystrophy. Christmas tree cataract. Today maybe and derma तो हो गया ना. derma का बताओ. tree man syndrome. Tree man syndrome is because of which virus? The entire body has so many warts that the person starts looking like a chalta firta tree. He's looking like a walking tree. Tree man syndrome is seen with HPV, human papilloma virus, which we will also study today. कौन सा HPV? 5, 6, 11, 16, 18. All of you are saying 6. Are you sure? What तो 6 से होता है, but are you sure tree man syndrome happens with 6? Tree man syndrome. चलो, then I will wait for another half an hour or 1 hour, because maybe I will ask you HPV in some time. 5 से होता है वैसे. चलो, I will come to that. Anyway, सीधा सीधा tree. What is सीधा सीधा tree? सीधा tree is known as Clostridium tetani. And where do you see napiform? Napiform means that if this is the test tube, napiform will look something like a turnip. Okay, it is going to look like a turnip. That is known as napiform, and that is seen with Vibrio cholera. So okay, these are all the gelatin का appearances that we've done. So इसी से related ये question बता दो. Which of the following is not a cultural characteristics of Bacillus anthracis? जल्दी से tell me. Yes, not a cultural characteristic of Bacillus anthracis is what? ABCD, quick. मैम मेडूसा हेड होता है, स्ट्रिंग ऑफ पर्ल्स होता है, इन्वर्टेड फर ट्री होता है, एंड बैम्बू स्टिक भी होता है. सब कुछ होता है, बट नॉट अ कल्चरल कैरेक्टरिस्टिक. कल्चर पे मेडूसा हेड कल्चर, स्ट्रिंग ऑफ पर्ल्स, पेनिसिलिन आगार, इन्वर्टेड फर ट्री, जेलेटिन आगार, बैम्बू स्टिक appearance is not on a culture. It is a gram stain technique that we are going to have. So sometimes everything is right, but you have to select. Read again कि पूछा क्या था. D is on gram stain. Okay, perfect. Moving on to the next question that you see over here. Which toxin utilizes the mechanism that has been illustrated over here? Which toxin is going to utilize the mechanism that has been illustrated here? Botulinum, tetanus, diphtheria, pertussis. If I zoom in, show you every part, because you might not be. एक मसल दिख रहा है मैम, कुछ यहाँ पे हेवी चेन, लाइट चेन, ABCD कुछ लिखा हुआ है, स्नेयर प्रोटीन्स कुछ लिखा है, मेम्ब्रेन नॉट फ्यूजिंग लिखा है, फाइनल लिखा है मसल फाइबर पैरालाइज्ड. ओके, सो इफ इट वुड हैव बीन अ सिचुएशन ऑफ, see, diphtheria तो आपने पढ़ा दिया, it didn't have paralysis. Pertussis is that whooping cough. वूपिंग कफ तो यहाँ कुछ बन ही नहीं रहा, मसल बात हो रहा है. तो इधर इट्स टेटनस और बॉट्यूलिज्म. नाउ टेटनस में तो मसल फाइबर इज टेटनस, कॉन्ट्रैक्टेड, स्पैस्टिक. दे आर सेइंग दैट दिस इज, they've not written the word spastic, plus they have written something called snare proteins. I think it is to do with botulism. Yes, botulism होता कैसे? It is with bottled or canned food. It is going to be with bottled or canned food. So they might say, so many times in the hospital when a newborn baby is there, the parents or the relatives say that हमें उसको 1 spoon of honey, we want to make the newborn baby lick honey. And you're not allowed to do that. For the first 6 months of life, it is completely exclusive breastfeeding. But then they insist, and you cannot fight with them because they will not listen to you. They will make the child lick honey. How do you counsel them that honey is coming from canned and bottled food items, which can be very, very rich in a bacteria, or they may be contaminated with Clostridium botulinum, and then this is going to result in flaccid paralysis. And flaccid paralysis matlab the baby can land up as floppy baby syndrome, which is something you will counsel them and they will not listen to you. वो फिर भी उसे लिख करा देंगे. That's how it works practically. But when I said botulism, I want to compare it with tetanus, because tetanus is opposite. Botulism में तो muscles are totally flaccid, loose, totally gone. Tetanus में on the other hand the muscles are totally contracted, spastic, and दोनों का ना mechanism somewhere works the same. I will actually tell you the next question which you will answer. I'm not asking you the answer. I want to explain this to you. After that you will come back and automatically answer. तो यहाँ पर एक nerve है, यहाँ पर एक muscle है. Ma'am, the simple logic says that if you want to contract the muscle, then you are going to use acetylcholine, and if you want to relax the muscle, then you are going to use GABA and glycine. This is my basic physiology that I know, that contraction of muscle acetylcholine se hota hai and relaxation occurs by GABA and glycine. But these are present inside what? Can I see? I have kept them inside chota vesicles. First these vesicles will have to open, then acetylcholine will come out. First this vesicle will open, then GABA and glycine will come out. For the opening of this, we require certain proteins called the snare proteins. What are the snare proteins? स्नेयर प्रोटीन्स आर जो स्नेयर, स्ना, सिन, ऐसे नाम आते हैं. सो स्नेयर प्रोटीन्स का एग्जाम्पल आर स्नैप 25, सिंटैक्सिन, साइनैप्टोब्रेविन. ये सब स्नेयर प्रोटीन्स. एंड इफ यू लुक्ड केयरफुली इन द प्रीवियस फोटो ऑल्सो, देयर वाज स्नेयर कॉम्प्लेक्स, एंड दे वर सेइंग स्नेयर कॉम्प्लेक्स डिड नॉट form, which means that it is very important that this membrane over here and this membrane over here fuses. तभी तो ये open होगा, तभी तो acetylcholine will come out. Then this membrane over here and this membrane over here fuses, then तो GABA glycine will come out. So basic problem that happens in both the situation, whether it is tetanus or whether it is botulism, is snare proteins are not able to fuse. Now when snare proteins will not fuse, this means acetylcholine will not come out, GABA glycine will not come out. बस अब disease देखना है. When GABA and glycine does not come out, let's assume situation number 1, GABA and glycine does not come out, this means ma'am relaxation will not happen. Acetylcholine is coming out, contraction होता रहेगा, relaxation will not happen. What will that result in? That will result in tetanus. On the other hand, ulta socho, if acetylcholine doesn't come out, there is no contraction, but GABA glycine are coming out, muscle full, relaxed, floppy, that is going to be a case of botulism. So over here, if you notice, the snare protein did not form, as a result of which acetylcholine could not come out, and if acetylcholine could not come out, तो यहाँ पे मैम बच्चा was becoming floppy baby. On the other hand, Clostridium tetanus में क्या हुआ? GABA glycine is not coming out, so सिर्फ contraction होता रहा, and that is due to which tetanus? It is due to tetanospasmin. Please note, they ask you, tetanospasmin is the one that causes spasm. Common sense. I can see the spasm. Look at this person above. He's looking like a bow and arrow. His muscles have spasmed so much that he has undergone opisthotonous position. Look at this person. It looks as if he's smiling. He's not smiling. He's in a lot of pain. Sarcastic smile. ऐसा लग रहा है he's smiling. Why? Because look at all his facial muscles. Everything has contracted. It's pulling his lips apart. It looks as if he is smiling, but he's not smiling. तो spasm क्यों हुआ? Because of tetanospasmin. Tetanospasmin ने क्या करा मैम? It inhibits the release of GABA and glycine. Now they ask you tetanospasmin. इतना सब पढ़ने के बाद क्वेश्चन क्या आता है? Is it oxygen labile or oxygen stable? Tetanospasmin is oxygen stable. Very very important. Now my question is that यहाँ पे था 12-year-old boy with everything becoming stiff. painful muscles, jaw cramping, not able to swallow, jerky movements. On processing, the microscopy shows spores with drumstick. Drumstick was tetanus. Drumstick was tetanus, and tetanus का क्या mechanism है? Inhibition of GABA and glycine. So if they say snare proteins हैं, तो दो चीजें सोचना, either it is tetanus or it is going to be botulism. Then you see कि अच्छा यहाँ पर अगर वो सब होता, tetanospasmin and all would have been written, I would have thought of tetanus. But over here some ABCD is written, which are toxins of botulism. साथ में there will be a history of bottled and canned food. I will go in for botulism. Is that okay with everyone? वो वाला question I'm not asking you यार, you guys have written it. Your collateral chat I'm reading, तो it's बढ़िया ना. That this tetanus is very similar to a forensic medicine का poisoning called the strychnine poisoning. So in tetanus the only difference is that tetanus में जो ये हो रहा है, that is happening presynaptically, whereas when you study in strychnine poisoning, that is going to be the same GABA glycine नहीं release हो रहा, but that GABA glycine का release is happening, not happening post synaptically. I've written it also. Okay, your collateral chat I have written. So tetanus का GABA glycine not getting released and not happening, mechanism of action presynaptic. Over here in strychnine it is going to be post synaptic, which is very very good. Coming on to the question that is done a hat trick in every exam, this has been asked. Why is clad media the preferred choice for culturing organisms in cases of UTI? UTI के patient में clad media use क्यों किया जाता है? You have seen this many times. Okay, yes guys, quickly. I think we'll have another 15 minutes of bacteriology before we start with virology. We are anyway running 20 minutes late, but never mind. Last session, so today I'm not in a hurry and I hope you are not either. You are saying option B because clad allows the growth of everyone. See, who will be a good culture media? Who will not discriminate? Like for example, who will be a good educator, a good teacher? A good teacher will be the one who will not discriminate कि ये average student है या below average है या above average है. Like if I have to teach microbiology, I assume सभी below average है. कुछ assume ही मत करो ना, कुछ expect ही मत करो. Answer दे दिया तो very good, नहीं दिया तो I have to teach. So I am trying to be the clad in your life, that I will allow that someone who has never studied micro should also attend my class, and someone who is a topper in micro should also attend my class. It should be an environment for everyone to grow. That is what clad does. Clad does not know ना patient को UTI क्यों हुआ है, staph से, strepto से, candida से, proteus से, klebsiella से. It doesn't know. So it says anyone can grow in me, and that is why clad is a better media. Others are very restrictive, they are very strict. They will say no, I will only allow E. coli to grow, I will only allow klebsiella to grow. So I don't want that kind of negativity. I want to be clad. I want everyone should be able to learn. So now coming to a very very tough table which you will finish. What am I trying to tell you? Enterobacteriaceae family. तो मैम दो है हमारे पास. McConkey versus clad. What are you saying? Clad is better. I will put a mark over here. But what are both of them trying to tell you? Both of them try to tell you about lactose fermentation versus non-lactose fermentation. Okay, so everything, I can't put MCQs everywhere. So now you will listen to me for 5 minutes where I will finish everything that I write here is an MCQ. So don't ask me मैम याद करना है नहीं करना है, लिखा है तो मतलब MCQ है. Question number 1, McConkey and clad क्या बताता है? Both of them tell you the same thing, lactose fermentation. Which is better? Clad is better. Why clad is better? Because you have written that clad is going to tell you the growth of every organism. So clad is better because it allows the growth of every organism, whether it is gram positive or gram negative. अगला question, McConkey का composition पूछते हैं. The composition of McConkey is referred to as the plant. Remember pretty pink plant? Why pretty pink plant? Because you can see on lactose fermentation, what color did you get? Pink color. And pink color का plant, what are the compositions? This is asked as it is. McConkey का composition. P से पेप्टोन एंड A से आगार. हर आगार में पेप्टोन आगार तो होता है. दिस इज गोइंग टू टेल मी अबाउट लैक्टोज फर्मेंटेशन, तो लैक्टोज डालना पड़ेगा. अच्छा, इफ इट इज टेलिंग मी अबाउट लैक्टोज वर्सेस नॉन लैक्टोज, कैन आई कॉल इट अ डिफरेंशियल मीडिया? बिकॉज डिफरेंस बता रहा है. ओके, इनिशियली देयर वाज सम अदर कलर, देन सम अदर कलर केम. सो मैम यू मस्ट हैव एडेड सम इंडिकेटर. व्हाट इज द इंडिकेटर? इट इज गोइंग टू बी न्यूट्रल रेड. सो इज इट एन इंडिकेटर मीडिया? यस. लास्टली यू हैव एडेड टोरोकोलेट. टोरोकोलेट तो रिमाइंड्स मी ऑफ बाइल सॉल्ट्स. बाइल सॉल्ट तो काफी टॉक्सिक होता है ना. बाइल सॉल्ट विल से दैट नो एवरीवन कैन नॉट ग्रो, ओनली सम बैक्टीरिया विल ग्रो, सम विल नॉट ग्रो. सो दिस मीन्स इट इज बीइंग सिलेक्टिव नाउ, which means McConkey is a differential media and an indicator media and a selective media. That is McConkey. On the other hand, clad says कि यार इतना strict होने की जरूरत नहीं है. Let gram positive also grow, let gram negative also grow, let me be a good person. That is why clad is considered better. Now they will ask you that what is the color that you get on lactose fermentation in clade, the color is going to be yellow. In McConkey it was a pink color plant, in clade it is going to be yellow, and they will ask you the indicator. इसका indicator naturally क्या color लग रहा था? Indicator का मैम naturally blue color लग रहा था. So what is it? BTB everyone is writing, bromothymol blue. ओके, ब्रोमोथाइमोल ब्लू इज द ओरिजिनल इंडिकेटर. तो अब मुझे कल्चर मीडिया समझ आ गए. व्हाट डज दिस फैमिली हैव? इकोलाई, क्लेब्सिएला, शिगेला, सैल्मोनेला, प्रोटियस, यर्सीनिया, सो मेनी थिंग्स. आउट ऑफ देम प्लीज रिमेंबर पंच किस. व्हाट इज पंच किस? Because if someone will punch you, then also your face will become red. If someone will kiss you, then you will blush and your face will become red, pink. So urease positivity जो test होता है always gives a pink color positivity. When will you turn pink in life? If someone will punch us, we will turn pink in life. If someone will kiss us, we will blush and turn pink in life. So punch and kiss is going to be pink. मतलब urease positive को कैसे याद करते हो? With punch kiss. All the others are going to be urease negative. ये तो पता है. Now we come to the next one. Which of them are lactose fermenters? That is E. coli and Klebsiella are lactose fermenters. बाकी सब are non-lactose fermenters. But I have another question. Is there something which is known as a late lactose fermenter? Late सो के उठा, उसको late याद आया कि अरे I also had to do lactose fermentation, मैं तो भूल गया था, just like all of us. सोता रहा, बाद में याद आया. That is Shigella soni. Soni will tell us that oh it is sleeping. Then it woke up late and it said oh मुझे भी तो lactose fermentation करना है. So in the bracket only for Shigella soni I will write late lactose fermenter. Now we come to motility. All of them are going to be motile. But this illa I always used to tell you that illa, all the students from South India would tell me, what does that mean? Illa means no. So then when I say Klebsiella, non-motile, Shigella, non-motile. Salmonella can be both. Salmonella जो typhoid वाला करते हो, that is तो motile. But then there are some other ones also that pulorum and some rare ones, they can be non-motile as well. तो इसका plus minus है. Proteus is going to be motile. Yersinia again has plus minus, so I'll consider it as plus. Overall I want to tell you Klebsiella non-motile, Shigella non-motile, illa वाले non-motile. यहाँ भी याद हो गया. Simple lactose fermenters दो थे, बाकी सब non-lactose fermenter. illa वाले non-motile, बाकी सारे motile. Punch and kiss are going to be urease positive क्योंकि pink. अब बचा IMVIC. मैम ये IMVIC क्या होता है? These are the 4 tests which are IMVIC. नाम देख लो. It will always be written as IMVIC. Indole test, methyl red test, VP test and citrate test. The good news is no one asks you the full form. They ask you पढ़ना आता है IMVIC में क्या positive क्या negative. Whenever IMVIC में IMV will be positive, you will get a red color, and when citrate will be positive, you will be getting a blue color. So repeating, for all of them it is red color, for citrate it is a blue color. So how do I learn? E. coli के लिए it is plus plus minus minus, and Klebsiella के लिए it is minus minus plus plus. How easy? See, now the examiner will say there is a lactose fermenting organism. You'll say अच्छा E. coli भी हो सकता है, Klebsiella भी हो सकता है. How should I differentiate? I'll say do IMVIC testing. If you get plus plus minus minus, that is E. coli, and if it is minus minus plus plus, then that is Klebsiella. Settled. For Shigella, Salmonella, Proteus, Yersinia, you don't have to learn. For FMG students, IMVIC सिर्फ इतना याद करना है. For NEET PG and INI-CET students, please remember I am shy. What is I am shy? So I am shy, we'll write it as a slang. Okay, I am shy will tell me that Shigella and Yersinia are only what? Methyl red positive, which means Shigella and Yersinia are only methyl red positive. That is one thing. I am shy. Now coming to the last one, that is what do I have to know for Salmonella? Salmonella का एक विडाल टेस्ट होता है, वो तो हमें पता है, टाइफॉइड वाला विडाल टेस्ट, in which we study OH antibodies. So we always write it as OH. I have converted that into minus plus minus plus. कि अच्छा Salmonella टाइफॉइड के विडाल टेस्ट में OH पढ़ते रहते हैं, तो that we will convert it into IMVIC also. We will whatever you can make. This is अंडा, so minus, H looks like plus, अंडा तो minus, H looks like plus, minus plus minus plus, सब कुछ याद हो गया. So if I say, can you tell me what organism is this? You should know it is red. क्या होता है? IMVIC. ऐसे लिखा होगा मैम. For first 3 you said red color is positive. For this you said blue color is positive. So if I look at this, सबसे पहले इंडोल में मुझे red color दिख रहा है, M में भी मुझे red color दिख रहा है, VP टेस्ट V में मुझे red color नहीं दिख रहा, and C में मुझे blue color नहीं दिख रहा. So this is going to be plus plus minus minus. What does this become? This is E. coli. Tell me the next one. The next one, tell me one by one. Do you see here? I'll write IMVIC for all of you. You tell me पहले में red color नहीं दिख रहा, दूसरे में red color नहीं दिख रहा. In the third one, I can see a red color, and in the fourth one, I can see a nice blue color. It is minus minus plus plus. What is this going to be? This is a case of Klebsiella. So simple, plus plus minus minus and minus minus plus plus. इतना ही पूछेंगे 99%. That is E. coli versus Klebsiella. Thank God. This toughest, lengthiest table is done for all of you. But now let me see if you guys were listening, because out of these, if I say कि चलो which are the two lactose fermenters, E. coli, Klebsiella, what will you do for lactose fermentation, McConkey and Cled? But then दोनों को differentiate कैसे करोगे? That's the next question. Here you have a 65-year-old diabetic man who presents to the emergency room with a cough having red currant jelly sputum. पढ़ना ही नहीं मैम, red color currant jelly sputum एक ही चीज बनाता है. Klebsiella pneumoniae, currant jelly sputum is Klebsiella pneumoniae. But look carefully. Culture of McConkey agar showed pink colonies, because yeah, E. coli and Klebsiella are going to be lactose fermenters, but they've written something, mucoid colonies are seen. Because now tell me, E. coli, Klebsiella दोनों lactose fermenters, दोनों क्या देंगे? Pink color. But Klebsiella will give something extra. Klebsiella will give something called a string sign. कल कहाँ पढ़ा था string sign? Ma'am, yesterday you had taught us string sign that in the Dadaji, if you have to catch him with a dhaga from the duodenum, Giardia lamblia, you did string sign. Now you are telling me string sign for Klebsiella pneumoniae, and after some time you will tell me for Vibrio cholerae. So that is also settled over here. Okay with everyone? Can I move forward? I got the concept that current jelly sputum होगा, साथ में string sign होगा. I will always mark Klebsiella pneumoniae. Okay, coming to the AIMS exam question, PYQ. Please identify the organism that has been depicted below, which is responsible for the effacement and attachment of intestinal cells. Yes, guys, for the effacement and attachment of the intestinal cells. This is a very C. All of you are saying C, which means EPEC, enteropathogenic E. coli. ठीक है, all of you are right. Tell me one more question, because then I have to teach you another table. E. coli can be classified by their characteristic virulence properties and different mechanisms that cause the disease. To which group does the E. coli O157H7 belong? You are saying again C? Nahi, not C. Okay, B I started getting. Okay, enterohemorrhagic E. coli. Chalo, that is correct. So now for those who didn't know, you will listen to me. These are all the different kind of E. coli, and mostly these E. coli are favorite for causing diarrhea. Usually E. coli for you study for UTI. UTI वाला story हम पिछले question में पढ़ के आए. Now we've entered into E. coli story causing diarrhea. These are all the E. coli causing diarrhea. Which kind of diarrhea you will tell me? One extra question you will tell me. 2-3 मिनट में question खत्म करते हैं. When I write enteropathogenic E. coli, P for what? P for pediatric वाला diarrhea. मतलब मैम it will cause infantile diarrhea. Infants are so nice, cute. बच्चे are so nice. We get attached to them. So that is why they show you attachment effacement lesion. बच्चों से attachment होता है, so there is going to be attachment effacement lesions. That's the photo that I had shown you over here. देखो attach हुआ, and then ये क्या है? What are these? Intestine ना, villi. These finger-like projections, they end up becoming effaced. Attach हुआ, so for example this is attachment, and then the intestinal villi opens up, so there is effacement. Attachment effacement. Villus is going to open up, so attachment effacement lesion बच्चों के साथ होगा. Where do you see enterotoxigenic E. coli? T for T. This is going to cause traveler's diarrhea. Common sense. Enteroinvasive E. coli. Invasion हुआ तो blood निकलेगा. Blood निकलेगा मतलब patient is going to have dysentery. Can I say enteroinvasive E. coli will be very similar to his friend Shigella, because Shigella also causes dysentery. तो दोनों का जो एक टेस्ट है ना मैम, दैट इज ऑल्सो वन वेरी वेरी इन्वेजिव वाला, ब्रूटल वाला टेस्ट कॉल्ड सेरिनी टेस्ट. आई हैव लर्नड इट एज सीरीनी टेस्ट. सीरीनी टेस्ट विल ऑलवेज रिमाइंड मी कि अच्छा ये एंटेरो इन्वेजिव वाले ई कोलाई के साथ था जो ब्लीडिंग कराता था. व्हाट इज सीरीनी टेस्ट? सीरीनी टेस्ट इज सीन इन दीज एनिमल्स. सो व्हाट यू आर बेसिकली डूइंग, यू आर इंजेक्टिंग द ऑर्गेनिज्म. एंड ये देख सकते हो, रैबिट होगा, गिनी पिग होगा, उसको एनिमल में इंजेक्ट कर दिया तो काफी इन्वेजिव है ना. एन एनिमल को यहाँ पे कंजंक्टिवाइटिस हो रहा है, keratoconjunctivitis in the animal. So Serini test is going to be seen in enteroinvasive E. coli, and also it is seen with Shigella. दोनों भाई भाई साथ साथ, same disease, same test. Now coming to enterohemorrhagic E. coli, ये तो कुछ H कराएगा. Hemorrhagic, hemolytic uremic syndrome. Can you tell me medicine में what history comes for hemolytic uremic syndrome? Yes, what question comes? यस गाइस, हीमोलिटिक होगा मैम. क्या क्वेश्चन पूछ रहे हो? हीमोलिटिक अनीमिया होगा. यूरिमिक मतलब किडनी प्रॉब्लम होगा. टेल मी द थर्ड थिंग. हीमोलिटिक होगा, हीमोलिटिक अनीमिया, अंडरस्टूड. यूरिमिक होगा मतलब देयर इज गोइंग टू बी किडनी फेलियर. व्हाट एल्स? ओके, ये तो what I have told you don't write again. Thrombocytopenia, very good, I was waiting for that. Hemolytic anemia होगा. Uremia मतलब there is going to be renal involvement and the platelet count goes down, that is known as thrombocytopenia. I've heard so many people learning it as rat. इसका भी mnemonic बनाते हैं कि अच्छा renal involvement होगा, anemia होगा, thrombocytopenia होगा. कितना mnemonic याद करोगे? ये नाम से जो याद होगा, learn it from the name. Hemolytic anemia, then uremia मतलब kidney. Third thing you learn that is thrombocytopenia. This is caused by O157H7. Very important question. Now a question that I expect in the future exam is that this is the only E. coli which is SMAC negative. SMAC क्या होता है? MAC तो पढ़ा था मैम, मैकोंकी आगार. मैक तो मुझे आता था. मैकोंकी agar was telling me what? मैकोंकी agar was telling me about lactose fermentation. But now I want to study about sorbitol fermentation. So when they write about SMAC, it is basically telling you a McConkey agar for sorbitol fermentation. And I want to tell you that all E. coli are going to be sorbitol fermenters. All E. coli are SMAC positive, but O157H7 is SMAC negative. Please note that. Okay, O158.7 is SMAC negative. बाकी सारे are SMAC positive, 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 positive. Coming to the last one, enteroaggregative E. coli. Aggregate हुआ तो कुछ some धमाका is going to happen. Like if you would have been studying micro alone, it is the most dead and boring subject. But when you study together with so many students here, and I am also constantly telling you पढ़ना ही पड़ेगा, you don't have an option. So ma'am, maybe micro will persist in my mind for a longer time. Aggregate हुए तो persist करेगा. Persistent diarrhea, what is the definition in medicine of persistent diarrhea? More than 14 days. And aggregate करे तो when I saw them under the microscope, they were all aggregated. They were all aggregated like bricks. This is the stacked brick appearance on HEP2 cell lines. Another question. Stacked brick appearance on HEP2 cell line. Perfect. Coming back, first I asked you attachment effacement lesion. Attachment बच्चों के साथ था मैम. बच्चों मतलब pediatric diarrhea. Pediatric diarrhea means EPEC. Next question I asked you was O157H7. That was that enterohemorrhagic E. coli. मतलब that was causing hemolytic uremic syndrome. And you have told us this is the only one which is going to be sorbitol McConkey negative. Okay with everyone, can I move on to the next question, which is this. Jaldi se. This is FMG ka repeat question. 2 sessions ago it was asked. A patient with repeated episodes of diarrhea and fever visited the OPD. The doctor sent the patient for stool examination and culture in the lab. What is the screening procedure used to differentiate Salmonella from Shigella? Usually Salmonella Shigella ko to aap hamesha ma'am you used to call it as Salmonella Shigella sisters, but now you want them to be separated. How bad of you. That is separated how? By Wilson and Blair media. तो पहले तो common बनाओ. When I call them Salmonella Shigella sisters, means everything about them is the same. Enrichment media दोनों का same. By the way, when the word enrichment comes, you will have to use the word broth. मतलब enrichment media, not enriched media. Enrichment media is a broth, is liquid. So selenite F broth, tetrathionate broth, दोनों के लिए होता है. Salmonella also Shigella के लिए. Now we come to selective media. XLD, DCA. DCA मतलब deoxycholate, because selective ना, it will say only I will let Salmonella Shigella sisters grow. I will not let others grow. तो कौन सा? XLD, DCA. But then how do I? तो दोनों में सब कुछ दोनों में positive आएगा. If I have to differentiate between them, I can't use DCA, XLD because both positive. I can't use selenite F broth because both positive. I will use Wilson and Blair. Everyone said that ma'am, Wilson is that bad boy who created a fight between. Finally, Salmonella Shigella sisters have been separated by this boy called Wilson. And Wilson said, obviously, Wilson is not that lucky that he will get both the sisters. He will get only one sister. So he got which sister? He got the trophy of which sister? We have made these two sisters as trophies. So कौन सा trophy win करा? Typhi का trophy win करा. Which means Salmonella typhi is going to grow on Wilson and Blair media. Wilson and Blair, Wilson को किसका ट्रॉफी मिला? टाइफी का ट्रॉफी मिला. Has he done a good deal by breaking the trust between two sisters? Not at all, ma'am. This is a black day in the history of sisterhood. This is a black day in the history of sisterhood. Wilson and Blair media Typhy ka trophy jab win karega, so what color is it going to give? It is going to give a black color. So many stories, hypothetical stories I have started making because of microbiology. This is not something that I used to do in life. This is something I have learned only with this subject. How to make random stories and make random relationships out of nowhere. So remember, Wilson and Blair media is how you will differentiate the Salmonella and Shigella sisters. Moving on to, let me take a break. You answer. On the last day of your MBBS course, the whole class was sent. What a sad last day, yaar. The whole class was sent to the microbiology lab for a Viva exam. Last day of MBBS, forget. Second year MBBS Viva also we passed with so much difficulty. And all the questions were asked for gram positive. Okay. Dr. Sanskar has a question. XLD पे भी तो अलग appearance होती है. See, appearance is different, but that question, I mean, when I ask you that, can you grow both of them on the XLD and DCA? You can grow both of them. So differentiating them becomes very, very difficult and is not easy for a beginner to do. But that one culture media which can clear-cut differentiate them is going to be the Wilson and Blair media. Okay, yeah, coming back. So D and B is what everyone is telling me. Okay, very good. क्या देखा यहाँ पे सबने? Everyone saw swarming. बहुत अच्छा, very very good. और सो जाओ, ठीक है? Don't ever open your brain and answer questions. Because you saw swarming, you said easy है मैम. ये तो अब प्रोटियस ही तो बचा है, सब तो पढ़ा दिया. प्रोटियस बचा है, विब्रियो बचा है, बस खत्म कर देंगे. So you marked Proteus. But did you notice what the Viva was about? Is Proteus a gram-positive organism? Proteus is a gram-negative organism, guys. Enterobacteriaceae family में आता है. It is gram-negative. So out of swarming, you had a mnemonic which was known as PVCs. उसमें से you had to pick up the gram-positive organism. Proteus is a gram-negative organism. Answer गलत. इसलिए I'm saying lunch कर लिया है क्या? That many of you slept off over here. Now ma'am, Proteus answer नहीं हो सकता. Vibrio, parahemolyticus and all. Vibrio is also gram-negative. Clostridium tetani can show you swarming and Clostridium tetani is gram-positive. So over here the answer, last day Viva में भी fail हो गए. Never mind, second year में fail हुए थे तो last day में तो होना ही था. Micro किसको याद रहता है ना? Final year MBBS तक किसको micro याद रहेगा? तो होना ही था fail. But never mind, and that is why I said that just when you think you are gonna relax in the exam is when the examiner is going to come back hunting for you. This was a case of Clostridium tetani, which means that we have forgotten gram-positive and gram-negative organisms. Didn't see gram-positive, hence I am highlighting it. Which now tells me that, ma'am, now is the right time that many of you were asking me gram-positive, negative revise कराओगे. Starting में revise किया होता ना, you would have taken it very casually. Now you've woken up and now you realize the importance कि नहीं यार अब तो याद करना पड़ेगा. I can't take it that casually. So now I'll come back to the first slide of bacteriology which I skipped. Purposely I skipped and now I have come back to it. You will tell me all the gram positive and gram negative. All cocci are gram positive except venom. All cocci, मतलब Staphylococcus, Streptococcus, they are all gram positive except venom. What is V? V for Veillonella, N for Neisseria and M for Moraxella. What are these? These are gram negative. अब सब ऐसे आंखें खोल के देखेंगे अच्छा गलती हो गया है तो then I can't mess up. All cocci are gram positive but venom is gram negative. यहाँ तक हो गया. If all cocci were gram positive then all bacilli are going to be gram negative. So all bacilli are gram negative except McDonald's, because McDonald's का नाम आया तो मैम कौन negative रहेगा? McDonald's का नाम आया तो it's all positive and happy vibes. Right, so McDonald's is gram positive. All bacilli are gram negative, but McDonald's is gram positive. What is McDonald's? M for हमारी country का TB mycobacterium obvious. Anthrax and Clostridium. Clostridium सारे tetanus, perfringens, etc. McDonald's D and D. This means पहला D, last D. So D and D is going to be diphtheria and diphtheroids. McDonald's, no for nocardia and A for actinomyces and L of course for our drunk friend listeria. All of these are what? McDonald's के साथ happy positive vibes. So now tell me Clostridium is what? Ma'am, Clostridium is going to be gram positive. Now I hope no one is messing up. I will come back to this slide. You can see I've left something over here. तो कभी ना कभी तो मैम इस पर भी वापस आएंगे. But for the time being, you answered Proteus and Proteus प्रोटियस गलत है. अच्छा प्रोटियस कब ठीक होता? ओवर हियर इफ दे वुड हैव रिटन ग्राम नेगेटिव आंसर ना, तो देन तो कुछ भी नहीं लिखा होता. मोस्ट कॉमन सिलेक्ट करना होता. आई वुड हैव आल्सो सिलेक्टेड स्वॉर्मिंग देख के प्रोटियस. आई एज अ स्टूडेंट आई वुड हैव डन दैट. इफ आई वुडंट हैव मेड दिस क्वेश्चन आई वुड हैव आल्सो डन द सेम मिस्टेक. इट्स वेरी ह्यूमन टू हैव डन दिस. बट प्रोटियस पे क्वेश्चन आएगा तो what sort of a question will come? Number one, ma'am, swarming will come, which is already written over here. Second, proteus के ऊपर we see a very famous phenomena. If this is, let's say there are two people in a ward, both of them have had urinary tract infection, both of them have had urinary tract infection with proteus only. You want to find out कि patient 1 का जो proteus है and patient 2 का जो proteus है वो same proteus है या अलग अलग proteus है? Because you are very scared that is there one proteus which is causing UTI in all the people of my ward? Is there some kind of an outbreak that has happened? Is it the same proteus or different proteus? तो patient 1 का urine यहाँ, patient 2 का urine यहाँ, दोनों का proteus started swarming. Now you see that when they meet, how do they react? So if they were best friends, if they were same, they would have hugged each other. तो यहाँ से swarming शुरू हुआ, यहाँ से swarming शुरू हुआ. If they would have hugged each other like this, मतलब same होते. But as soon as they saw each other, they decided, look carefully, they decided to take a U-turn and turn back. They decided to take a U-turn and turn back. Exactly what you're going to do with a lot of people the day your MBBS finishes. Because you don't like them. Abhi to majboori hai that you have to stay with them. So you're going to take a U-turn and turn back. Because then you will remember how much they troubled you during exams. This means they are different proteus strains. What is this known as? Dines phenomena. नहीं ये mycoplasma नहीं है, वो Dines stain होता है. Dines phenomena if I am talking about, Dines phenomena means that same strain होगा, तो what will same best friends, they will fuse. Different strain होगा, so can I say there will be a line of demarcation? दोनों एक दूसरे से they are going to stay away from each other. People have started making snake emoticons, which is like just everyone in MBBS. And I totally agree. Right now everyone's very good, but after your MBBS is over, you're left with a group of 5-7 people or even less whom you talk to for the rest of your life. Because by final year, like your first year ka birthday is always celebrated with 20-30 people in your batch, but your final year internship ka birthday is celebrated with less than 5. That's the entire trajectory of how your friendship evolves over MBBS, because you start seeing a lot of real faces by then. Let's keep that discussion for another day. In short, that was Dines phenomena. And now I will ask you, which you've already told me, कि अच्छा Dines stain पूछा जाएगा तो ma'am we are going to answer mycoplasma. That also we are going to know. Coming back, surgery में question आएगा, Proteus causes what? मैम सबसे पहले Proteus was punch and kiss. तो I know Proteus is an enzyme positive called a urease positive organism, and it is going to result in a Staghorn calculus, which it looks like a ginger, to be very honest. Adrak type it's looking, but it's actually a Staghorn calculus. And Staghorn calculus, this I taught you in pathology also. Proteus बनाता है. What is the composition of Staghorn calculus? You had told us that time also that it is going to be triple phosphate. Can I call triple phosphate as the true white crystal also? Remember this. And do you remember in which pH is it going to form? It is going to form in alkaline pH. ये हमने पढ़ लिया. Okay, Proteus. अगर ये Proteus होता मैम, अगर हमारा वाला आंसर होता तो ये सब क्वेश्चन आते. हमारा वाला आंसर नहीं था, ग्राम पॉजिटिव था, so I selected Clostridium tetani. I'm moving on to the next question. I cannot finish now without this. ये तो हर एग्जाम में पूछा जा रहा है. Which of the following is responsible for causing watery diarrhea and cholera by Vibrio? By the way, I just realized it's 2:20, which means I just want to let all of you know कि शायद session 3:30 तक होगा, but please don't complain because today is the last day and I want to cover everything and not skip anything of what I have decided. I had a total of 110 slides और मुझे वो 110 खत्म करनी ही करनी है, because not for myself but for you guys. तो obviously I had kept a target of 3, but I know कि 3:30 तक होगा, तो please bear with me. Anyway, Vibrio का मतलब rice water stools, इतना हमें पता है. How does it happen? Very good. Zona occludens. Okay, you are saying zona occludens. कौन सा toxin? Zot toxin. Zona occludens toxin बनाता है मैम Vibrio cholera. It makes a zona occludens toxin. Okay, it makes another toxin, obviously known as cholera toxin. I mean obviously cholera toxin तो बनाएगा ही ना, because cholera है. It also makes a zona occludens toxin. So let me just directly show you a photo ना. This is Vibrio cholera. This is known as the cholera toxin over here. मैम cholera toxin I can see उसके अंदर AA वाले parts भी हैं और BB वाले parts भी हैं. What is the usual protocol that I always teach you? AA is always for action. What action will it cause? It will increase cyclic AMP. Oh, so those rice water stools are because of increase in cyclic AMP. And BB का क्या काम होता है? BB BB का काम होता है बाइंडिंग का. तो A1 is, see what is going to come inside an increased cyclic AMP? A वाला will come inside an increased cyclic AMP. What will B वाला do? B वाला will bind to which ganglioside? It will bind to GM1 ganglioside. ये इनका most expected question है. Don't take it lightly. Every year they are giving it again and again and again. So B वाला will bind to GM1 ganglioside. A वाला will come inside an increased cyclic AMP, and then that rice water stool is going to happen. यहाँ तक ठीक है. But then only one cell cannot be affected, na? And if so much of water has to come out, you will have to break a lot of junctions. If it has to go from one cell to the other, you will have to break junctions. Lots of cells will be affected. Who helps in that junction breakage? That is known as, which cell junction are you breaking? You are breaking zona occludens. Very, very important. So rice water stools तो मुझे समझ आ गया. But now if I ask you, how do you do the diagnosis of cholera? के rice water stools होता है because cyclic AMP and all. What is the shape of Vibrio? This I taught you some time back only. It is going to be a comma shape organism. How does it move? It is going to be, this I taught you yesterday, ma'am. It is going to have the shooting star motility, jaldi jaldi, quick wala motility. That is going to be the darting motility. Very good. Which test positive? You can see a string coming out of it again. You know this. It is string test positive. And now this finally completes जो हमने पढ़ा था. Patient के अंदर if you send a string धागा to catch the दादाजी, that is known as Giardia lamblia. String test was in Giardia lamblia. Then two bacteria in which I taught you today. One was Klebsiella pneumoniae, where you were seeing the colony was coming out like a string, and second is Vibrio cholera. वो table आप already बना चुके हो. Now you are left with the cholera का culture media, that is TCBS. What is TCBS? Thiosulfate citrate bile salt. इतना याद रखना है? नहीं, sucrose याद रख लो. Because TCBS is going to tell you about sucrose fermentation. When you do sucrose fermentation, you get a yellow color, and when you don't have sucrose fermentation, you don't get a yellow color. Vibrio cholera is a sucrose fermenter. How will you indicate it? On a TCBS media. What is the indicator? Again, bromothymol blue. So if I ask you a simple question, that there is a 30-year-old male patient presented to the hospital with complaints of diarrhea, vomiting, nausea, leg cramps. Culture के लिए भेजा था. Photo has been shown below. Identify the media. So you will say TCBS media, the growth, because yellow दिख रहा है, तो sucrose fermentation हुआ है. This means it is showing me the growth of Vibrio. I mean, over here you know the answer because it is obvious. We were studying this. Exam में जाके थोड़ा सा ऊपर नीचे confusion होगा, but then you will read XLD or DCA का तो photo usually does not come. CLED can show the growth of Proteus. Okay, CLED is what? Lactose fermentation. Ma'am, CLED अलग था. Lactose fermentation, Proteus history, Proteus वाला नहीं लग रहा. Over here, Vibrio cholera with that cholera history, I think that is going well. Sucrose fermentation. Okay, this is what Vibrio, sorry, what Vibrio are we talking about? Cholera. I changed the Vibrio. If I say Vibrio parahemolyticus, will that show sucrose fermentation? No. So where will I write Vibrio parahemolyticus, Vibrio alginolyticus, Vibrio vulnificus, Vibrio ABCDE, कोई भी Vibrio होगा दूसरी साइड. तो मैम ये जो इतने सारे आपने नाम लिए, can you tell me one question on all of these? When I talk about number one, first I will start with this. When I talk about Vibrio parahemolyticus, P for, इसमें भी food poisoning. क्या खाने से food poisoning? Prawns. In simple words, I'm talking about seafood वाला food poisoning, ma'am. Seafood खाने से जो food poisoning होता है, prawn, crab, ऐसा कुछ होगा तो Vibrio parahemolyticus. Okay. Vibrio vulnificus causes very serious infection. What is that? Sepsis. Vibrio vulnificus, very serious infection, that is sepsis. Vibrio alginolyticus causes one thing in the eyes, that is conjunctivitis, and the ears, that is otitis media. How I have learnt it is that all three of them commonly cause one thing called wound infection. Why? Because all three of them are said to be halophilic. What do you mean by halophilic? Ma'am, halophilic का मतलब होता है halo salt, philic loving. They are salt loving organisms. So we have a very simple kind of a rule. जले पे नमक छिड़कना है ना. So जले पे, on any wound you have to sprinkle salt. Sorry, very bad English translation for you guys, but I think jale pe namak chhidakna, let's keep it to that. So when jale pe namak chhidakna is, what is it known as? That whenever there is a wound infection, you will think of that namak wala, you will think of the salt loving organism, and that is known as the halophilic organism, all three of them. But then they will ask you which is most tolerant to salt. Most tolerant to salt means even 10% salt if they can tolerate, more than 10% salt if they can tolerate, that is going known as Vibrio alginolyticus. Alginolyticus, or how many MasterChef fans over here? MasterChef इंडिया, ऑस्ट्रेलिया, अमेरिका कुछ देखते हो तो उसके अंदर यू विल ऑलवेज सी पीपल आर कुकिंग चाइनीज फूड, एंड टू मेक चाइनीज फूड दे यूज अजीनोमोटो. अजीनोमोटो इज समथिंग विच मेक्स इट वेरी सॉल्टी, मेक्स इट वेरी स्पाइसी. तो अजीनोमोटो इज द salt loving wala, maximum salt loving. Alginolyticus is most tolerant to salt, over 10%. And if you have real Chinese food which has salt and spices and all of that, then what will happen? आँखों से कानों से धुआं निकलेगा मैम. We are going to, no, I don't have an English translation for that. आँखों से कानों से धुआं निकलेगा. So that is going to be conjunctivitis and otitis media. This is just a way of learning. I'm sorry I'm teaching you so much of food right at lunch time, but I don't have an option. So we are settled with it. Now tell me one more thing. Which out of these three is going to cause or help in showing you something called Kanagawa phenomena? This is a question again. Kanagawa phenomena is shown by Vibrio parahemolyticus. Kanagawa phenomena is seen on what agar? It is seen on Vagatsuma agar. Vagatsuma agar is nothing but a blood agar. Ma'am, usme you have added some salt and then you are giving it a very fancy name, that is Vagatsuma. You've just taken blood, added some salt in it. It's a stupid thing that you have made and you have named it into Vagatsuma agar. If it can show certain growth on it, that is known as Kawagama phenomena. Kanagawa phenomena. Okay with everyone? Yes. Now we come to the next one. All food items done. Okay, let's move on to the next question over here, which is a very simple but an expected question. From which bacteria is the MW vaccine extracted as mentioned below? M. indicus prani, M. welchi, M. leprae, M. bovis. Yes. Okay, you're saying M. indicus prani. This is a name which you read it once and then you can't forget it. Firstly, what is MW vaccine? MW vaccine is a immunomodulator vaccine which has been prepared for which particular disease? For leprosy. So for leprosy, a vaccine has been made which is an immunomodulator vaccine. Name of that vaccine is MW vaccine. It has been prepared from which bacteria? From M. Mycobacterium indicus prani. This is one leprosy. वैसे तो leprosy you studied. What is that classification you studied in dermatology? Ridley-Joplin classification. पढ़ ही लिया होगा ना, because without that derma sessions are incomplete. So leprosy questions you will get in derma. Micro में either you will get the M. indicus prani question, or you will say that can I grow leprosy on blood agar, chocolate agar? Usually is it feasible to grow? No. You will do animal inoculation. कौन सा animal मैम जिसकी body पे ऐसे 9 bands होते हैं? तो leprosy के लिए, lepra के लिए you are going to use 9 बैंडेड आर्मडीलो. ओके, कहाँ मिलेगा? इंडिया में नहीं मिलेगा. सो इंडिया में कुछ जुगाड़ निकाल लेते हैं. वी कैन ऑल्सो ग्रो इट ऑन द फुट पैड ऑफ माइस. फुट पैड ऑफ माइस और 9 बैंडेड आर्मडीलो वट एवर इज रिटन इज फॉर लेप्रेसी. लेप्रेसी के लिए माइक्रो का एक और क्वेश्चन था. ZN स्टेन में हाउ मच % H2SO4 विल यू यूज एंड व्हाट इज द नेम ऑफ दैट स्टेन? आई टॉट यू येस्टरडे. 5% H2SO4 यूज करेंगे मैम, एंड दैट इज नोन एज द फाइट. 5 का फाइट फॉर एक्ोस्टेन. ये ऑलरेडी हमें आता है. सो लेट अस मूव फॉरवर्ड. Next question. Read carefully. 27-year-old male patient presents with dry cough and fever. The chest X-ray shows bilateral infiltrates. On general physical examination, patient is oriented to time, place and person. Per abdomen examination shows moderate splenomegaly. On blood test, the CBC shows low hemoglobin. Anemia का patient है. Peripheral smear में क्या दिखा? अच्छा भूलो, थोड़ा पैथो पढ़ लेते हैं. It's been 4-5 days, पैथो ही नहीं पढ़ा. What is this showing you? Ma'am, round RBCs, spherocytes. As soon as I saw spherocytes, did you think of hereditary spherocytosis? Because then I'm gonna kill you. I taught you so much with so much of emphasis. When you read spherocytes, what will you think of first? Most common cause, autoimmune hemolytic anemia. सबसे पहले क्या सोचोगे? AIHA. Okay. Now AIHA is of two types. Either it is going to be warm type. Warm type is caused by garam antibody, that is IgG. Or it is going to be the cold type, and cold type is caused by IgM. And why do you see this antibody? Because of a bacterial infection, that is mycoplasma. So when they are correlating autoimmune hemolytic anemia with infections, you will correlate it with mycoplasma. That's a path micromedicine integration that they've got up over here. That okay, spherocytes were there, hemoglobin is low, autoimmune hemolytic anemia. कौन सा infection सोचोगे? Mycoplasma. So mycoplasma shows you which colonies? 2-3 times तो you've told me. One last time बता दो. Fried egg appearance. कौन सा agar? On which agar do you see the fried egg colonies? You see it on PPL agar. In fact, the other name of mycoplasma, by the way, mycoplasma के दो और नाम है. Number 1, it is known as PPLO organism. Number 2, it is also known as the Eaton's agent. And anything regarding its size, it is going to be The smallest, na? Mycoplasma is the smallest bacteria. Is it gram positive, gram negative, or gram poor? It is going to be a gram poor organism. MRCS, याद है कल का first topic है MRCS. Mycoplasma was gram poor, which I've got over here. Ma'am, you are saying it's छोटा bacteria. Look at the tiny fried eggs. छोटू fried eggs are seen over here. दिख ही नहीं रहा. To see the fried eggs, can I add some color? And then I'll be able to see the fried egg, and that is known as the Dines stain. Because now again I will ask you, where do you see the Dines phenomena? Remember, two best friends meeting, they hug each other, alag hain to U-turn. And then that snake story we went on to. Proteus was showing me Dines phenomena. Dines stain is going to be seen with Mycoplasma. Coming back, these are the only questions you can get for Mycoplasma. Moving on, to which organism does the provided life cycle belong? क्या क्या बन रहा है यहाँ पे? एक ह्यूमन बीइंग है, so many animals over here. I can see rat, dog, horse written. Then I can see some urine happening, contamination of water happening. Then I can see a bacteria which is kind of, like spiral in configuration. टाइफॉइड यूरिन से कहाँ आएगा? हैंटावायरस, वायरस इज नॉट गोइंग टू बी सीन ऑन लाइट माइक्रोस्कोपी लाइक दिस. यर्सीनिया पेस्टिस तो प्लेग कराता है ओनली बिकॉज ऑफ द रैट, मे बी देव रिटन, बट रैट फ्ली होगा फॉर प्लेग. दिस इज लेप्टोस्पायरा बिकॉज दिस इज गोइंग टू बी, येस, द RRR, मैम. लेप्टोस्पायरा इज RRR. whenever you have rat urine which is going and contaminating the rainy water, rat urine going and contaminating the rainy water will come to the farmers, the rice field farmers. Then I will think of Leptospira, spiral organism. Repeating once again, Leptospira, there is going to be rat urine. Rat urine will go and contaminate the rainy water. Rainy water will of course be used by all our farmers, the rice farmers, the paddy field workers, and they will end up having Leptospira. तो क्या disease होता है? What is the name of the disease that Leptospira क्या? Wheals. Very good. Wheals disease. ऐसे थोड़ी लिखा जाएगा. Wheals disease में patient को क्या हो रहा है? What is the other name? Number one, ictero means jaundice. Hemorrhagic, there is going to be bleeding. Icterohemorrhagic fever is going to be noted. Can I say ictero because liver affected होगा तो hepato, and hemorrhagic also because the renal system is affected. Can I call it hepatorenal syndrome? Yes, ये सब same चीज. Wheals disease, jaundice और hemorrhage. Icterohemorrhagic, jaundice मतलब liver, hemorrhage मतलब kidney गया, तो hepatorenal syndrome. कैसे करेंगे diagnosis? There is a media called EMJH. That's the fourth R. EMJH media shows you R for ring. See, this is test tube 1 and 2. Which of them is showing you the ring? Please, ऊपर वाले को ring नहीं समझना in the exam. You have filled it with a media. Which media you have filled it with? EMJH. This is the fluid. You will have to see one more ring. That ring is seen over here in the second one. So, ma'am, this is the EMJH का ring positive, and ring is going to be seen Dinger's ring. So, rat urine, rainy water, rice field workers, Dinger ring. That is Leptospira. But अगर एक एंटीजन एंटीबॉडी टेस्टिंग करना हुआ, many of you are saying माइक्रोस्कोपिक एग्लूट मैट करेंगे. मैट ओके. बिफोर दैट डॉक्टर पारुल हैज आस्क्ड, मैम, बिकॉज ये सब ये लोग इतना कोलैटरल बातें कर रहे हैं तो मुझे एक चीज याद आई. डॉक्टर पारुल गॉट रिमाइंडेड ऑफ समथिंग कॉल्ड एस्कोलीज थर्मो रिंग प्रेसिपिटेंट टेस्ट. नाउ दैट I mean it's not related to this, but I'm writing, okay, because you've asked me. Ascoli's thermo ring precipitant test, yes, that is going to be seen in anthrax. Thermo's ring precipitant test is going to be seen in anthrax. वो अलग. यहाँ पर जो दिख रहा है, for the diagnosis we do a test called MAT. How can our story be complete without CAT, SAT, MAT? See, immunology मैंने बीच में जो जहाँ important है I have added on. So what are these agglutination tests? That is CAT, SAT, MAT. CAT is going to be cold agglutination test, SAT is standard agglutination test, and MAT is microscopic agglutination test. So we learn it as CAT, SAT on the MAT. And how do you learn it further? See, there are two lucky charms of every exam. One is the owl. आउल पे क्वेश्चन आना होता है, तो आउल आई अपीयरेंसेस यू डिड इन पैथो. माइक्रो का लकी चार्म इज अ कैट. सो समथिंग रिलेटेड टू कैट दे गिव यू. ईदर दे आर गोइंग टू गिव यू अ क्वेश्चन. yesterday we told you one life cycle with cat, and either we will eat the cat or the cat shit will come to us. Remember old shit, new shit, so much shit we spoke about. That was toxoplasma. So toxoplasma का cat questions come, or they give this mnemonic वाला हमारा cat sat on a mat, and that is learnt as How do you learn your cat? Name of your cat is my dear cat. You will call her as my Billy. Okay, my dear cat is cat sat on a mat, my Billy. So means cold agglutination test is seen in my for mycoplasma. Standard agglutination test is seen for brucellosis. Brucellosis is a disease which comes as a zoonotic disease. It comes from animal milk. So usually animal milk से exposure होता है. That is brucellosis. And microscopic agglutination test is going to be seen in leptospira, which you will write as spira. So remember, cat sat on a mat, my Billy, done. Meanwhile, everyone started saying, oh मैम cat scratch disease भी तो था, उसमें वो granuloma दिखता था. Cat scratch disease and pathology used to show you the stellate granuloma, which is very very good. You studied it. Perfect. Moving on. So coming Legionella भी बता देना. Legionella, okay, I've not got it included in today's class, but Legionella का usually they tend to give you questions on pneumonia only. But we'll see in the end if I can get a question from here. Okay. Coming to the next, finally we come to a 23-year-old male patient, family physician, complaining of painless genital ulcers. The story of genital ulcers is here. Okay, he gives a history of having unprotected sexual intercourse with a commercial sex worker 2 weeks ago, at least not a truck driver this time that they mentioned. No history of any chronic illness, vital stable, GPE reveals non-tender inguinal lymph nodes. तो अल्सर भी पेनलेस, lymph node भी पेनलेस. जब सब कुछ पेनलेस होता है मैम, then we think of syphilis. But this time it's not a truck driver. So sad. We were expecting truck driver to come, but हो गया. काफी truck driver I've told you. So maybe people other than truck drivers also have syphilis. Okay, which is the most important. So now over here, this could be HIV positive patient, of course, because it's a sexual transmission, but not the primary disease investigation that I would want. I would want to do here the dark field, because syphilis is what? Syphilis is caused by the bacteria spirochete. Spirochete, कौन सा वाला spirochete? That is Treponema pallidum. So ma'am, that is a very very spiro patla organism. For very thin organisms you told us dark field microscopy करना है. Anyway, students have always still want to go back to ma'am, we will get a history of truck driver, and we always say truck drivers always ride on dark roads, right? Truck driver will always be found on dark roads, so you will always use dark field microscope. So coming back, syphilis के सारे questions in one place. When you will want to do the microscopy, कौन सा वाला? Dark field microscope. If you don't have a dark microscope, I told you it's a very thin organism. If it is very thin, then you make it thick, then you make it mota. How do you make it mota? By depositing some silver around it. Can I say we can also do the silver impregnation stains? Yes, there are two stains. There is known as a Fontana stain and there is a Levadity stain. Fontana stain and Levadity stain. How do I learn it? If they say आपने film लिया है, film basically means that from the lymph node you did FNAC का film, fluid, discharge है, discharge का film has been made, you will want to go in for Fontana stain. If they say we have taken a tissue biopsy, if we have taken a tissue biopsy, which silver stain can you do? Levadity stain. So if film has been taken, तो Fontana stain. If tissue has been taken, तो Levadity stain and silver stain is done. Now let's go through the entire journey of, let's start with अच्छा one ऐसी question, this syphilis का incubation period क्या होता है? Because it's quite a fancy incubation period, 9 to 90 days. Also one more thing, by the way, today in your bonus slides there is also a slide of most important 10-12 most important incubation periods that I've written. Today's bonus slides that you will get will be truly golden. मतलब I'm doing खुद से खुद का तारीफ, but I'm doing that because to emphasize is that what I've prepared is going to help you a lot in that last 1 week when you are searching इधर उधर कि अच्छा कहाँ से incubation period, कहाँ से bodies, कहाँ से all the drugs I'll get, all that I have written. So today the PDF is one, and then those 20 slides in the end which you will get, you will have to revise in the next 1 month or 2 months, however exam time you have. Coming back is कल नहीं आई ना, डोंट वरी डॉक्टर फातिमा, वो सब आई हैव पुट इन वन टुडे बिकॉज आई वांट दोज 20 शुड बी एट वन प्लेस एंड यू शुड रिवाइज देम बार बार व्हेनेवर यू गेट टाइम इन वन पीडीएफ ओनली. टुडे इट हैज बीन एडेड. चलो वापस आते हैं. इंक्यूबेशन पीरियड तो ईजी ना, 9 to 90 डेज याद रहेगा मैम. नाउ लेट्स स्टार्ट विद प्राइमरी सिफिलिस. प्राइमरी में सब कुछ पेनलेस, जेनाइटल अल्सर पेनलेस, इंग्वाइनल नोड पेनलेस, एंड पेनलेस पीपल आर मतलब बेसिकली दिस पर्सन विल नॉट बी क्राइंग ना, बिकॉज कोई पेन ही नहीं हो रहा. स्टोन हार्टेड पर्सन, नॉट क्राइंग. हार्ड अल्सर, very hard ma'am, it is not crying at all. Okay, then this goes into secondary syphilis. Secondary syphilis shows us condylomata lata. Why not condyloma acuminatum? Because this I will teach you in some times. Where do you study condyloma acuminatum? एक्यूमेनेटम तो मैम मुझे वॉट जैसा लग रहा है, वो तो HPV कराता है. आई एम नॉट टॉकिंग अबाउट इट. आई एम टॉकिंग अबाउट कॉन्डाइलोमेटालाटा, विच फ्रॉम टुडे ऑनवर्ड्स आई विल राइट एज कॉन्डाइलोमेटुलाटू, because this is just a way of remembering that these are nodules which I see at which junction, at the mucocutaneous junction. These are also similar to but mucocutaneous junction. So everyone, today's song, today we didn't have any song, we didn't make any song, right? So remember, condylometulatu, which you see at the muco-Q2 junction, is going to be seen in which syphilis? Secondary syphilis. Condylometulatu, muco-Q2 junction, secondary syphilis में दिखेगा. What else? Ma'am, two hands, two feet, two hands and two feet पे rash दिखेगा. That is also seen in secondary syphilis. All two things coming together. Finally, I have not written over here, but for your completion, you can tell me tertiary syphilis में क्या दिखेगा? Organ involvement, brain गया, cardiac गया. So neurosyphilis, cardiosyphilis, that is how you are going to study it. Okay, the organ involvement goes into here. Okay, you said Lata is singing, very nice. और दो तीन और mnemonic बना लो. Okay, coming back, they ask you questions on primary and secondary syphilis, which we have studied, and you will do dark field microscopy, which is also settled. But one more thing, now that you've told genital ulcers, you will have to study this. कौन सा painful, कौन सा painless, जल्दी से one flashcard. When I say painful, you always remember crying with a lot of pain. So Haemophilus ducreyi is crying with pain, and उसको cry को shankar नहीं बोलते, shankroid बोलते हैं. तो remember, crying with pain, ducry, shankroid. Other than that, virus, herpes simplex virus 2 can also cause painful ulcers. बस painful ulcers का यही दो. Painless genital ulcer के साथ साथ lymph node वाला कहानी is also going to be there. Okay, someone said, ma'am, not feeling hungry. No, if that is indirect way of sending me off, I'm not going. Today I'm very, very stubborn. I will make you also sit and I will also sit. Khud bhi I will not eat lunch. You can eat. It's okay. You are allowed. But usually what happens is that you feel hungry when you are at the receiving end of a lecture. जब पढ़ रहे होते हो ना, you feel very hungry. But now telling you as an educator when you're on the other end, when you are teaching, because you guys are, you don't know what all is left. मुझे दिख रहा है वो कितना slides pending है, तो मेरे लिए that is what is sticking in my mind ना. Then for that time your hunger, your thirst, your miscellaneous things all go take a back end. Your aim is कि अच्छा इनका कम time में maximum cover हो जाए, that kind of a thing. But for you guys, please do it alongside, because you are अभी exam going students, you need all the energy. Okay, coming to the next, painless genital ulcer. When you think of ulcer, साथ साथ lymph node. तो मैम syphilis में तो सब कुछ painless था, no pain ulcer, no pain lymph node. But lymphogran, देखो painless ulcer तो सभी में, but lymphogranuloma venereum में the lymph node is going to have a lot of pain. And you know, look at the photo of the lymph node in lymphogranuloma venereum. The photo of the lymph node, look at it, देख के ही दर्द हो रहा है. It is looking so red and inflamed. You can look at it and say patient must be in a lot of pain. And these painful lymph nodes are known as buboes. These are known as buboes. I can see one area in between. What is this known as? This gaddha or groove. This is the inguinal ligament basically. दो inguinal lymph nodes, बीच में inguinal ligament, that is what has created a groove. Groove sign is positive. So who causes lymphogranuloma venereum? It is caused by Chlamydia trachomatis. But ma'am, Chlamydia trachomatis तो ophthalmology में trachoma कराता था. But please note, I mean I'm going very off track, but I'm making you revise that Chlamydia trachomatis जो trachoma कराता है, that is Chlamydia trachomatis ABC, which causes trachoma. The safe strategy that you will study in ophthal, which is a pakka wala question of ophthal for trachoma safe strategy. But that is Chlamydia trachomatis ABC. When LGV is caused, that is caused by Chlamydia trachomatis L1, L2, L3. Be very certain on this, and that will have these painful lymph nodes or buboes. Lastly, donovenosis is a disease which is caused by Klebsiella granulomatis. That also has a painless genital ulcer, and this is going to show you a very famous appearance which is known as the safety pin appearance. This is referred to as safety pin appearance. Miscellaneous questions सब बढ़िया चल रहे हैं, ये बढ़िया चल रहा है मैम. इसके लिए एक फ्राइज टेस्ट होता है, इसके लिए डॉक्सीसाइक्लिन दिया जाता है, सब very good, excellent. If I'm not correcting you, मतलब you are writing the right things. If I correct you, if I find an incorrect answer, I will tell you कि गलत चल रहा है. Okay, coming to the next question. बहुत ही लंबा क्वेश्चन है, but read carefully. 18-year-old student presents to the hospital with fever, abdominal pain and loose stools. Back to diarrhea. Initially it was watery, gradually they become dysentery, मतलब blood tinged. All the symptoms have just begun one day ago. बहुत short history, incubation period भी बहुत छोटा लग रहा है. There's a barbecue party with his college friends. Wow, chilling in life. Stool examination shows pus and culture from the sample has shown finally maximum growth at 42 degree. Select the images that you would select out of here. कौन सा images? ओके, ऐसा किसी ने नहीं सोचा कि यहाँ पे इमेज स्लैश इमेजेस लिखा है तो शायद मल्टीपल ऑप्शंस हो सकते थे मैम। हमने सोचा 42 डिग्री कंपाइलोबैक्टर जेजुनी मतलब कैंपीबैप हमारा आंसर क्यों, मतलब सो सिंपल ना, हम लाइफ ज़्यादा कॉम्प्लिकेट करते ही नहीं। व्हाट इज द शेप ऑफ कंपाइलोबैक्टर जेजुनी? इट इज़ कॉमा शेप, जस्ट लाइक विब्रियो इट इज़ दैट कॉमा शेप ऑर्गेनिज्म। तो 1 and 2 दोनों आंसर है यहाँ पे। Welcome to Wake Up Reality. Now coming to what all did I talk about? When I talk about Campylobacter jejuni, firstly the jejuni will tell me about the June ka mahina. Earlier we used to say June ka mahina will have 42 degrees, although now even March and April has 42 degrees. That's a separate issue. But remember that the growth of this organism is going to happen at a June ka mahina, that is going to be 42 degrees. Now this will always be learnt as any bacter, Helicobacter, Campylobacter, they are said to be कॉप्स। कॉप्स क्या होते हैं? दे आर कैटलेज ऑक्सीडेज पॉजिटिव स्पाइरल्स। कैटलेज ऑक्सीडेज पॉजिटिव स्पाइरल्स, दे आर कैटलेज ऑल्सो पॉजिटिव ऑक्सीडेज पॉजिटिव स्पाइरल। मतलब देखो ये ऐसे स्पाइरल दिखेगा या फिर इट्स गोइंग टू लुक कॉमा शेप। हाउ कुड यू फॉरगेट कॉमा शेप, गल्विंग शेप, स्पाइरल शेप, दैट इज कंपाइलोबैक्टर। देन व्हाट इज द मोटिलिटी? जैसा जैसा विब्रियो जैसा शेप, विब्रियो जैसा मोटिलिटी, डार्टिंग और शूटिंग मोटिलिटी इज गोइंग टू बी सीन ओवर हियर। समझ आ गया? बैक्टर बैक्टर अंडरस्टूड, जेजुनी अंडरस्टूड। व्हाट इज कैंप? व्हेन यू गो कैंपिंग, मैम एक हफ्ते का तो कैंपिंग ट्रिप बनता है ना आफ्टर योर एग्जाम। यस, प्रॉमिस मी दैट ऑल ऑफ यू विल गो because you deserve it, you have to go somewhere after the exam. So 1 से 7 days का 1 week का camping trip बनता है, that is the incubation period. But when you will go camping, you will prepare for 3 things. You will say where will I eat food from, how will I drink water, and where will I use the washroom. बस ये 3 tension होता है। तो actually camping trip happens because of some kind of food, and that is usually uncooked poultry. That is why they give you a history of barbecue party done by the college students. After that, initially patient has watery loo, means the diarrhea is initially watery, and after that the diarrhea becomes a little dysentery type, so it is going to become blood tinged. ठीक है? Someone said मैम पेरेंट्स नहीं मानेंगे, कोई बात नहीं, झूठ बोल के चले जाना, डोंट कोट मी ऑन इट। एग्जाम के बाद यार यू डिजर्व अ ब्रेक, माने ना माने यू हैव टू गो 1 day 2 day, कहीं तो यू हैव टू गो टू डी स्ट्रेस, दैट यू डिजर्व irrespective of whether someone around you allows or does not allow. Coming back, uncooked poultry से होगा watery diarrhea followed by blood tinged. यहाँ तक तो समझ आया। But one complication of Campylobacter jejuni that you are very scared of, one neurological complication is going to be GBS. yes, perfect. तो यहाँ तक तो हमें समझ आ गया। नाउ वी कम टू दैट, अच्छा अगर फोटो आएगा तो कॉमा शेप का आएगा। मोटिलिटी हमें डार्टिंग वाला पता है। मीडियम का क्या नाम है? कंपाइलोबैक्टर के मीडियम का क्या नाम? कैंपीबैप मीडिया। कॉमन सेंस, ये तो नहीं पूछेंगे। समथिंग एल्स दे विल राइट, स्कीरोज मीडिया एंड बड्सलर्स मीडिया। Skiro, Butler and Campybap. Coming back, you had to think of Campybap media, you had to think of gulving shape or comma shape. 1 and 2 both are answer. Acid fast तो ये नहीं था, ये TB नहीं है। And look what is written over here. What is SMAC? MAC was McConkey, SMAC was sorbitol McConkey. And do you remember all the E. coli are sorbitol McConkey positive, but look what I've written over here. O157H7 is sorbitol McConkey negative. ये same चीज उन्होंने फोटो में डाल के दिया, which I taught you. And finally with that this has come to an end, which gets me to the next question. Now, before I go on to the next question, I am going to go all the way back. I don't know how many slides I've taught you, it's endless. But I'm going to go all the way back and ask you one thing that I left in the beginning, and that was this. Ma'am, सब पढ़ लिया, mechanism of actions एक साथ बता दो, सारे mechanism of action. Number 1, which are the ones which are going to decrease the protein synthesis? DPSS, ये हमें पता है, decreasing protein synthesis. DPSS, what is DP? Number 1, diphtheria toxin. अच्छा, now you'll have so much to tell. Diphtheria toxin, अच्छा वो वाला जिसमें pseudomembrane था, bull's neck था, okay, that Albert stain, Tim we did, okay, that is going to decrease the protein synthesis. Second, Pseudomonas exotoxin also decreases protein synthesis. So D and P हो गया. What is SNS? Shiga and Shiga-like toxin. Shiga तो obviously for Shigella, and Shiga-like toxin is the toxin of E. coli. But how do they decrease the protein synthesis? D and P cause what? सबका answer started coming. It is going to cause ADP ribosylation of EF2. कैसे करता है ये decrease protein synthesis? By ADP ribosylation of EF2. How does Shiga and Shiga-like toxin decrease protein synthesis? By decreasing the 60S ribosomes. Very good. ये सबको आपको आता था. Amazing. Then next, how do you increase cyclic AMP and cyclic GMP? Cyclic AMP का mnemonic cyclic AMP with a minor change over here. Number one C for याद है rice water stools, cholera because of cyclic AMP. Anthrax का tripartite EPL toxins, they were causing cyclic AMP. M का थोड़ा सा change करना पड़ेगा, you'll have to twist it a little. It becomes E. E. coli का labile toxin increases cyclic AMP, which means E. coli का जो stable toxin है that is going to increase cyclic GMP. And finally P for what? P for pertussis. तो अभी के लिए remember cholera, anthrax, E. coli and pertussis. Confusion आएगा labile versus table. So I think you already know this USMLE के first aid का mnemonic है. Labile person will always be हवा में in the air, and a stable person will always be very very grounded. So stable on the ground, which means that labile toxin is going to increase cyclic AMP, stable toxin is going to increase cyclic GMP. This is the most important mechanism of action. Yeah, now I can finish off carefully and I am so relieved because now I feel micro khatam hi ho gaya. When bacteriology finishes, it's a relief for the student and the teacher. Coming to the next one. A virology lab we have entered into. Receive sample from a patient with a suspected viral infection having fever, cough and body aches. Testing confirms the presence of RNA virus. Which of the following is an example of an RNA virus? क्लासिफिकेशन से स्टार्ट करते हैं बिकॉज हम वो फिर ग्राम पॉजिटिव नेगेटिव वाली गलती कर देंगे मैम, तो हमें स्टार्टिंग में ही बता दो व्हाट इज डीएनए, व्हाट इज आरएनए. यू आर सेइंग रेस्पिरेटरी सिंसेशियल वायरस इज एन आरएनए वायरस. सो आरएनए वायरसेस आर तो 1 million. I will learn the chota wala list. All of these are DNA viruses. How do you learn the DNA viruses? We learn it by the mnemonic happy. Happy is what? Happy is going to be DNA virus. So happy mein I am starting off with the P, which is bacteriophage. P for phage. Bacteriophage is okay. Now there are so many P's that I have to first take care of the P's. Which other P do we have? P for parvovirus, वो जो slap cheek appearance अभी पढ़ेंगे. P for parvovirus. P for pox virus. सारे pox, like we have smallpox, cowpox. So ये vaccinia variola वाले pox. Molluscum pox you have studied in dermatology. अभी यहीं पे बता दो मुझे. मोलस्कम पॉक्स में 2 क्वेश्चन है जो यहीं के यहीं यू विल सॉल्व. नंबर 1, व्हाट काइंड ऑफ लीजन्स डू यू गेट इन द स्किन इन मोलस्कम पॉक्स? टाइम ही नहीं है ना, तो इजी वाले क्वेश्चन यहीं पे सॉल्व करके जाएंगे. अम्ब्लिकेटेड लीजन्स दिखता है मैम. नंबर 1 अम्ब्लिकेटेड लीजन. एंड सेकेंड, विच बॉडीज डू यू सी? वी सी दी HP बॉडीज. ठीक है, ऑल्दो आई हैड एडेड दिस इन द मिसलेनियस, बट ऑल ऑफ यू हैव बीन सो नाइस and you have given me the answer here and there, so I will show you right now only. This is molluscum pox. What kind of lesion do you get? You get umbilicated lesion क्योंकि बीच में ऐसा एक होल होता है. And what kind of bodies? ये पिंक कलर बॉडीज कौन सी होती है? These are the HP bodies. HP का फुल फॉर्म क्या है? Henderson Patterson bodies. What is the special stain for HP bodies? It is the floxine stain. ऐसे ही same question चलता है dermatology में. Molluscum contagiosum. They might not write molluscum contagiosum. They will write molluscum contagiosum virus. सोचते रहो MCV क्या था, ये वो RBC का MCV था 80 to 100 femtoliters. कहाँ का MCV था? It's the same thing. Molluscum contagiosum virus. Umbilicated lesions, HP bodies, HP body का special stain, floxine tartrate stain. What is molluscum? Now I can tell you, it is going to be a type of a pox. तो सारे pox but not chicken pox. Chicken pox does not come here. Okay, moving on to the next one, the P. The P is going to be papilloma. वो तो पता ही है मैम, human papilloma virus. जिसको नहीं भी पता था, thanks to Poonam Pandey, he or she got to know about human papilloma virus. This is like known to non-medicos also. Another P is polyoma virus. पॉलीओमा इज व्हाट? JCBK SV40. इसके क्वेश्चंस भी अभी खत्म करके जाओ. SV40 आई हैव टॉट यू in pathology. It causes a lung tumor, maybe not a lung tumor but something around a lung, that is pleura tumor. SV40 is now known to cause mesothelioma. जो छोटे छोटे viruses हैं, I am finishing it off here only. Mesothelioma, we remember this ma'am. Okay, what does JC virus cause in INI-CET students? JC virus, PMLE, progressive multifocal leukoencephalopathy. So it causes a brain disorder. Okay. What does BK virus cause? For those who don't know, BK फुल फॉर्म ऐसा नहीं है, ऐसा हमने बनाया. BK स्टैंड फॉर बैड किडनी. इट कॉजेज एन इन्फेक्शन इन बैड किडनी. व्हाट इज बैड किडनी? जिन लोगों का किडनी फेल हो चुका होता है, दे हैव अंडरगॉन अ ट्रांसप्लांट, राइट? सो इट कॉजेज इन्फेक्शन इन रीनल transplant patients. It causes an infection in renal transplant patients. So इसका भी एक क्वेश्चन अभी साथ साथ करते जाओ, जो जो चीज खत्म होता जा रहा है वायरोलॉजी का यही है, whatever you read वहीं पर उसके दो क्वेश्चन करें, wrap it up. There is a 55-year-old kidney transplant recipient with worsening renal function. After transplant, you don't expect the renal function should worsen further. Urine analysis shows cell over here. Now naturally my instinct would be that इतना बड़ा urine में cell दिखेगा with इतना बड़ा nucleus, I will straight away call the clinician and say कि कोई bladder में growth है. Is this a urinary bladder cancer that you are suspecting? And then the clinician tells me, no ma'am, this is not a bladder growth, but the patient had a kidney transplant. So then I'll be like, okay, these are cells which are looking like bladder cancer cells but are not real bladder cancer cells. These are decoy cells. They tend to mimic bladder cancer. They tend to mimic bladder cancer. Which viral infection are they seen with? This is known as BK virus. So bad kidney, मतलब kidney transplant में infection कराएगा. What is the name of the cell that it causes in the urine? It is known as the decoy cell. Very good. All of you have already written it. So ये भी हमने पढ़ लिया. Now we are done with all polyoma family members. Now I go on to the A. A for what? A for adenovirus. अब जो बचे, okay, too much shown. A for what? Adenovirus. अब adenovirus में मैम adenovirus आपसे ना 40 and 41 पूछा जाता है, because there are many numbers, adenovirus 3, 7, 14, 11, etc, etc. 40, 41 is asked because 40, 41 adenovirus, 40 causes potty. Okay, 40 causes potty. It is going to cause infantile diarrhea. Perfect. It is going to cause infantile diarrhea. 40, 41 causes potty. Excellent. Perfect. H for what? Hepadnaviridae. Hepadna तो समझ आ रही है ना, hepatitis B virus. The only virus which is DNA out of hepatitis is going to be hepadnaviridae. बचा क्या? Herpes viridae. मैम herpes viridae तो खत्म ही नहीं होता. When I look at the herpes viridae family, I will have to erase a few things. I will write it in your PDF, so don't worry. So when I talk about herpes viridae family, I have lot of them like herpes viridae 1 2 3 4 5 6 7 8. I realize कुछ नाम easy है, सिर्फ दो नाम याद करने, rest all of them are easy. See, herpes virus 1 and 2, can it be written as simplex 1 and 2? Same thing. Herpes, अगर simplex की बात हो गई तो the next one is going to be zoster, that is herpes zoster virus. Fourth and fifth I have to remember. HHV4 is known as Epstein-Barr virus. HHV5 is known as cytomegalovirus. बस ये याद रखना है. Other than that, 6, 7, 8 are known as 6, 7, 8. So 1 and 2 are known as simplex 1 and 2. 3 automatically become zoster. 4 and 5 are EBV and CMV. 6, 7, 8 is as it is. तो ये बना हमारा complete. Now tell me, Epstein-Barr virus, is it a DNA virus? Yes, it is human herpes virus 4. JC virus, yes, it causes PMLE, ma'am, polyoma, ये भी DNA virus. Adenovirus 4041, potty, infantile diarrhea, ये भी DNA virus. So all the DNA viruses are learnt by the mnemonic happy. अब जो बचा like respiratory syncytial virus is going to be an RNA virus. Is that okay? Because now I move on to the next question. There is a 6-month-old infant who presents with a 1-week history of fever, irritability, decreased appetite and lethargy. Examination shows obviously fever है तो temperature, moderate hepatomegaly, and there are petechiae purpura that are present on trunk and extremities. CBC is petechiae purpura तो platelet count कम था, thrombocytopenia, and even the WBC is less. ELISA detects antibodies against antigen or PP65. That's the buzzword, because अभी तक तो any kind of virus can cause this situation. PP65 is the antigen for what? It is for cytomegalovirus. If I give you this hint, cytomegalovirus is which human herpes virus? It is human herpes virus 5. अभी ऐसा पढ़ा था ना, human herpes virus 5 is known as cytomegalovirus. तो बस आपको अगर PP65 पता है, then your answer is settled over here. Now I'm not writing stupid things. What does cytomegalovirus show you? मैम इट शोज अस द आउल आई अपीयरेंस. ये मुझे नहीं लिखने का मन, बहुत पढ़ लिया, बट आई विल टीच यू. अभी आई एम गोइंग टू टीच यू ऑल ऑफ दिस अगेन. यू आर आंसरिंग राइट नाउ फॉर मी. द एसोसिएशन ऑफ HHV8 is observed in all of the following conditions except. HHV8 causes all of the following conditions except. 2 questions का test you are giving, then I will teach you पूरा herpes family in 5 minutes. Okay. What did you say over here? C, ma'am, it does not cause adult T-cell leukemia lymphoma. चलो ये तो ठीक है. I will teach you HHV8, but can you tell me then who causes adult T-cell leukemia lymphoma? Adult T-cell leukemia is caused by, देखो ना, T-cell leukemia. तो T-cell leukemia virus कराएगा. Human T-cell leukemia virus कौन से जीन के थ्रू? It causes via the tax gene. Question खत्म. So if I ask you Who causes T cell leukemia virus? That is, the T cell leukemia virus will cause T cell leukemia via which gene? Via the TAX gene. Do you know HTLV1 belongs to which family? It is belonging to retrovirus family, because all of you think retrovirus only has HIV. HIV is retrovirus, but please note, other than HIV, HTLV1 is also a retrovirus family. And that causes adult T cell leukemia lymphomas. तो ये तो बाद में पढ़ेंगे. अभी the story is HHV8. So these are the three things which I will talk about. One more question you tell me, then I will teach you pura family. There is a 25-year-old female presents with severe fatigue, sore throat, swollen lymph nodes, noting a similar illness in her partner. So it is contagious. Examination shows fever, hepatosplenomegaly, cervical lymphadenopathy. Complete blood count shows absolute lymphocytosis with some atypical lymphocytes. What are you saying? This is glandular fever. Okay, glandular fever का easy वाला नाम क्या है? Infectious mononucleosis caused by EBV, also known as the kissing disease, and hence you could see partner to partner also there was a transmission noted. Glandular बोला तो मैम मुझे समझ आई ना, lymph nodes were increased. Then you also said hepatic and spleen enlargement was seen. Fever बोला तो of course patient is also going to have low grade fever mentioned over here. Kissing disease बोला तो transmission भी बोला, सब कुछ दिख रहा है यहाँ पे. This is Epstein-Barr virus. If they would have written HHV के terms में, what is it going to be? HHV is going to be human herpes virus 4. Yes, now what I'll do, now is your time to relax a little. For 5 minutes, I'm going to start with HHV entire family, because if I keep making you do questions, it's endless. I will now put all the questions in 2 flashcards and you will listen to me for 5 minutes. Starting first, of course, with HHV1. HHV1 and 2 are known as what? HSV1 and 2. What is HSV? Herpes simplex virus. The rule is simple. If I am above the waist, it is HSV1. If we go below the waist, it is HSV2. So if I ask you that I am going above the waist, what all is going to come to your mind? If they ask you, where do you see oral lesions? Obviously, ma'am, oral lesions are seen with HSV1. If they ask you neural involvement, CNS, brain for everyone, I hope is above the waist. So that is going to be HSV1. If they also tell you that, let's assume buccal mucosa, oral, that is going to be HSV1. So that is simple. But if they say below the waist, let's assume they were talking about genital ulcers. So that is of course going to be below the waist. So that is going to be HSV2. Is it a painful genital ulcer? Did it come with Haemophilus ducreyi and HSV2 were causing painful genital ulcers? So I have finally finished it. And also if they say mother to child, like during delivery from the mother's vagina, if it goes into a child, if there's an exposure during the delivery, that is also going to be below the waist. So that will also be HSV2. Neonatal, yes. Now moving on further. Fancy names kya honge? What are the fancy names? Herpes gladiatorum. Gladiatorum reminds me of gladiator. Gladiator strength. So strength means it is also known as wrestler's herpes. See, wrestlers, they have skin to skin body contact. Body contact can spread it. So herpes gladiatorum, gladiator for wrestler. Okay. Then herpetic whitlow. Whitlow is seen in healthcare workers. If you by mistake accidentally touch a patient with herpes with your fingers, maybe your glove had a tear, you were not wearing gloves, you were not aware patient had herpes, you end up touching the patient. So maybe we healthcare workers can then get herpetic lesions also. So herpetic whitlow is for workers and gladiator is for wrestlers. Okay, whether it is HSV1 or it is HSV2, the smear that we always take is known as the Zank smear. When the word Zank smear will be written, it is also known as, okay, sorry, no, sorry, I have a question. Someone says EBV is also known as HSV4, HHV4. Did I mention something like that? Did I just write HH? No, I've written HHV only. Okay, I had a doubt there. I've written HHV only, human herpes virus 4. I will come to that in case someone had a doubt. Okay, coming back, Zank smear. Whether I talk about HSV1 or 2 or even 3 later on, Zank smear is what you will notice. What did you see in Zank smear? Ma'am, let's assume there's a lesion on the finger. You took a smear and you made a slide. What is that known as? Zank smear. Zank smear shows you one cell or multiple cells. Multiple cells. I'll have to write very small, tiny, because I don't have space. What is it known as? It is known as multinucleation. Number 1. You keep telling me. Next, do you see cells which are separate, or they're trying to fit into each other, like they're trying to take each other's shape? That is known as molding. So the next thing that I noticed, the nuclei are taking their shape, molding. And another feature that you see in the nuclei is known as margination. So when you see the 3 M's, you know you are dealing with a case of herpes. This is same for pap smear. In gynae, if you ever see a gynae report saying that the pap smear shows you multinucleation, molding and margination, you'll be like, acha, gynae, which infection? It is the herpes infection that the female is having. These 3 M's written anywhere in the body is herpes infection. Now I have a very simple question for all of you, and that is, if all the meningitis, brain above the waist, so what, because of HSV1, the exception is molarate meningitis, which shows lots and lots of lymphocytes, and that is because of HSV2. Repeat this sentence with me. All meningitis, of course, above the waist, so it is because of HSV1, but molarate meningitis is because of HSV2. Don't mess up here. Now coming to HHV3. What is HHV3 known as? Herpes zoster virus. Can you tell me? This is pedia question. You will teach me. Herpes zoster, बच्चों में, in children, what does it cause? It causes chickenpox, and in adults it causes zoster or shingles is what you call it. So these are some questions on chickenpox that you would probably want to answer for me. Number 1, chickenpox incubation period is asked. They write 14 to 21 days or 2 to 3 weeks. This incubation is important. Syphilis ka incubation period was 9 to 90 days. Chickenpox ka incubation period is going to be 2 to 3 weeks. Now, where does it start? Chickenpox rashes. Ma'am, rashes are said to be pleomorphic. Means they can be macules, papules, vesicles, blah, blah, blah. Every other stage is possible. But very commonly, they are defined as dewdrop on petal appearance. Dewdrop means it looks like a vesicle as if it is filled with water, and petal means red color, so the base is going to be erythematous. That is known as dewdrop on petal appearance. Why? How does it start? Ma'am, CP starts. CP, it is going to start centripetal. It starts centripetal and then spreads outside, so spread is going to be centrifugal. Mostly students have learned chickenpox shows centripetal rash. They forget to read the question. Listen to this question carefully. If I say that how does chickenpox rash start? Ma'am, CP starts. CP starts centripetal. But if my question in the exam is, what is the spread method of rash of chickenpox? The spread occurs centrifugal. Please note. And if I write the opposite, then I'm talking about smallpox. Smallpox is the one that is going to start centrifugal and will spread centripetal. But smallpox is eradicated 1980, long ago. Smallpox patient is not seen. I see chickenpox patient. CP start centripetal, go outside centrifugal. If they ask you that chickenpox has infected a mother to child has ended up having congenital varicella syndrome. Look at this. Everything will become small. Like if they ask you the size of the skull, small, microcephaly. Look at the limb. Compare the two limbs, one of the limb has become small. The skin is also looking very small and contracted. What all did I say? Sab kuch small. When I say the skull, ma'am, microcephaly. When I say the limb is not developed. The skin is also showing very, as if it looks as if the child's skin was burned. Scars were formed, cicatricial lesions are seen. Everything becomes small. Now, if the same thing happens in adults, it is known as zoster. Zoster shingles, when will it happen? When the person's immunity goes down. So, usually this is the photo that you get. Ma'am, classical getting a rash, which is in which side? It is unilateral, yes. And everywhere they will say unilateral, either on the face or on the back or on the chest or on the abdomen. Everywhere it has to be unilateral and dermatomal. This I think you can easily identify, but they ask you what is the most common complication. So, the most common complication that you have in these patients is post-herpetic neuralgia. For post, I mean, just asking you one pharma question. If you are asked the treatment for herpes zoster, which drug do you give? I don't know. Do I need to write it? Or you guys, of course, you know it. It is going to be acyclovir. Ye to pata hai. But what is the drug that you would want to give for post-herpetic neuralgia? Nerve pain. Nerve pain, what would you give? Ma'am, we would give gabapentin. I think this I've just did time pass. ये आपको आता है. You all know this. Okay, so let us move on. HSV1, HSV2 and HZV you have done. What is going to be next? What is human herpes virus 4? Because 4 and 5 get you lots of questions. You will do the fill in the blanks. If I would have started asking you MCQs, next 1 hour would have only been on this one slide. So I've got all MCQs stuffed in one slide. When I write Epstein-Barr virus, which cells of the body does it attack? B cells or T cells? Question 1. It attacks the B cells. cells. What is the receptor via which it enters the B cells? CD, perfect, CD21CR2, that's the name of the receptor. After entering, which are the two genes that it produces? LMP1, EBNA2, and also something which is known as the viral interleukin 10. So I've always taught you as 1 to 10. 1 to 10 means it is going to produce LMP1, EBNA2 and interleukin 10. Okay. Now what does it cause? Ma'am, you told us infectious mononucleosis. It causes glandular fever. Glands will be enlarged. Like for example, lymph nodes will be enlarged. Hepatosplenomegaly will be there. Then you told us fever hoga, kissing disease because it spreads by contact. What is this microscopically that you will see in infectious mononucleosis? Downy cells. I'm not writing because it's pretty obvious that you get to see the ballet skirt appearance. This is the ballerina skirt appearance of downy cells. But ma'am, what are downy cells? Downy cells, because everyone believes, acha, EBV goes into B cells, so B cells must have become downy cells. No, B cells have been hijacked. B cell to gaya, bichara B cell is gone. B cell calls his brother for help. Who is B cell ka brother? T cell. So these downy cells, like this superhero cape, these are the CD8 T cells who are coming to rescue their brother. So downy cells are not the B cell. EBV enters into B cells. B cells have been hijacked. The T cells have this cape like a superhero, this ballet skirt they have made, and then they are coming running to save their brother. So CD8 T cells are the downy cells. Can I say T cells, B cells? What are they? Lymphocytes. So these are nothing but atypical lymphocytes. Now in a case of infectious mononucleosis, number one you saw downy cells on a blood test. Then you wanted to do antibodies. The antibodies that you get in EBV are heterophile antibodies. The old test that was done for EBV was Paul Bunnell test. These days what you do is the monospot test. Why do you have to know this? Because they will say there is a child, monospot test is positive. That's your only hint that you will get for diagnosing EBV. Monospot test positive, it's pakka EBV. Now you don't think of anything else. This was all fever stuff. But what about, someone said superhero in a skirt. Yeah, this is exactly what it is. This is a superhero in a skirt. Great. Now finally asking, coming back to pathology, neoplasia. I didn't teach you this in neoplasia because I knew this day would come. EBV causes a lot of cancers. You will tell me everything. Carcinoma, lymphomas, and INI-CET students will tell me sarcomas also. Carcinoma, which is the most common carcinoma that EBV causes? Gastric or nasopharyngeal? Pehle nasopharyngeal tha, now it has changed. The most common cancer that it causes is gastric. The second most common is nasopharyngeal carcinoma. Coming to lymphoma, every lymphoma it can cause, ma'am. Hodgkin's lymphoma also, non-Hodgkin's lymphoma also. Hodgkin's is like one entity. Non-Hodgkin's has so many things. It can cause Burkitt's lymphoma. It can cause DLBCL also. It can cause lymphoma in patients who have undergone transplantation also. And every other lymphoma that they write, EBV can cause every lymphoma. But sarcoma, only INI-CET students will tell me. Which sarcoma does it cause? Leiomyosarcoma. This could be a question only in INI-CET. I don't expect it in NEET also. Coming further, EBV done. Now I come down to the last one. HHV5, simple. HHV5 to ma'am, cytomegalovirus. This you have already taught us. If cytomegalovirus goes into the bacha from the mother, which calcification in the brain? I taught you yesterday. Parenchymal calcification, grey matter, white matter calcification, or periventricular calcification. It is cytomegalovirus, periventricular calcification. Perfect. What is the antigen for cytomegalovirus? PP65 antigen you just now told us. And this I don't even want to ask. Owli appearance, this everyone knows. Okay, HHV5 done. What is HHV6? It causes 6. That is sixth disease. In fact, HHV7 and 6 roughly cause the same disease. So HHV6 causes sixth disease that is known as roseola. Roseola means some rose color rash. Infantum, in an infant. So I can see a rash over here, which is very obvious. Apart from the rash, I can see some spots known as Nagayama spots. Nagayama spots. This is Nagayama. This is not the Beijing and Nakayama strain. Totally different, but yet so similar. Beijing and Nakayama strain are very, very Japanese names. So those are the strains which are used for the vaccine for Japanese encephalitis. That is Beijing and Nakayama strain. Japanese name, Japanese encephalitis vaccine. Now I come down to Nagayama spots, which are seen in sixth disease. And obviously it's an infection, to fever, to common sense. Finally coming to HHV8, and the story will end. HHV8 causes three things. 1, 2, 3. Come on. 1. Kaposi sarcoma. How can you forget? I've taught you in patho also. Kaposi sarcoma sarcoma, most common site. Jaldi se, I will now know if you're only downloading PDFs or reading them also. Kaposi sarcoma occurs in the skin of where? The lower limb. If it doesn't occur in the skin, which is the second most common site, it is going to be the lymph node. What kind of a tumor is it? It is a blood vessel tumor. Basically, it is a vascular tumor. Very, very good. So you are reading. Good. Yeah, I'm getting answers. Great. Okay, other than Kaposi sarcoma, second one, primary effusion lymphoma. Patient will have effusion, pleural effusion, pericardial effusion history hoga. They will say, oh, those effusions are nothing but because of cancers like lymphoma. Which virus? HHV8. So cancer ho gaya, cancer ho gaya. Tell me one non-cancer thing that it causes. That is known as Castleman disease. Castleman disease is a lymph node disorder, but it's not a cancer. So what is happening in the lymph node? This is important only for INI-CET students, that Castleman disease shows you two very important features, which is known as the lollipop follicles and the onion peel appearance. What is lollipop follicles? You will see one blood vessel. That stick is going to be the blood vessel, and around that blood vessel, all the lymphocytes, whatever lymphocytes you have, all those lymphocytes are arranged like this as an onion peel appearance. Has it now started looking like a lollipop? So if they ask you the entire thing, that is known as lollipop follicle. If they only ask you lymphocytes kaise hain, the lymphocytes are showing you the onion peel appearance. So I have labeled both. One is going to be the lollipop and one is going to be onion peel. Let us just zoom in and see once. Can you see a blood vessel going inside? Is this going to be the lollipop? So I will draw and erase so that you can see later on also. This is the blood vessel, and then look at the lymphocytes around it. These are onion peel, but when a blood vessel goes through it, now it's a lollipop. Repeating, these are onion peel, but when a blood vessel goes through it, it becomes a lollipop. So Castleman disease because of HHV8. That's the question I asked you. HHV8 causes what? Kaposi sarcoma. It causes primary effusion lymphoma. It causes Castleman disease. What does it not cause? It does not cause the adult T-cell leukemia lymphoma, which is caused by HTLV1. Okay, someone asked me that, ma'am, in post-transplant patient, most common to CMV hoga. Okay, this is a very good question that you've asked me. There should not be any doubt. In a post-transplant patient, you will have CMV. Most common agar pucha, to post-transplant mein, it is going to be CMV. But if they start showing you decoy cells will then give you a hint towards BK virus. Okay with you? Yes, moving on. Finally done with all of it. Let's go on to our favorite question. What is the protein found in HPV? Okay, our target was 330. Let's see if we can finish. But yeah, I'm very certain. I'll tell you for your reference, we are on the 99th slide. So that just leaves us with few, very hardly less than 10. Kar lenge. We have hepatitis, jo thoda time lega. But otherwise, they are quick questions. They'll be done rapidly. What is the protein found in HPV? Vaccine pucha, to this question is L1. Now everything about HPV is written over here. You have to fill in the blank. A question kar liya, now 10 more questions you will do. HPV can be low risk. Usually the low risk numbers are 6 and 11, and they are low risk because they cause warts. What do they cause warts as? Condylomata or condyloma acuminatum. So I hope you remember, this is condyloma acuminatum. Okay, condyloma acuminatum, versus high risk ones are going to be 16, 18. They cause squamous cell carcinoma. Kahan ka? Squamous cell carcinoma, as per Poonam Pandey, only cervix. But now we are medicos, more educated, right? So we know that it can cause squamous cell carcinoma wherever squamous epithelium is there, like penile area has squamous epithelium, anal canal has squamous epithelium, oral cavity has squamous epithelium. For that matter, esophagus also has squamous epithelium, and larynx also has squamous epithelium. Ma'am, jahan anatomy mein squamous epithelium, over there we are going to have HPV ka squamous cell carcinoma. Don't limit yourselves only to cervix, which means that the vaccine won't only be given to women. Vaccine has to be given to men also, because it can cause men cancers as well. Now coming to, before I go on to cancers, remember I was telling you that sometimes there are so many warts that the person starts looking like a walking tree, chalta firta tree. That was what? Yes, HPV 5 and even 8. Finally, for those who had never heard of this, tree man syndrome is going to be HPV 5 and 8. Now coming to what is HPV. HPV has all these things. Number one, the L1 capsid. L1 is something which is present in the capsid, outer area. Capsid is going to be used for the vaccine preparation. I think this we already know from the question. What is, these are all proteins, E2, E4, E5. What is E2 protein? E2 is the controller. Like, why are all of you sitting in this class? Because I am trying to control you. Okay, baithna padega. The day if I stop, God forbid, but if I stop this streaming right now, and if the net goes off, and I shouldn't say such things, but if something like that happens, then why will you sit here? You will be the first one to rush and have your food and say good riddance with LRR Micro. But I am the controller till the time you are under control. If I go away, then everyone is going to be like, oh, this E2 goes away, then this E6, E7 says, chalo, cancer time. So now what will E6 and E7 do? They are the ones which are responsible for carcinogenesis. And how do they cause cancers? See, there are two people protecting us. One is the policeman. Policeman is what? P53 gene. And one is the governor. Governor is what? RB gene. दोनों को हटा दो. E6 protein will say I will go and inhibit the policeman. E7 protein will say I will go and inhibit RB gene. Cancer will occur. Finally, when you look at it under the microscope, you see a very, very important cell which is known as koilocyte. Who makes koilocyte? It is E4 and E5. All your questions are done. So ma'am, what is a koilocyte? How do you define it? This I've got as a pap smear from a female. She had a cervical lesion. We did a pap smear. So in the pap smear, we saw that the nucleus was very, very dark. Something like a kishmish, something like a raisin. So raisinoid nucleus is going to be seen, number one. Number two, around the nucleus there is a whitish area. There is a perinuclear halo. That is how you define, because I don't think they will write koilocyte. They will say there is a female on her pap smear. I'm going to tell you 3 words. You will tell me the diagnosis of that pap smear. Number one, there is a female on a pap smear. She is showing you shish kebab appearance. Shish kebab appearance on pap smear was seen with candida. We did that yesterday. Second, I tell you a female. Right now, I told you on a pap smear, she is showing 3 M's. Multinucleation, molding and margination. Ma'am, that was HSV. Female है, pap smear है, genital area है, I would suspect HSV2, below the waist. Third, there is a female, pap smear shows you raisinoid nucleus with perinuclear halo. They don't write the word koilocyte. Raisinoid nucleus with perinuclear halo, you are going to think of human papilloma virus. All the questions of human papilloma virus are settled for you. Okay, gynae ka thoda sa homework I am giving you. You have to read about I've told you the capsid used for making vaccine, but I'm sure in gynae I saw the LRR PDFs while making all my sessions to know what you've done and what you haven't. So you have to do the Cervarix, Gardasil, the quadrivalent, the octavalent, nanovalent, wo sari vaccines you have to do. Okay. Coming to the next one. Which of the following underlying factor is responsible for using or inducing aplastic crisis in patients with hereditary serocytosis? Back to pathology. HS was a hemolytic anemia. In a hemolytic anemia, suddenly the bone marrow says, "Ke shut her down." Bone marrow says aplasia, no RBC, no WBC, no platelet. I will not make anything. Which virus are you thinking of? Yes, that is parvovirus. B19 to be very, very precise. Very, very good, guys. So now tell me, parvovirus B19 kya karata hai? What are all the things that it can do? Parvovirus exactly B19. Remember, we always think of Paro from Devdas because she's always crying and her cheeks are always red because she's crying. Why is she crying? Because she's solo, she's single. The only single-stranded DNA virus. All DNA viruses are double-stranded. Parvovirus is single-stranded. So Paro is crying because she's single. Also, she is the smallest virus out of all. She measures all of 20 nanometers. She's the smallest virus out of all. So chota sa virus, plus she's alone, she's single, she's crying, her cheeks have become red. So what is this known as? Slapped cheek. It looks as if someone has slapped her, slapped cheek. Someone will slap obviously with 5 fingers. So slapped cheek appearance is known as 5th disease. And because it is an infection causing redness, it is erythema infectiosum. Sab kuch same ho gaya. After that, only the cheeks will not go red. Even the hands and the feet can have rash. That is why known as gloves and socks syndrome. If it goes from mother to child, it is going to cause hydrops fetalis. If it goes from mother to child, hydrops fetalis is known. Ma'am, in case of hemolytic anemia, it will do a complete shutdown of the bone marrow, aplastic crisis, and that is the question that was asked over here. Why? But okay, aplastic means RBC, WBC, platelet, all gone. But primary attack is on what? RBC, WBC or platelet? RBC, WBC or platelet. So ma'am, parvovirus first attacks the P antigen of the RBC precursors. That is why the RBC precursors start showing you what? These kind of, this I showed you in patho also. They start showing you these dog ear kind of projections because primary attack is on RBC and after that they can attack the WBC and the platelet also. Okay, meanwhile, everyone has told, was asking me, okay, is this enveloped or is it non-enveloped? Everything if I will answer, then what will you answer? That's the next question. 9-year-old boy presents with fever, malaise and a bright red slapped cheek. Maybe I want to ask you the same question that you're asking me. The rash spreads on his face, later spreads to the trunk and extremities, plus there is anemia. Clinical diagnosis of erythema infectiosum is made. What are the characteristics of the virus responsible? So ma'am, this much you told us, slapped cheek lag raha hai, parvo to bana, paro is devdas, paro, so single. I had to think of all single stranded options. Same what happens in the exam. Two options are ruled out, two I am left with. Most of you have said A, because yes, this is a non-enveloped single-stranded DNA virus. So please remember now what you were asking me, that is it enveloped or non-enveloped? It is going to be a non-enveloped single-stranded DNA. Okay, your question you have answered yourself only, and I hope it is settled. Now we move on to the next one. In the genome of hepatitis B virus, the deadly one has come. Which region codes for the marker indicating high viral replication during infection? That's first. Everything will not be about the graph. Sometimes non-graph questions will come. Okay, someone said, why not B? Because B was enveloped, and I'm saying that parvovirus is non-enveloped. So then it can't be B. It is going to be non-enveloped single-stranded DNA. Coming on to the next one. Yes, guys, most of you are saying C. C matlab kya? Option C, C gene. Some of you are saying X. So now let me just tell you, these are all the 4 genes that hepatitis B has. Firstly, hepatitis B virus is what nanometer size? This is a size that they ask you, and it is also referred to as the Dane particle, which I will tell you. The size of it is going to be, yes, 42 nanometers. I hope that is the lag के बाद question का response that I'm getting. Now it is made up of S gene. S क्या होता है? S is surface. Ma'am, it is going to make the surface antigen. Surface antigen का दूसरा नाम is Australia antigen. If I remember, there was one vasculitis in pathology which was caused by surface antigen, and if you remember, that was associated with polyarthritis nodosa. Link questions पढ़ लिया. Now coming to X. X मतलब liver का ही X होने वाला है. Liver का X मतलब the HBX gene is going to cause hepatocellular carcinoma. Liver ही गया X. Now we come to P gene. P is going to make P for polymerase. P gene is going to make DNA polymerase. And then we come to the C gene. Ma'am, obviously it is going to make HBC, which is going to be the core antigen. But along with that, we also have HBE, which is going to be the pre-core antigen. And do you know that for infectivity, the pre-core antigen or the HBE is the marker. They've asked you what is going to tell you about high viral replication, means high infectivity. Who tells you infectivity is told by HBE? So who is going to make it? It is going to be the C gene. Or scene wala chal raha hai, collateral. Very good. I taught you in patho. Great going, guys. Bas same momentum maintain. So C gene is what is going to be making HBE. That is for infectivity. Yahan tak very good. Now we come to solve this. If you can, because these are the questions which scare you. I think this is getting copy pasted twice, but anyway, दोनों जगह same चीज लिखा है. I'll erase this so that you don't have confusion. That's the question and these are the options. Same got printed twice. There's a 28-year-old patient who has presented for follow-up after a hepatitis B infection. Lab results show HBsAg negative. My personal way of solving these questions is first write in your mind, at least make a note. Achha, what is positive, what is negative? HBs negative. HBe is also going to be negative. Anti-HBc is positive, number 1. For IgG, chronic disease, and anti-HBs are also positive. Most of you are writing B because ma'am, the antigens have gone away. The acute disease would have antigens. The antigens have gone away and now the antibodies are present. So most likely this is a patient who's currently in a state of recovery. Very good. Currently in a state of recovery. So what I'll do, I'll now tell you 2 questions, 3 actually. One is from the graph, one is from the table, and one is a previous year INI-CET question. First, let me tell you from the graph, and everything is written, just be with me for 2 minutes. Number 1, if I ask you which is the first marker to rise, same screenshot from rapid revision. The first to rise is going to be the surface antigen. Can I say this is going to tell you the onset of the disease? They ask you, what tells you onset of hepatitis? What is the first thing to rise in the blood? It is going to be the surface antigen. So here, let me trace. Surface antigen rises, surface antigen falls off. Then you you expect if the antigen has gone, then the antibody should come. But I saw that there's a gap. Antigen has fallen here, but the antibody rises after few weeks. What is this gap period known as? This is referred to as the window period, and I am very scared that, if this time in this week patient comes to me giving a blood sample, antigen will come negative, antibody will come negative, I will give him a negative report and say you don't have hepatitis, whereas he has hepatitis B. So I'm very scared to take the blood sample in this window period, and by looking at a patient you can't tell if he's in window period or not. So you will need a marker which will help you in the window period, which I will tell you. So surface antigen and antibody are done. Now I look at HBE, which is telling me infectivity. If you look carefully, surface comes first and right after it HBE is going to come. So right after it rises. So till the time the antigen is there, the patient is very, very infective. When the anti-HBE antibody is going to come, this means the infectivity of the patient is going to go down. So surface antigen wala story mil gaya with antibody. E antigen story mil gaya ma'am with antibody. I have found their antigens and antibody. C antigen I am not finding, because does C antigen come in the blood? No. C is core antigen. Core will remain in the core of the virus. It will never come out in your blood. It's in your body, but it will never come out in the blood. You will only make antibodies against it, and that is why you can see antibodies against HBC. I can see IgM antibody against HBC, and that is what is coming positive in the window period. Finally, I have found a marker for the window period. Marker for the window period is IgM anti-HBC. So let me make you solve some questions. If I say, can you fill in the blanks for me? If I say surface antigen is positive, okay, after that abhi antibody has not come. Then E antigen is positive, antibody has not come. The only antibody that has come is anti-HBC IgM. What will you make that? What will you make that? Acute hepatitis? Okay. Now, I want to learn that in the exam, you will learn two things, and that's a very weird mnemonic but will help you a lot in your paper, and that is SEMA and SEG-C. Okay, SEMA and SEG-C is how you will learn it. Means what? SEMA means if they say surface antigen, like you have made positive over here, then E antigen, like you have made positive over here, and which antibody of HBC, IgM type of HBC which you have made over here, this is going to be a case of acute hepatitis. Can you tell me this is acute hepatitis with low infectivity or high infectivity? Ma'am, jab tak HBE antigen is there, this will be high infectivity. Now let's go on to SEMA done, SEG-C. If the surface antigen is going to be positive like you see over here, HBE antigen is positive like you see over here, IgG type of HBC antibody is present. Now the story has turned into chronic hepatitis. Yeah, this chronic hepatitis again is high infectivity or low infectivity. Till E antigen is present, ma'am, everywhere I will write high infectivity. तो ये भी समझ आ गया. Simple ना? So surface E IgM मतलब acute, surface E IgG, that is going to be chronic. Okay. Now let me look at the third situation. Antigen negative, antigen negative. All antigens have gone. All antibodies are present. Patient is in a state of recovery. Obviously, when the antigens are going to go away and the antibodies will come. No, this is not vaccine. All antibodies being present mean patient is in a state of recovery when only anti-HBs antibody is present, and especially if the titer is equal to more than 10 international units. That you should know for yourself also. If you are an intern, they ask you, have you been vaccinated with hepatitis B? So you will say, okay, I have, but then they say, how will you confirm? I'll say, I'll get my blood test done. Which blood test? I will get an anti-HBs titer done. If that anti-HBs titer antibody levels are above 10, I will say the person has been vaccinated. That is indication of vaccination. This you should know as a healthcare worker also. Coming to the next, like let's assume you got a needle prick injury. After a needle prick injury and you get to know the patient was hepatitis B positive. So first thing you want to know is, do you have antibodies to protect yourself, or will you have to take an antibody injection? So you will get your titer done. If your titer is above 10, this means you are protected. Coming to the last one, if everything is negative but only IgM anti-HBC is positive, ma'am, M was for window period. This is the marker for window period that you have marked over here, which I think is okay. ये सब हमने पढ़ लिया था. We were very good with SEMA, SEG-C, mnemonic, ma'am. We were very good with recovery. Question आया ये, the last thing. Surface antigen negative, E antigen negative, surface antibody negative, E antibody negative. All these antigens and antibodies are coming negative. The only thing positive was total anti-HBC. Total anti-HBC means IgM was also there, IgG was also there. Now what is your diagnosis? Acute hepatitis, chronic hepatitis, recent infection, remote infection. So ma'am, this most likely goes into a remote infection. This most likely goes into a remote infection. Reason being that by now most of the antigen antibody levels have gone away. This total anti-HBC was said to be positive in the exam. When they write total, this means they have done a combination of IgM and IgG. I mean, if IgM alone would have been present in the window period, they would have mentioned it. When they've written total, that means that mostly IgG is a part of that component which is going to remain almost for a very, very long time. Some people even say after many, many years and decades it stays on. So this will just tell you some kind of a remote infection that is going to be seen, which happened many years ago, and that there is no, if someone asks me, kitne saal, to I don't know. There is no criteria for, okay, these many years have crossed and that is when you call as remote infection. There is no criteria for that. I think we are settled with it. Can I go on to the next question over here? Sorry, it's a little bit of a chota font, but I wanted to show you the exact question. A patient comes to the clinic with symptoms of viral infection. Physician says potential viruses are based on the myxovirus family. Which of the family or viruses is not a member of Paramyxoviridae? So ma'am, myxovirus में दो आता है. One is known as orthomyxoviridae, and I think, sorry, I have exceeded. I don't even have the thing to tell you कि अब और कितना exceed होगा, but we are now left with 5 slides. ठीक है, तो orthomyxoviridae and paramyxoviridae. Orthomyxoviridae is going to be what? It is going to be influenza wala, influenza A, B, C and all of that. Paramyxoviridae has, obviously ma'am, if influenza was there, then para-influenza must be in Paramyxoviridae family. ठीक है, apart from that, that is MMR. Can you tell me what is MMR? Measles, mumps, R for? This I'm not answering. Measles हो गया, तो measles is a part of Paramyxoviridae family. Para-influenza is a part of Paramyxoviridae family. Mumps is a part of Paramyxoviridae family. Influenza is not, which is not a member. Influenza, because that is a part of Orthomyxoviridae family. R over here, very good. If you said measles and mumps, you didn't say rubella, I'm very happy. R is respiratory syncytial virus. MMR vaccine पढ़ते हो, but MMR organisms are not in the same family. Rubella comes under which family? Rubella comes under which family, guys? Yes, earlier they used to say this comes under Togaviridae family. Now they say it comes under Matonaviridae family. So recent question will be that it is coming under Matonaviridae family. जब माइक्रो में ना फेवरेट है, जब इनको लगता है कि बहुत टाइम से कुछ नहीं करा तो फैमिली बदल दो, नाम बदल दो, like Penicillium marnefi, no, Talaromyces marnefi. If earlier Togaviridae, no, now Matonaviridae, that kind of things they keep doing. Okay, coming back, so this is going to be respiratory. You've not finished it. One more thing that comes under paramyxovirus is Nipah virus. How can you forget the Nipah virus ka story? Because Nipah virus happens because of which kind of bats? It happens because of fruit bats. So firstly, question number 1 का answer मिल गया, which is not a member of paramyxo. Influenza, because influenza is orthomyxo. Question 2 का answer भी आपको मिल गया, which said that there is a patient having encephalitis and there are fruit bats that are abundant in the area. This also belongs to Paramyxoviridae. What will you mark? Nipah virus. One small little hint, if they give you bat alone, think of Ebola virus, and I will show you these photos abhi. If they tell you fruit bat, then you will think of Nipah virus. This hint I gave students last year and same exam में question आया. Bat वाला life cycle आया तो Ebola. Fruit bat वाला life cycle आया तो that is going to be Nipah virus. By the way, everything about Nipah virus over here. So Nipah virus is going to be using pigs as their amplifier. There are going to be fruit bats which are going to be present in this particular life cycle, and it causes encephalitis. It causes encephalitis, so neurological involvement. But what's scary is the mortality rate, 70%. And Kerala में outbreak हुआ था, if you guys remember, in 2018, and it had a very severe mortality rate. So that is what you have to know. We will talk more about it just in a while. Moving on to the next question. A patient's cell culture exhibits distinct cytopathic changes known as formation of syncytia. Syncytia means a group that is multinucleated giant cells. Based on these, the virus that is most likely responsible for this is going to be, yes, what is it? Okay, some of you said D, SV40. SV40 तो mesothelioma कराता था. I didn't tell you anything like that. Okay, measles virus, because they have talked about a multinucleated giant cells. What is the multinucleated giant cells in measles, which I've taught you in patho in the bonus slides that was there? Warthin-Finkelde giant cell. How do you identify Warthin-Finkelde giant cell? In the nucleus you will see a dot. In the nucleus you will see a dot. There are intranuclear and intracytoplasmic inclusions. Measles में Warthin, देखो, they didn't write Warthin-Finkelde giant cell. They wrote some giant cells. Giant cells are what? All nuclei have grouped together. Syncytia, you will think of the measles virus. So now one more question. There is a 33-year-old lady who is going to who brings a 3-year-old unimmunized child to a child specialist. Baby has been suffering from fever, cough, runny nose and watery eyes for 4 days. There is also a history of rash starting behind the ear pinna a day before coming to the hospital. Measles का infection था. What is the infectivity period? What is the infectivity period? Okay, you are saying 4 days before to 4 days after the appearance of rash. Very good. So jaldi से what you'll do, because like I will teach you measles, mumps and rubella एक साथ, मुझे बस ना सबका पहले incubation period बता दो. If I ask you the incubation period, what is the incubation period of measles? Ma'am, number one, it is going to be 10 days. The incubation period of measles is going to be 10 days. अच्छा, 10 में से mumps के लिए you will make a 19 out of it. So for mumps it is going to be 19 days, and from 19 you will make a 14 out of it. So for rubella it is going to be 14 days. Repeating once again, measles के लिए it is going to be 10 days, then mumps के लिए it is going to be 19 days, and rubella के लिए it is going to be 14. 10, 19, 14 is how you are going to remember it. Now I come to कि अच्छा 10 days के incubation period के बाद the first thing that the patient has is going to be fever and 3 C's. Fever तो होगा, like this बच्चा had cough, coryza, conjunctivitis. So it is going to be cough, coryza and conjunctivitis. Cough हमें पता है क्या होता है. Coryza is what? Coryza is runny nose, conjunctivitis watery eyes. This will happen on which day, ma'am? This will happen on 10th day. Now you add 2 more days in this child's life plus 2 days, मतलब on the, so I'll write this, on the 10th day of the incubation period, मतलब day 1 of symptoms, you will have fever and 3 C's. Plus 2, 12 days पे क्या होगा? Coplic spots. Where do you see coplic spots? They are seen near the molars, on the buccal mucosa. We know that. You add 2 more days, means on the 14th day now we will see a rash. And now what will you see on the rash? Where does the rash begin? Ma'am, it begins from behind the ear pinna and then it is going to go down. Like water will fall on your body, same way water falling mechanism होता है, and from the pinna you can see it is going down on the body. So you can see first is fever and 3 C's, then coplic spots, then the rash. And when is the infectivity period? As was asked over here, 4 days before to 4 days after the appearance of rash is going to be the infectivity period. That is also done. एक और चीज जल्दी जल्दी बता दो, pediatrics का है, because you told me everything about MMR, tell me their vaccine का strains also. अब जब लेट हो ही गए हैं तो अच्छे से हो. So vaccine का strains क्या हुआ है? Measles. Measles, the way you write, you will learn which vaccine strain. Edmonston-Zagreb strain. Edmonston-Zagreb strain is what is used. Then for mumps, ma'am, mumps में we always remember that cute बच्चा who is going to have cute little parotid gland involvement, bilateral. Cute बच्चे का नाम हमने रखा Jerry. So the name of the strain is going to be Jerry-Lynn strain. Very, very good. Then comes rubella. The way you write rubella is R for R. The name of the strain is going to be RA27/3, which is amazing again. ये strains will help you a lot. साथ साथ सबका incubation period लिख लो. It is going to be 10 days, then 19 days and then 14 days. चलो, full chart is made over here. I can move on to the next question. Which enterotoxin is most likely responsible for diarrhea and vomiting in a 6-month-old child experiencing these symptoms? See, a 6-month-old child coming to us with diarrhea. Most common cause of diarrhea in infants is rotavirus. रोटावायरस बना लिया. रोटावायरस का कौन सा वाला टॉक्सिन इज रिस्पॉन्सिबल फॉर इट इज द क्वेश्चन. यू आर सेइंग ए, NSP4. ओके, रोटावायरस एक्चुअली इज व्हाट फैमिली? रोटावायरस इज गोइंग टू बिलोंग टू द रियोविरिडे फैमिली. दिस इज व्हाट यू हैव टू नो. रोटावायरस रियोविरिडे. तो इसमें से दिस इज द स्ट्रक्चर, दे विल से विच प्रोटीन इज कॉजिंग इट. इट इज NSP4. दैट इज द टॉक्सिन विच इज कॉजिंग. आई टोल्ड यू इट्स द मोस्ट कॉमन कॉज ऑफ डायरिया इन चिल्ड्रन. यू नो, तो बच्चों को बचा लो. यू गिव अ वैक्सीन. व्हाट इज द वैक्सीन यू गिव? नो रॉकेट साइंस. Obviously rotavirus का vaccine is Rotatec, Rotarex. ये तो common sense. There's a side effect of vaccine that they ask you in pediatrics and that is intiosusception. Path micro pediatrics में वैसे तो intiosusception in surgery तो is never ending. But two most अभी I'm teaching you ना सिर्फ exam point of view से. क्या अच्छा exam में क्या question आएगा? तो intiosusception polyp के साथ आया तो which polyp causes intiosusception? It is Peutz-Jeghers polyp. अगर किसी vaccine का side effect आया, that is going to be rotavirus का side effect. Okay, not rotavirus infection, rotavirus की vaccine का side effect. ठीक है. Can I move on to the next question? Very important. What is false about Ebola virus? It is a filovirus. It is transmitted by mosquito. Bats act as a reservoir. Nosocomial transmission is seen. False, false statement. False, false वाला statement. Okay, Meckles also lead, but हाँ, इंटरसेप्शन का तो फिर never ending. I just told you जो exam वाला buzzwords है. ओके यू आर सेइंग बी लग रहा है मैम, इट इज ट्रांसमिटेड बाय मस्कीटो. हाँ ठीक है, मुझे भी ऐसा ही लग रहा है. व्हेन आई लुक एट इबोला वायरस, फर्स्टली इबोला का शेप अगर पूछा जाएगा, आई हैव लर्नड इट एज बोल ऑफ स्पगेटी, विच समवन हैड रिटन इन द कमेंट्स आल्सो राइट नाउ, विच इज राइट. इट इज लर्नड, एग्जामिनर विल नॉट राइट बोल ऑफ स्पगेटी, एग्जामिनर विल राइट spaghetti shaped. Okay, so you need to remember, अच्छा bowl of spaghetti is Ebola, belongs to which family? Filoviridae family, which is correct. Remember I told you bat आएगा तो Ebola सोचना, but if they write fruit bat, you would have thought of Nipah virus. Here only bat is there. So primarily I saw that life cycle was in the bat. The primary reservoir is the bat, and then the bat will always come in contact with animals ना, jungle में, caves में. तो animals और bat के बीच का life cycle था. By chance, if there is a transmission that happens to us via what? Very rarely we wouldn't come in contact with a bat, or sometimes we would come in contact with these animals. Whatever may be the situation, if it comes to us, the problem is that this goes from us to us also. There is a human to human transmission seen. So can it act as bat as reservoir? ठीक है ma'am. Is it going to be nosocomial transmission? Yes. What is wrong? It is transmitted by mosquito. That is totally wrong. Now they will ask you some other questions of Ebola virus. If I ask you which of them is going to be the most virulent type of Ebola virus, you will say it is going to be, yes, which is the most virulent. No lunch break. अब क्या break? अब तो 5 minutes में class ही खत्म है. Most virulent is going to be what? It is going to be Zaire Ebola virus. Zaire is zehar. That is how we learnt it. Zaire is zehar. Okay, what about the least? What is the least one that you have to know, ma'am? Reston. Reston is going to be resting है ना, वो तो काम नहीं करता ज़्यादा. But Zaire is like zehar. It is going to be very, very virulent. So if I had to make a drug, I have made a drug nowadays, that is INI-CET. So ma'am, INI-CET we know that MA always stands for MAB, monoclonal antibody. Monoclonal antibody हमें पता है. For EB, for Ebola virus. For which Ebola virus? For Zaire Ebola virus only you will make antibodies, na? You will not make for the resting one. So monoclonal antibody for Zaire Ebola virus के drug का नाम क्या है? It is going to be INI-CET. That is what is the questions that they ask you on Ebola. It is a bowl of spaghetti. Very, very important. Coming to the next question that you will do, match the following. Baby question. Please match the items in the life cycle of Japanese encephalitis. Why I expect a question on Japanese, and by the way, just to let you know, this is the last question and the last slide left. Acha, Ivory Coast also, Dr. Harsha, that you mentioned. Ivory also I've told you is like a color of peace. Ivory is like that peace, white ivory color, color of peace. That also does not cause infection. The dangerous one is only one, and that is going to be the Zaire Ebola virus. Coming back. Okay, so ma'am, accidental host तो हम होते हैं इसके अंदर. Amplifier host are going to be the pigs. Reservoirs are going to be the RD'd birds, and the vector is going to be Culex. Let us see if we have a, yes, we have a life cycle over here. See, we are तो बेचारे accidental host by chance if Japanese encephalitis comes to us. Primarily, there are two cycles, natural cycle and amplification cycle. See, natural cycle, weather amplification cycle, the mosquito that is involved over here is going to be Culex. Okay, it is going to be Culex. Natural means it is bird Culex, bird Culex. Which bird are they talking about? They are talking about the RD'd birds. But if they say amplification, amplifier is going to be a pig. So if it is pig Culex, that is amplification cycle. If it is bird Culex, that is going to be a natural cycle. So that is exactly natural reservoir कौन है? Bird. Amplifier कौन है? Pig. Accidental कौन है? All of us. And vector कौन है? Vector is going to be Culex. So this is okay. But now the question is that what is the vaccine that is given for Japanese encephalitis? That is the question that they are asking you. It is till now SA 14-14-2 कुछ ऐसा पढ़ा था? Yes. That was which kind of a vaccine? That was a live attenuated vaccine. Yes, live attenuated vaccine. But अब कौन सा? Now ma'am, there is a new thing that has come up. There is a killed type of a vaccine which is made from the kolar strain. Okay, killed type of a vaccine made from the kolar strain that comes by the name of the Genvec vaccine, right? So Gen for Japanese encephalitis vaccine. PSM का question, hence I got you. PSM और micro integrate करना होगा तो in PSM they will ask you. So killed वाला kolar is the Genvec आजकल का recommended one. Earlier it was SA का live attenuated vaccine. If they want to integrate, they will integrate it with the life cycle of microbiology, which is done for us. Before I end today's session, one question which I just want to ask you, which I've not got you as a question, because इतनी बार वो question देख लिया that now I feel that you should just know it on your own. And that is, what do you do for the diagnosis of dengue virus? That's the last one. Dengue virus का मुझे सिर्फ you will have to tell me that what antigen testing will you do, what antibody testing will you do, and then you will end the session. ठीक है, then only bonus slides. कौन सा एंटीजन मैम? सिंपल, NS1 एंटीजन. ये क्या क्वेश्चन पूछा? ये थोड़ी पूछ रही थी मैं कितने दिन करोगे. Till what day can you get? Textbook says up till day 18 you can get NS1 antigen positive. कभी सुना है? Practically no. Practically telling you max to max भी push करे तो day 5. Till day 5 you can get the antigen, and thereafter which kind of antibody starts coming? IgM type of antibody starts coming. To test for IgM type of antibody, it is going to be MAC ELISA that you are going to test. This is what is the most confusing part of dengue, which I wanted to tell you for dengue virus, and I think that is settled for you. तो book में कुछ भी लिखा हो, practically telling you 3 होता है यार, but still if I have to go for an MCQ, I'll push to the maximum limit, तो day 5 तक I will say okay, but after that you stop getting the antigen, and now you're going to switch to antibody, that is IgM type of antibody. Now from my side, I'm just letting you know that your flashcards are going to look like what? I've got all the bodies written as one place, all the the different shapes are in one place, all the vaccines and all the drugs I have written at one place. All this work I'm done. I'm scanning through ताकि आपको दिखता रहे. And lastly, what I've done, I have done an entire culture media summary. Means जितना भी culture media I have taught you, not taught you in LRR, but you have it in RR. All those culture media, Wilson Blair वाला story, TCBS media, वो सब कुछ, Campy Bap is there. And that's the thank you from my side. So ये bonus slide already है, you will get it. It's written, everything I've written in my own handwriting, so you don't have to run around किसका आंसर क्या. Finally done. What a relief. Thank you for all the patience. I think this is the lengthiest LRR that I've had, but everyone told me कि मैम एक बार में पढ़ा दो सब कुछ, whatever you think you can. But now I'm done, dusted. I will chill and enjoy. Now the work and onus is on you, because you have to revise this LRR. You have to do the Q bank, but you're not leaving your rapid revision. Especially for students appearing, I mean INI is very close by, but for NEET and FMG students ऐसा नहीं कि अब बस बैठ के जून जुलाई तक हम सिर्फ LRR पढ़े. Your main is still rapid revision, but now you've got a crux out of it कि अच्छा most important क्या है. I always tell students till at least 3 weeks before the exam rapid revision को जब तक पकड़ के रख सकते हो, you have to hold on to it. The day you feel कि यार निकल गया, it has just slipped out of my hands, now I don't have any time, is when you will only come to rapid LRR. But till then, don't do this that now I have LRR PDF, so now to hell with rapid revision. वो नहीं करना, that is gonna be a disaster. You worked hard. I saw your answers, yeah. I heard your answers. I read each one of them. You guys have worked hard and you mugged up rapid revision. Now don't let that effort go waste, because now you have to hang on to it. You have to hold on to it till your respective exam. And the day you feel that now, the time has come that I have 15 days and 19 subjects to do, 20 days and 19 subjects to do, that sort of a situation will arise. Is when you will say, okay, now let's make peace with it and let's let go of RR. Let's switch to LRR. Till that day, jab tak your physically your body allows you, mentally your mind allows you, RR is what you will stick to, not leave it till any time. Okay. Some more questions were there, which in between students were asking. So, I believe that we are going to have more sessions. Abhi the timetable is not there, but this is not the last session that I'm meeting you. So now whenever I meet you next, I have made a list of all the doubts and extra questions you wanted. So I will not repeat LRR again. Jo bhi agla session hoga, I will make sure all the extra questions you wanted, like on Legionella, Ectothrax, Piedra, jo idhar udhar ka lesser important things were there, then now I'm going to include that in the next session. But I'm not going to limit, I won't repeat this again because it's going to be a waste of everyone's time. Crushed ping pong ball appearance is the cyst form, Dr. Nishita, if that's your query. And PDF will be uploaded for on the app also and on my Telegram group as well. Yeah. Okay, so right. I believe, there was so much happening. Acha, Dr. Parul, leiomyosarcoma ka mitosis criteria equal to more than 10 per 10 high power field. That's the cutoff for two things. That's the cutoff, Dr. Parul, for leiomyosarcoma also and for malignant phyllodes also. More than 10 mitosis per 10 high power field. Yeah, so don't worry about quizzes and all. अब आज का दिन थोड़ा rest मतलब take rest from Path Micro. By tomorrow you will get whatever quiz I have to conduct, whatever other things I have planned. By tomorrow morning you will get it on the group. But आज के लिए you just take a relaxation from this Path Micro world. By tomorrow I will give you tension again, so don't worry. Okay, thank you so much, guys. And I'll take leave now. Sorry for eating up all of your lunch time. Go rest a little and then get back to your studies. Thank you so much for all the patience. All the very best.